Okay, good morning everyone. Hello? Naririnig niyo po ba ako, guys? Tayo na naman pala ang magkakasama today. Parang kailan lang tayo nagkita. Anyway, so kamusta po ang mga puso natin after taking your pre-boards 2? Kamusta? Hindi naman siya gano'n masakit i-take, right? Marami po kayong nasagutan compared natin sa PB1. So let me share my screen now. Good morning everyone. Ayan, check ka lang po. Wait lang. May class ba kayo after this one? Feeling ko naman matatapos tayo ng maaga. Yun. Uy, kailan lang tayo nagkita? Okay, how do you feel right now? Yun yung first question ko. Kamusta po kayo knowing na less than 30 days na lang ay magbo-boards na? Na-discuss naman na yung first half nito, right? Because ang assign po sa akin is the second half. Okay na kayo doon? Kinakabahan na po. Yes, that's valid. Yung iba ba ay na-excite? Ini-schedule po yung pagpapanik. Okay lang yan. Time management. How about the others? Kasi ilabas na natin lahat ng mga emotional reactions natin so that we could be able to analyze and discuss this material properly and objectively, because kapag merong associated na emotions with it, especially kapag negative emotions, mahirap mag-aral, right? So, yun, I suggest that before you do your discussions or your studying sessions, ubusin niyo na muna lahat ng emotional reactions niyo para focus na lang tayo all throughout. Again, I am JD Rojas po. I'll be with you from 7 to 1 p.m. Okay, yun po yung official time natin. Hindi na po ako makakapagbigay ng lunch break kasi medyo awkward po yung time slot for us. First morning break natin would be at 8:30 a.m. That's 15 minutes break. Tapos ang next break natin would be, let's say, 11 a.m. Okay? If you have any questions, please feel free to ask me para right then and there maka-clarify po natin. Yung 75% po ba na average is for top-notchers po? I could not really say because what I know is that kung ano yung score no top 1 ay ina-adjust for the other takers. Hindi ko lang sure kung yun pa rin ba yung nag-work ngayon. Yan. Alright, pwede po bang pa-type ako na ready na so I know na nandyan po kayo kasi wala na naman naka-open cam. Padulo na tayo guys. So natapos na tayo. Ayaw niyo makipagkita sa akin? Why? Why? Anyway. Ayan, magpa-face reveal naman. Alright, happy Friday everyone. Let's start with the second half of your pre-boards 2. Walang invitation eh. Pupunta naman ako, pero walang invitation. Number 51. All right. Clients suffering from cardiovascular disorders. 51. Which of the following manifestations would a nurse expect to identify when assessing a patient who has atrial fibrillation? Again, you know the drill when you're with me. Okay, so highlight lang po tayo ng bagay-bagay sa buhay. Okay, atrial fibrillation, of course, that would be letter C, irregular radial pulse. Okay, atrial fibrillation. Along with your irregular radial pulse, ano pa yung pwede nating ma-appreciate sa patients with AFib? Of course, irregular lahat. Irregular yung jugular venous pulsations, irregular even yung S1 heart sounds niyan. And if we're trying to assess the patient, generally speaking, pwede siya magkaroon ng syncope, palpitations, chest pain, shortness of breath, because especially kapag titingnan po natin yung itsura ng atrial fibrillation sa ECG strip, di ba? Ano makikita natin? The atrial rate would be from 300 to 600 beats per minute. Ganun siya kabilis. Okay? Of course, meron tayong ma-appreciate no QRS complex dyan, pero yung P-waves niya is hindi na discernible sa sobrang bilis ng beats niyan. Okay, so in a nutshell, ganun po yung atrial fibrillation. So 51, that's letter C. Okay, number 51, that's letter cat. Again, 51, that's letter C. One more, 51, that's cat. Number 52, a nurse will expect a patient to describe the symptoms of arterial insufficiency in the lower extremities in which of the following ways. Again, let me highlight this one for you, arterial insufficiency. Okay, before you go to the choices, magkakalkalan muna tayo ng nalalaman about this concept that is given to us. When you say arterial insufficiency, kulang, right? Hindi sapat yung oxygen na napupunta sa lower extremities niya. Okay? And with that, kapag meron tayong ischemia or tissue ischemia, of course may pain na nararamdaman si patient. Okay? Dito niyo rin po mababanggit, yes, at maririnig yung term na intermittent claudication. Okay, so yun yung knowledge natin about this. So let's take a look at the choices. That's letter boy. My legs hurt when I walk, but they feel better when I sit down. Okay, 52, that's letter boy. Kapag naman sinabi mong venous insufficiency, baligtarin mo lang. Okay? Yung oxygen, it could reach the lower extremities, pero anong problema niya? Hindi naman siya makabalik. Right? Hindi siya makabalik. Yun yung issue. Kaya ang management natin mainly is to elevate the legs kapag venous insufficiency. So 52, that's boy. Number 53, which of the following nursing interventions is the most appropriate in the care of a patient who has peripheral venous insufficiency? Right? Yun yung kagandahan kapag kahit yung mga kapitbahay na concepts ay iniisip mo na rin kasi pwede siyang itanong sa following question since nasa isang situation ka lang naman. Right? Alam na natin yung sagot dito. That's 53 letter apple, elevating the legs. Okay, to reduce the swelling, of course, and to increase the blood flow or the venous return. 53, that's apple. 53, that's letter apple. One more. Number 53, that's apple po. Number 54, the client who is admitted with thrombophlebitis has an order for heparin. This medication should be administered using what? Okay, so please do not forget your pharmacologic concepts kasi lumalabas po talaga siya as in for real. Lumalabas siya, guys. Hindi ko alam kung kailan at kung ilan ang lalabas at kung ano exactly yung lalabas pero lumalabas siya. Okay? Here, you have to appreciate muna kung ano ba yung ginagawa ng heparin. Siyempre, hindi mo naman po pwedeng napakabilis ibigay yan because basically, lalo naman pong ninipis yung dugo ni patient, increased risk for bleeding naman yan. So with that, you have to be very careful when it comes to the infusion rate of heparin. You need the help of your letter boy infusion controller or the infusion pump. Could be rin. Okay, so 54, that's letter boy. 54, that's letter boy. Kapag medyo na-curious kayo, ano ba yung letter apple, yung buretrol na yan? If you're familiar with the Soluset, okay, yan lang po yan, yung buretrol. Soluset yan. Okay, so 54, that's letter boy. Again, 54, that's boy. One more. Number 54, that's letter boy. Number 55, the physician has ordered nitroglycerin buccal tablets for a client with stable angina. The nurse knows that nitroglycerin affect the heart by another with your pharmacologic question. Nitroglycerin is the focus. That's letter boy, dilating coronary blood vessels. Yan talaga yung pinakatrabaho niya sa buhay, guys. Yung nagdadilate siya ng coronary arteries, ini-improve niya yung collateral blood flow to the ischemic areas within the myocardium or within the heart. So, ano therapeutic effect ng nitroglycerin, especially for patients natin with angina? Madi-decrease natin ngayon yung myocardial oxygen demand niyan. Okay? Mas ma-relax si patient. 55, letter boy. Okay, number 55, that's letter boy. One more, 55, that's letter boy. Naririnig niyo ba ako kahit ganito lang yung volume ng boses ko? Hindi ko pa masyadong nilalakasan. Ayan. Alright. So 55, that's boy. Baka malurlur yung mga natutulog. 56. Client suffering from disturbances in GIT, a patient who has had a total gastrectomy is given instructions on measure to prevent the developing of dumping syndrome. So, when you say total gastrectomy, nagtanggal ka ng stomach, tapos total, so you remove the whole portion of the stomach. And as we know, kapag meron tayong tinatanggal sa parte ng katawan natin, kung ano yung natira, yun lang yung ikakabit natin. So in this case, natira po yung esophagus tsaka yung small intestine ni patient. So yun yung ipagkakabit. Okay? With that, kapag kakain si patient, masyadong mabibigla ngayon si small intestine na para, uy, wait lang, di ako ready. May food content na ako nire-receive. Ang tawag natin doon is your dumping syndrome. Syempre, magre-react yung katawan with that. Okay? And when we say dumping syndrome, with the word syndrome, okay, it is a cluster of symptoms. It is a group of symptoms. And what kind of symptoms are we experiencing for patients with dumping syndrome? Of course, they have GI symptoms like your nausea, vomiting, abdominal bloating, abdominal cramping, and even the pain. Okay, what else? Along with their vasomotor symptoms. So vasomotor symptoms, those are your lightheadedness, dizziness, sweating, or diaphoresis, even tachycardia symptoms. So yun na-feel ng patient mo kapag meron kang dumping syndrome. And in addition to that, meron tayong dalawang uri ng dumping syndrome. That's your early dumping syndrome and your late dumping syndrome. So with the word itself, the early dumping syndrome, it would occur, let's say, at least 30 minutes after the patient eats. Okay, bakit siya nangyayari in the first place? Kasi yun nga po, masyadong nabibigla si small intestine na, uy, may food content agad kasi walang stomach na sumalo, small intestine agad. So anong nangyayari? Magkakaroon ka po dyan ng massive fluid shifting just for the small intestine to digest the food contents properly. Okay, and with that fluid shifting, kaya ka nagkakaroon ng vasomotor symptoms, yung tachycardia, lightheadedness, diaphoresis. Okay? Kapag naman sinabi mo late dumping syndrome, of course, with the word itself, late dumping syndrome, that would occur, let's say, 1 to 3 hours after the patient eats. Ano naman nangyayari? So, ganun pa rin naman yung takbo ng pathophase. Masyado pong mabilis yung food content na dumadating sa small intestine, nabibigla si small intestine, and we know na ito ay merong high carbohydrate content. So, mapo-force ngayon si pancreas na mag-release na masyadong mataas na insulin. As a result, magkakaroon naman ng hypoglycemia effect si patient. Okay, so in a nutshell, ganun yung itsura ng dumping syndrome. Now, what do we know about this dumping syndrome, or with the things that we know about dumping syndrome, which of the following would indicate a correct understanding of the instructions naman na ngayon? Okay, that's letter C. I will avoid concentrated sugar. Yun na yun. Okay, so 56, that's letter C. Ang daming sinabi, di ba? Nakakaloka. Pero ganun dapat kayo sa board exam. Pero times 2. Okay? Kasi 2 hours lang yung allotted sa inyo for a 100-item exam. Okay? Analyze the situation carefully, tsaka mo basahin yung choices para hindi ka maliligaw-ligaw. Okay? So 56, that's letter cat. Yon. Okay, 56, that's letter cat. As we know, kapag mataas kasi yung carbohydrate content and even the sugar content, hypertonic yun. So, mas mataas yung fluid shifting na pwedeng mangyari. 56, that's cat. 56, that's cat. Ako kasi yung tipo ng estudyante na sinasagad ko yung time allotted. Okay, so kung 2 hours ko siyang tinatapos. Okay, 56, that's letter cat. 57, which of the following lab values should a nurse expect to be elevated in a patient who has pancreatitis? Syempre, pancreatitis, we have your pancreatic enzymes. Asan yun dito? That's letter dog, serum amylase. Kapag inflamed yung pancreas mo, mag-i-increase din yung pancreatic enzymes mo as a response to that inflammation. Hanapin mo lang yan dyan. Okay, 57, that's dog. 57, that's letter dog. One more, 57, that's dog. Number 58, which of the following statements, if made by a patient who has had a cholecystectomy, would indicate a correct understanding of dietary instructions? That's letter dog. I can eat whatever I can tolerate. Usually, wala naman ng special dietary instructions after a patient had your cholecystectomy. Pero kasi itong question na to, hindi niya outright binanggit na ito daw ay immediate post-op. Okay? Pero kapag immediate post-op yung question, tapos cholecystectomy, of course, you would encourage the patient to have a low-fat diet. Okay? Low caffeine and sugar diet. Okay, so 58, that's letter dog. 58, that's letter dog. One more, 58, that's dog po. 59, the nurse should expect to prepare a patient who has a bleeding esophageal varices for which of these procedures initially? Okay. So, 'di ba, para masagutan mo 'to, imaginin mo muna anong meron kapag merong esophageal varices at nagbi-bleed na nga, okay? Asaan yung, part or yung site kung saan siya nangyayari? Siyempre ditong area, GI area 'yan, okay? Kapag naka-handle na kayo ng actual patient who has a bleeding esophageal varices, as in para na siyang monster, as in blood everywhere. Hindi ko alam kung nakwento ko na yung kwento na yun, yung experience namin na yun. Kahit sa katawan ko, there's blood everywhere, but sadly, the patient did not survive kasi syempre blood loss, massive blood loss, tapos hypotensive. Hindi na niya nakayanan. Okay? But with that, kapag meron tayong patient na esophageal varices, syempre kailangan natin dyan ng balloon tamponade, okay? Para lang magkaroon ng pressure sa loob to prevent bleeding and hemorrhage, okay? And gusto natin ipa-x-ray si patient so that makikita natin yung proper placement ng balloon tamponade na yun. 59, that's letter dog. 59, that's letter dog. Again, number 59, that's letter dog. Number 60, to which of the following measures should a nurse give priority when caring for a patient who has acute hepatitis B? All right, so let me highlight this one for you, hepatitis B. As we know, kapag communicable diseases, di ba, what makes communicable disease a little bit more special than the other nursing concepts is that napakaliit lang niya na concept in such a way that kapag binigyan ka ng communicable disease, ano lang yung tatakbo sa isip mo? Incubation period, disease transmission, signs and symptoms, management, prevention, ganun lang. Okay, pero masyado kasi marami yung communicable diseases, but on a more specific scale, yun lang yung iisipin mo. Okay? Kapag binigyan ka ng communicable disease, una mong isipin is kung paano ba natin natatransmit ito. Right? So basically, kapag hepatitis B, through your body fluids, but most specifically, bloodborne po siya. Okay? Bloodborne siya. Pero pwede mo rin ito makita sa iba't ibang body secretions mo, such as your semen and vaginal secretions, kaya po considered din to as sexually transmitted infection. Okay? So supposedly, kung ideally, yun yung susundin natin, dapat letter apple sana. Kasi 'di ba, meron din tayong saliva at pwede nating matransmit, okay, ang hepatitis B with your body secretion such as saliva. But according to CDC kasi, napakaliit lang po nung tsansa na matatransfer ang hepatitis B through your saliva. So letter C tayo, promoting your bed rest. Okay? So number 60, that's letter C. Kasi acute hepatitis B. Ito pong letter boy, i-place natin si patient in a private room, let's say kapag transmission, let's say yes, pwedeng contact transmission, airborne, and even droplet transmission, yung disease transmission nung sakit na binigay, eh hindi naman siya ganon, right? So no need to place the patient in a private room. 60, letter C. Again, number 60, that's letter C tayo. One more, 60, that's letter cat. Number 61, client with chest tube thoracostomy. Gusto ko yung pala ganito lang yung situation. No? Tinamad na silang gumawa ng kwento. Ganto-ganto na lang. Statement na lang. The client returned from thoracic surgery 3 hours ago with 2 chest tubes placed at 20 centimeter suction, which findings would be considered abnormal. All right, so let me highlight this one. Tapos, abnormal daw. So, negative sign tayo dito. Ganon. So, that's letter C. No fluctuation in the water seal chamber. Okay, no fluctuation in the water seal chamber. In the first place, para masabi mong normal, okay, ang presence of bubbling, okay, kapag po sinabi natin water seal bottle, sulat ko lang i-recap lang natin. Kapag sinabi mo water seal bottle, para masabi mong normal, dapat makakita ka ng intermittent bubbling. Right? Yan yung normal. Okay? Kasi magfa-fluctuate yan as the patient inhales and exhales. So sana merong intermittent bubbling. Kapag suction control naman, ano klaseng bubbles yung kailangan nating makita para masabi mong normal siya? Yes, very good. Okay, it has to be continuous. Okay, continuous and gentle bubbling. Kasi kapag vigorous bubbling naman yan, hindi rin okay yun. Okay? Kapag naman drainage bottle, ang pinag-uusapan, anong klaseng bubbles yung kailangan nating makita para masabi nating normal siya? Kapag drainage bottle. Or in the first place, dapat ba may bubbles? Yon. Yon. No bubbling. Yan. Very good. So, ito lang yung kailangan mo maintindihan para masagutan mo to ng tama. That's letter C. Okay? No fluctuation in the water seal chamber. Yung abnormal kasi, yung mali daw eh. Eh, kasasabi lang natin dapat may intermittent bubbling. So, 61, that's letter cat. Again, 61, that's letter cat. One more, number 61, that's letter cat. 62, the nurse caring for the client who has just undergone a left pneumonectomy knows that the client should be positioned on. Okay, so pneumonectomy. Iba ang usapan kapag pneumonectomy kasi isang buong lung ni patient yung tinanggal mo. Okay, and with that, masyado malaki yung tissue na tinanggal natin. So we would expect, okay, a massive fluid shifting to happen as a possible complication. And for us to prevent that to happen or for happening, okay, dapat proper position, it would help a lot. That's letter boy, the left side with the head of the bed flat. Okay? Left side with the head of the bed flat. Alright, isa-isahin natin. Kailangan po naka-left side lying siya at naka-supine position so that okay, it would allow the proper ventilation of the remaining lungs, okay, para mag-expand siya properly and for us to prevent the fluids from draining into the sutured bronchial stump. Okay, so kapag sinabi mo stump, yun yung area na tinanggalan mo ng tissue or ng lungs. Okay, so 62, that's letter boy. Dapat head of the bed flat yan. Okay, 62, that's boy. 62, that should be letter boy. Wait lang. Yes. Oo. So kapag left, yung tinanggalan mo, dapat left side din siya so that the remaining lung, it would expand properly. Okay? 63, while assessing the client. Okay. Kailangan head of the bed flat si patient kasi kapag naka-elevate yan, imaginein mo, it would be harder for the patient to expand the lungs, right? Kasi nakaganon siya. So dapat naka-flat lang muna siya. Okay, naka-flat muna siya. Okay, so 62, that's letter boy. Number 63, while assessing the client who has a chest tube, the nurse notes that the tubing is kinked between the bed rails. And as you know, ayaw natin ng mga nakikink na tubings, okay? And the nurse knows that this places the client at risk for letter apple tension pneumothorax because any kinds of kinking or looping or even pressure doon sa drainage tubing, it would produce your back pressure, okay? So it would force the fluid back to the pleural space, kaya ka magkakaroon ng tension pneumothorax. 63, that's letter apple. Okay, 63, that's letter apple. Ay, may mga bagong dating. Nagkamali daw sila nung pasok. So, 63 na po tayo, NP3. Okay, 63 na po tayo, NP3. That's tension pneumothorax. Good morning, guys, sa mga bagong dating po. Anyari? Anyari? Mali ng bigay ng SCED. 64. Okay lang yan, you're safe with me now. Okay, magkakasama na po ulit tayo. Hindi na po tayo ulit magkakahiwa-hiwalay hanggang matapos natin 'tong pre-boards 2. Walang iwanan po. Okay, 64. Gusto mo i-invite din natin si Sir Raymond dito para dito na tayong lahat, 'di ba? 64. A client is in emergency department with a pneumothorax secondary to a gunshot wound. Siya yung taga-demo ko, guys. Di ba gusto niyo yung mga nagde-demo sa buhay? Siya yung ide-demo, pang-demo natin. Ganyan. The client complains of shortness of breath and exhibits tracheal and mediastinal shifts to the left. For what procedure should the nurse prepares? As we know, guys, any kinds of tracheal deviation is not a normal finding. So, we clearly know na merong mali kay patient. Okay? Tapos may pneumothorax din daw siya. So that's letter boy, insertion of a closed chest drainage tube to relieve the pressure on the trachea and the mediastinum. Okay, so 64, that's letter boy. Tanggalin natin yung mga hindi naman dapat nandoon sa loob ng lungs. 64, that's boy. Again, number 64, that's letter boy. One more, 64, that's letter boy. 65. The doctor is preparing to remove chest tubes from the client's left chest. In preparation for the removal, the nurse should instruct the client to. Ito na naman tayo, removal ng mga tubes, right? So, ganun pa rin po tayo. Apply your Valsalva maneuver, that's letter boy. Hold his breath and bear down. Bear down. Okay. Bakit natin to pinapagawa kay patient? So that we would be able to prevent the air from entering the pleural cavity habang tinatanggal natin yung chest tube. Okay, 65, letter boy. Okay, 65, letter boy. Mas okay na kapag papagawin mo to kay patient, sabay kayo. Okay, dapat sabay kayo para tama rin yung, make sure mo na tama yung instructions mo kay patient. Okay, tayo sabay tayo bilang ako. Gaganon ka. Okay, 65, that's letter boy. Sige po, 62. Ano sabi ni Ma'am Udan? Letter C daw. Can I see? Turn slightly. I see. With the head elevated. Okay. Wait lang. So kapag si Ma'am Udan ang nagsabi, siya yung sundin natin. Source to kay Ma'am Udan, sabi daw elevated. Alright, so do you agree here? Change natin yung answer elevated. Wait lang, can I see pa? Alright, okay. I see. Okay, sige. So, I stand corrected, guys. Palitan natin yung 62. Let's make it letter C. Okay. All right. So, wait lang po. 62, that's letter C. 62, that's letter cat. Again, 62, that's cat. The left side with the head of the bed elevated. I'm sorry. Okay. I do not want to confuse you. Let's change our answer here. 62, that's letter cat. Okay. Elevated na po. All right. So, 62, that's cat. 63, that's apple. 64, boy. 65, letter boy. 66, the initial diagnosis of pancreatitis is confirmed if the client's blood shows a significant in elevation of which the following serum values, that's letter apple, amylase. Okay, ganun pa rin. Diba? Isipin niyo lang yung pancreatic enzymes. Mag-elevate yan. 66, that's apple. 66, that's letter apple. 67, which of the following signs and symptoms would the nurse expect to see in a client with acute pancreatitis? That's letter dog, ascites. Okay, 67, that's letter dog, ascites. As we know, guys, itong acute pancreatitis, okay, even yung pancreatic fluids and enzymes niyan, in a more moderate to severe cases of pancreatitis, pwede na siya ngayong mag-leak. Okay, saan siya possibly magli-leak? Pwedeng sa peritoneal cavity, pwede rin siya maka-reach sa pleural spaces natin o kaya sa lungs. Okay, kapag yan nag-leak papuntang peritoneal cavity, magkakaroon ka possibly ng ascites. 67, that's dog. Okay? Para lang mas ma-sure tayo na letter dog talaga yung tamang sagot, isa-isahin natin yung choices. Ang Jarya, guys, Hindi mo siya masyadong makikita sa patients with acute pancreatitis because expectedly, meron silang decreased peristalsis. So it's not supposed to be diarrhea. Okay? Ang jaundice naman, although yes, it can occur but it is not always present. It may not be present. Okay? So hindi rin yan yun. Hypertension, parang baligtad. Dapat hypotension to. Diba? Okay, so 67, that's dog. 67, that's letter dog. One more, 67, that's letter dog. 68, the nurse evaluates the client's most recent laboratory data. Which lab findings would be consistent with a diagnosis of acute pancreatitis, that's letter apple, hyperglycemia. Okay, that's hyperglycemia. Kana lumayo, di ba? Impaired kasi yung excretion ng insulin natin, kaya ka magkakaroon ng letter apple. Letter boy, leukopenia, baligtad. Dapat leukocytosis kasi inflammation of the pancreas, elevated WBC. Thrombocytopenia, kailan lang to magde-develop? Kapag may acute pancreatitis si patient, kapag may DIC na siya as complication. So, hindi pa rin ito. Okay? Hyperkalemia, baligtad pa rin. This should be hypokalemia kasi one of the expected symptoms of your pancreatitis is vomiting. So 68, letter apple. 68, that's apple. One more, 68, that's letter apple. 69, the initial plan for a client with pancreatitis most likely would focus on which of the following as a priority, that's letter apple, resting the GI tract. Okay, taking note of the keyword initial plan kasi. Okay, that is to place the patient on NPO, right? Para mapahinga natin yung GIT, para ma-prevent yung stimulation ng pancreas. Okay, para rin ma-prevent natin yung pain kay patient. Okay, 69, letter apple. Again, guys, dito ko sasabihin na kapag tinignan mo minsan yung mga choices, lahat sila tama. In fact, lahat sila tama. Okay, pero kasi magkakatalo lang sa kung ano ba yung pinaka-priority mo when it comes to the question that is being asked of you. So that is the initial plan. Pinakauna mong gagawin, letter apple. Okay, 69, letter apple. 69, that's letter apple. One more, 69, that's apple po. Number 70, the nurse carefully monitors the client with acute pancreatitis for which of the following complications? That's letter dog, pneumonia. Because as I said before, yung mga pancreatic enzymes ni patient, especially kapag nagpo-progress further na yan, pwede na siya mag-leak kung saan-saan. It could even reach the patient's lungs. Okay? And aside from pneumonia, okay, pwede rin pong ma-associate yung pleural effusion over here. Okay, ano pa? Atelectasis din. Pwede, atelectasis. Okay, so number 70, that's letter dog. Okay, very uncommon yung acute pancreatitis in relation to your cirrhosis. Okay, pero kung gusto mong i-correlate yung pancreatitis tsaka yung liver, pwedeng ascites than cirrhosis. Okay, kaya hindi natin siya pinili. Letter dog tayo. Okay, so 70, that's dog. Number 70, that's letter dog. Again, number 70, that's letter dog. Okay, and kapag magkakaroon tayo ng patient na may pancreatitis at may cirrhosis at the same time, pwede kasing si patient ay meron ding excessive alcohol use, kaya siya nagkaroon ng cirrhosis. It's not primarily because of the pancreatitis. Okay. 71, client with pulmonary tuberculosis. Which client has special risk factors that warrant testing for tuberculosis? Yun na yun. That's letter apple. Uy, hello! Andito kayo. Yung mga pancreatic enzymes ni patient, yes, it could leak. Pancreatic fluids, ganyan. Pwede siya mag-leak. Okay? Sa peritoneal cavity, sa pleural spaces, pwede yan. Okay? Uy, hello! Ngayon lang kita nakita dito. Ayan, sana marami kayo natututunan. So 71, tuberculosis is the highlighted concept. Over here, it's letter apple, 45-year-old Caucasian man who has been homeless for 2 years because one of the major risk factors for our TB patients is yung mga tao na wala namang sapat na healthcare. We know this, right? Sa community, let's say yung mga homeless people, yung mga people who live in crowded spaces, mga ganyan. Okay? So 71, that's letter apple. 71, that's letter apple. Again, 71, that's letter apple. Age-wise naman, sino ba yung commonly affected with tuberculosis? Pwede yung pedia patients natin under 15 years old. Pwede rin namang patients between 15 to 44. So that would be your pedia as well as your young adult patients. Okay, pasok si letter apple. 71, that's apple. 71, that's letter apple. One more, number 71, that's apple. Yung asthma, pwede rin ba magkaroon ng tuberculosis? Well, I could say, kung ang angle na titingnan natin is yung comorbidity niya, pwede yun. Pero kasi ang TB is, we have to remember kung ano ba yung disease transmission yan, airborne kasi yan. Okay, so not really. 71, that's apple. 71, that's letter apple. Number 72, the priority nursing action for a client admitted with a productive cough, weight loss, and a suspected diagnosis of tuberculosis. That's letter apple, instruction of preventing disease transmission. Okay, yun na nga po yun. Kapag binigyan kayo ng communicable disease, i-run through nyo lang yung outline natin before. Like etiologic agent, incubation period, period of communicability, signs and symptoms, management, interventions, ganun lang. Okay, dun lang iikot kapag communicable disease yung tinatanong. Okay, 72, that's apple. Ano pong age ng young adult na risk sa TB? We could say 15 to 44 years old. Okay. 72, that's apple. 73, the nurse concludes that an intradermal TB test result is positive if the following is present. That's letter apple, induration of 10 milliliters or more, 10 mm or more. Sige, isa-isahin natin para mas masaya. Okay, kapag 0 to 4 mm, that's negative. Okay, kapag 5 mm or more, positive na to, sana. Okay, in patients who are immunocompromised, for example, next na lang natin. Okay, with HIV o kaya naman ang patient natin with cancer. Okay, basta immunocompromised patients o kaya naman may exposure sa TB patients. Okay, kapag 10 mm or more, positive naman po ito. Okay, sa mga people in high-risk areas. High-risk areas. Sino ba yung may mga, or yung mga tao na nasa high-risk areas? Let's say, healthcare workers. Okay, yung mga dikit-dikit overcrowded places, such as your prison places. Okay, even yung mga children natin, pwede nating ipasok dito. Okay, 15 mm or more naman. Okay, positive in any normal person. Okay, kaya letter apple kasi 'di ba yung case natin si patient ay homeless. Letter apple, 73 letter apple. 73, that's apple. One more, 73, that's letter apple. 73 apple. 74, client with TB has a prescription for mayambutol or ethambutol. The nurse should tell the client to notify the doctor immediately if he notices, that's letter dog, color, vision changes. So let me highlight the drug for you. Okay, wala kamatayang TB drugs, hanggang dulo mapapag-usapan ata siya. Okay, so kapag ethambutol, syempre, eye complication yan, possibly optic neuritis. Okay, changes in color vision and even your visual acuity, pwede rin. Okay, isa-isahin na natin yung ibang mga TB drugs. Pag sinabi mong rifampicin naman, yung body fluids mo would turn into red-orange. Usually, yung ihi, yung pinaka nakikita natin. Okay, so sulat natin dito urine and other body fluids. Okay, pero pwede rin yung tears niya, yung pawis niya, pwede yan. Okay, kapag naman isoniazid, ang issue, anong pwedeng mangyari kay patient? Hepatotoxic ito, first and foremost. Ano pa? Pwede rin siya magkaroon ng peripheral neuropathy. There you go. Okay? Kapag naman po pyrazinamide naman, hyperuricemia. Okay? Nakakataas daw siya ng uric acid. So, isusulat ko dito, hyperuricemia. Ganon. Ano pa ba? Streptomycin. Okay, kapag streptomycin naman, syempre, this one is nephrotoxic. Okay, nephrotoxic. Ano pa? Hepatotoxic. Hepatotoxic, ototoxic. Nakakabingi. Okay, so yan yung mga yan. Okay. 74, since ethambutol, that's letter dog. 74, that's letter dog. Again, number 74, that's letter dog. 75. The Manti test is used to determine whether a person has been exposed to tuberculosis. If the test is positive, the nurse will find a, letter C, central area of induration. Okay, this one is the past slide. Okay, so 75, that's letter C. Etong letter boy, sharply demarcated erythema. Di ba, expected naman natin yan kapag gumagawa tayo ng intradermal. So, hindi yan yung tamang sagot. Okay, 75, that's cat tayo. It will really happen. 75, that's cat. Again, number 75, that's letter cat. 76, client with benign prostatic hypertrophy. Gusto ko talaga yung tinambag na sila gumawa ng situation. When taking history from patient who has a diagnosis of pyelonephritis, a nurse should expect the patient to report which of the following symptoms. Sobrang flashbulb memory para sa akin yung pyelonephritis because this is the very first case that I've handled when I was a student nurse. Okay. Actually, sa ward 14 talaga kami naka-assign nun. That's the trauma ward. It's just that nagkaroon ng overflow patients sa med-surg ward. Kaya nandun siya. Tapos siya hina-handle ko. But anyway, kapag pumasok sa isip mo na or kapag binigay sa'yo yung word na pyelonephritis, the next word or symptom that should come out in our minds would be letter C, flank pain. Okay, 76, that's cat. That's flank pain. Bakit nagkakaroon ng flank pain? Because anong pathophase ng pyelonephritis, ascending urinary tract infection, it could reach the patient's renal pelvis and even the renal tubules. Okay, so anatomy-wise, okay, the patient could feel pain sa flank area niya. 76, that's cat. Okay, number 76, that's letter cat. Again, number 76, that's cat po. Number 77, which of the following instructions would a nurse include in a discharge plan for a patient who had a transurethral resection of the prostate or the TURP? Suking-suki sa board exam. That's letter apple, limit the intake of caffeinated beverages. Okay, bakit? Ano bang meron sa caffeinated beverages? Okay, but bawal siya sa TURP because that one is a bladder irritant. Okay, kung ano man yung signs and symptoms ng mga pasyente natin na may BPH o underwent TURP, okay, it would make it worse kapag pinainom mo na itong mga caffeinated beverages. Kunwari, urinary frequency and even urgency. Ganyan. So 77, that's apple. 77, that's apple. Baka lang may sumagot sa inyo ng letter dog. Kasi tunog tama eh. Kasi uro issue, so dapat may straining na magaganap. Hindi po. Basta may straining na urine with each voiding. Anong issue natin dito? Dapat may stones. Okay, so this is more on urolithiasis. Okay, ito namang letter C, baliktad. Dapat high fiber so that we could avoid the patient from straining, okay, while he or she is defecating. Okay, so buburahin ko rin to sa paningin natin. Okay, at ito ring letter boy, mali din to kasi dapat po, let's say, for 3 weeks pa, okay, yung decreased activity ni patient to avoid putting pressure on the bladder, okay, and for the patient to recover. Okay, so 77, letter apple talaga yung tamang sagot. Okay, number 77, that's apple. 77, that's letter apple. One more, 77, that's apple. 78, a patient who comes to the physician's office is suspected of having hypertrophy of the prostate. The nurse should expect that he will probably have which of the following symptoms? That's letter apple, residual urine of more than 60 cc. Okay, expected natin yan. Okay, 78, it's letter apple. Yung pinaka-nature ng BPH natin as a case, basically, ito yung prostate ni patient, lumaki siya. okay, nag-hypertrophy siya, andito yung bladder sa taas. So, technically, hindi naman yung buong bladder yung issue natin. Okay? Yung neck lang ng bladder yung na-obstruct ng prostate. Okay? So, kapag obstructed yung neck ng bladder ni patient, okay, pwede siya magkaroon ng residual urine kasi if the patient tries to urinate, hindi niya malalabas lahat yan. Okay, and aside from this symptom, pwede pa niyang ma-feel yung frequency, urgency, dribbling of the urine, interrupted din yung urine stream niya, yung mga ganong issue. Okay, BPH yan. And even nocturia, pwede. Okay, so 78, that's letter apple. 78, that's letter apple. One more, number 78, that's apple. Ano po ang normal urine output standard? That's 30 cc per hour. Okay, that's 30 cc per hour. For the adults, number 79, which of the following findings, if identified in a patient who is being treated for benign prostatic hypertrophy, would indicate that the treatment is having the desired effect? Okay, that's letter dog, decreased urinary dribbling. Okay, syempre, kapag nare-reach natin yung desired effect, expected mo na hindi niya na ma-feel yung chief complaints niya to begin with or yung symptoms na na-feel niya. Okay? So 79, that's letter dog. It's not really about the issue on the amount of residual urine. It's about the fact na meron siyang residual urine per se. Okay? Kaya letter apple yung sagot natin. Okay? Kasi ang gusto niyang iparating sa'yo is that hindi niya naubos yung laman ng bladder niya. So may natitira. Ganun ka ba umihi? May natitira. Okay, so 79, that's dog. Number 80, after your TURP, the nurse must carefully observe for which life-threatening post-op complication, that's letter dog, hemorrhage and shock. Okay, 80, letter dog. Diba? Watch out for bleeding. What more kapag nag-hemorrhage yan? 80, that's dog. Again, number 80, that's letter dog. One more, 80, that's letter dog. Number 81, client with chronic obstructive pulmonary disease, COPD, client with history of asthma. History of asthma presents in the physician's office with complaints of difficulty breathing. While performing the initial assessment, the nurse become concerned with the client's respiratory status has worsened based on which of the following? Okay. Highlight mo muna si patient ay may asthma. Okay, tapos nahihirapan na siya ngayon huminga. Okay, saan ka na-confused dito? Okay, kung hindi letter boy yung sinagot mo, anong sagot mo? Okay, kasi lahat ng options may wheezing. Tapos hindi naman tayo pumili doon. In fact, letter boy yung sinagot natin, noticeably diminished breath sounds because, okay, kapag nag-wheeze si patient, we know na meron pa rin kahit konting air na pumapasok. So kapag meron na pong worsened respiratory status ang isang pasyenteng may asthma, we could say na totally obstructed na siya. Letter boy ang sinagot natin dito. So 81, it's letter boy. Okay. 81, that's letter boy. Again, number 81, that's boy po. Number 82, the nurse has just received orders to provide chest physiotherapy for a client 2 times per day. The nurse evaluates which schedule to be most therapeutic. Ay, yung ganitong konsepto kay Cosern Herb po natin to mababasa. Fundamentals po ito. Okay? Ang chest physiotherapy recommended standard schedule niyan is every morning as the patient wakes up, okay, so that yung accumulated secretions niya nung tulog siya ay matatanggal natin. Okay? Tapos before bedtime, okay, para saan yung before bedtime? Para po kapag matutulog si patient ay may ginhawa naman siya, may comfort. Okay, in addition to that, dapat po ay before meals, pino-perform itong chest physiotherapy so that hindi naman siya masusuka-suka kapag ginaganon-ganon natin yung likod niya. Okay, so asan dyan yung pinaka-ideal scheduling? That's letter boy, 6 a.m. and 4 p.m. Okay, 6 a.m. and 4 p.m. is the most ideal. Pakipalitan na lang po sa G-form ha, if nagkamali po. Okay, kasi kapag sinakto nating 8 a.m., we could say na breakfast time niya yon. So dapat before meals. Upon waking up, son. Upon waking up. So 82, that's boy. Okay. 82, that's letter boy. One more. 82, that's letter boy. Number 83, the nurse assesses a college-aged client complaining of shortness of breath after jogging and tightness in his chest. Upon further questioning, the client denies a sore throat, fever, or productive cough. Okay, so here, dininay niya na wala daw siya na-feel na ganito. So definitely, it's not about the infection or inflammation. The nurse notifies the physician that this client's clinical manifestations are most likely to. Okay, tapos sino ba yung patient natin in the first place? College student na nagjo-jogging. Okay, sa oval nila. Suddenly develops tightness in his chest. And alam mo na meron tayong konsepto na exercise-induced asthma. Asan dyan yun? That's letter dog. So 83, that's letter dog. Asthma. Okay, so 83, that's letter dog. Ano po yung pneumoconiosis? Ito po yung isang halimbawa ng occupational related diseases natin. Yung kapag nakaka-inhale sila ng mga industrial dusts, okay, nagkakaroon sila niyan. 83, that's letter dog, asthma. 83, that's letter dog, one more. 83, that's letter dog. Number 84, client with late-stage emphysema becomes confused and is experiencing tremors. The nurse interprets that these symptoms are indicative of which complication of emphysema. Now, kapag tinatanong naman sa atin is about the complications of any cases, okay? And alam natin na affected na dyan yung iba't ibang systemic organs natin, okay? Depend natin sa symptoms na binigay para mas specify natin anong organ system yung pinaka-tinutukoy niyan. Okay, confused, experiencing tremor, so that must be neurological affectation in relation to your respiratory distress. Okay, that must be letter boy, carbon dioxide narcosis. Okay, carbon dioxide narcosis, and i-highlight ko rin po ito, late stage emphysema. As we know, kapag ang pasyente natin is late stage na, ilang percent na lung po ba ng lung function yung gumagana? We could say, let's say, 30% left na lang yung lung function yan. So ibig sabihin, sobrang severe na, sobrang impaired na yung gas exchange niya to the point that it could affect the patient's level of consciousness. So yun po yung carbon dioxide narcosis. Okay, so 84, letter boy. 84, that's letter boy. Napakataas na ng CO2. Okay, nalulurlur na si patient. Okay, nadi-decrease na yung consciousness niyan. 84, that's boy. 84, that's letter boy. 85, a nurse is caring for a client with COPD who is receiving aminophylline or theophylline IV. A theophylline blood serum level is drawn on the client, and the nurse monitors the result and expects the findings to be at which therapeutic level. Classic pharma question. That's letter C, 18 micrograms per ml. Expected findings na therapeutic. Okay, so kasi ang therapeutic level talaga niyan would be at 10 to 20 micrograms per ml. Sa kanya 18, so pasok pa yan. 85, that's cat. 85, that's letter cat. One more, number 85, that's letter cat. Number 86, anong question number yon, ma'am? Okay, number 86, client with peptic ulcer disease. Which nursing action will be most effective in treating peptic ulcer disease? Uy, tumawid na tayo, GI na tayo. That's letter boy, giving antibiotics and HCl secretion inhibitors daily as ordered for 1 week. Because ito pong peptic ulcer disease, one of the causative factors of that would be your gram-negative, anong bacteria yon? H. pylori. Okay. H. pylori. Okay. So dahil meron siyang infection present, iti-treat natin yan with antibiotics. At dahil meron siyang ulcer per se, iti-treat natin yan with HCl secretion inhibitors daily. Okay. For example, your proton pump inhibitors, like which medication? Ano mga examples ng PPIs natin? Can you give me one? Yun na yun. Okay, lahat ng may mga prazole, omeprazole, lansoprazole, pantoprazole, mga ganyan. Okay, very good. So 86, that's letter boy. Okay, number 86, that's letter boy. One more, number 86 po, that's letter boy. Number 87, the nurse tells a client who is post-op after a gastrectomy that dumping syndrome is a significant problem for, that's letter boy, 20 to 50% of clients having gastrectomies. Okay. I hate to break it to you guys, pero this one is a perfect example of your either you know it or you don't type of question. Very, very objective type of question. And wala naman po tayong ibang panlaban dyan, kundi ang magbasa ng maraming reference. Okay, have to read a lot. Okay, ako naniniwala ako na kahit isang beses mo lang siyang dinaanan, okay, mag-a-appear pa rin siya sa mind mo if you try to retrieve it as long as active reading yung ginagawa mo. Okay, as long as active reading. Okay, may ganyan po ba sa boards? May ganitong tanungan sa boards talaga na either you know it or you don't. It's like, it's expecting you to fail. Parang ganon. Okay, pero syempre, may magagawa pa rin naman tayo dyan. Pwedeng through your context clues or pwedeng to read a lot lang. Magbasa ka para sure na sana madaanan natin. Okay? Hindi naman mas marami ka pa rin namang masasagutan dyan. At hindi ko po masabi kung ilan exactly yung mga ganitong klaseng tanong. Okay? Pero i-prepare nyo na lang po yung mga sarili ninyo. Okay? So 87, that's letter boy. Number 88, the nurse will usually ambulate a client post-gastrectomy beginning, that's letter apple, the day after surgery. So syempre, yung mga post-op clients natin in general, sana pinapa-ambulate natin for as soon as possible for us to prevent those post-op complications, most especially yung pneumonia na complication, pati yung mga mobility issues and even integumentary issues. Okay? Ito pong letter dog muna tayo. Itong letter dog, immediately after awakening from anesthesia, alam nating very, very wrong to. Kasi medyo groggy pa siya from the sedatives na binigay natin. So risk for injury siya dyan. Okay? After 3 to 4 days of the surgery, pwede na natin tong ipagawa kay patient. Pwede na natin siyang ipa-ambulate independently. Independently. So, ibig sabihin, ito pong letter apple na the day after surgery, kapag ipapa-ambulate natin yan, dapat ay with support pa rin or with assistance. Okay? So, number 88, that's letter apple, the day after surgery with support. Number 88, that's letter apple. Again, number 88, it's letter apple. Number 89, which would the nurse expect to see with the dumping syndrome? That's letter dog, diaphoresis. Buti na lang, napag-usapan na natin siya kanina para hanapin na lang natin dito. Okay, so 89, it's letter dog. 89, it's letter dog. Okay, number 90, a client is admitted with a diagnosis of duodenal ulcer. During the intake history, the nurse would expect the client to report. Okay, so highlight muna natin to, duodenal ulcer. Kasi magkakalituhan yan kapag tinapat mo na yung gastric ulcer. So mabuti ng malino na duodenal ulcer yung tinatanong. That's letter apple, epigastric pain that is relieved by eating. As we know, kapag ang pasyente mo merong duodenal ulcer, syempre merong hypersecretion ng gastric acid natin. And of course, mas malala yung pain. Mas worse yung pain kapag walang laman yung tiyan niyan. Okay, so to relieve the pain, ang tendency ni patient is kakain na lang siya ng kakain. That's your letter apple. Okay, 90, that's apple. Okay, number 90, that's letter apple. 90, that's letter apple po. Number 91, when admitting nurse performs thoracic assessment on the client, which of the following will she expect on inspection? Okay, again, which of the following will she expect in inspection? Okay, tapos binasa mo yung choices. Parang lahat naman yan mali. Parang lahat naman yan hindi expected. Pero hinighlight natin yung keyword inspection kasi yung ginagawa ni nurse. Ano ba yung mga ini-inspect natin kapag chest assessment? Syempre yung symmetry ng chest movement, ano pa, yung presence ng masses or nodules, mga ganyan. Okay, so number 91, that's letter boy. Okay, number 91, that's letter boy. 91, that's letter boy. Number 92, the physician performed thoracostomy at the bedside. Pneumothorax was identified on the left side of the thoracic cavity. What position will the client assume during the insertion of the chest tube? Ito na naman tayo, positioning. Pero tama na tayo dito this time. Letter C, supine with head elevated and left arm raised above the head. Okay, medyo marami kasi siyang pinapaghalo-halong concept dito eh. Okay, baka maligaw yung iba sa atin. So isa-isahin natin. Okay, may pneumothorax daw si patient na nasa left side. Okay, tapos i-highlight natin yung actual na question. What position daw? The best answer is letter C. Okay, kailangan po nakasupine yan so that for easier and more accurate insertion of the chest tube. Saan ba natin ipapasok? Ay, hindi pala tayo, hindi tayo mga nurses yung maggagawa nito, assist lang tayo. So saan ipapasok ng mga doktor yung chest tube na yan? Sa apical area po ng lungs, banda medyo sa taas yan. Okay, so for ease of insertion, dapat nakasupine si patient, dapat po naka-elevate yung head of bed niyan so that yung air na dapat or yung gusto nating lumabas na hangin ay pupunta po siya sa apical area ng pleura. Okay? And dapat din naka-left arm raised above the head si patient para mas ma-expose natin yung affected side. So 92, letter C. Supine with head elevated and left arm raised above the head. Nagets niyo ba yun, guys? Nagets niyo ba yun? 92, that's cat. Okay, yeah. So 92, that's letter cat. 93, to ensure that intrathoracic pressure is maintained, the nurses observe that while the thoracostomy tube is being inserted, it is connected to the closed chest drainage system. Okay, number 93, that's letter dog. If you are familiar with the itsura of the PlureEvac, okay, hindi na kasi masyado uso yung 3-way bottle na hiwa-hiwalay. Okay, medyo gumagamit na tayo ng PlureEvac. Yun po yung example ng closed chest drainage system. And as the doctor inserts the tube, dapat nakadiretso na yun sa drainage system na yun. So that wala pong papasok na atmospheric air, okay, into the lungs of the patient, and to allow immediate drainage. Okay, kung ano yung gusto nating ilabas doon sa lungs, agad-agad siyang matatanggal. Okay, ito kasing letter apple, kapag linamp mo siya, pwede naman, but maximum lang na 15 seconds. Okay, and although clamping could prevent the entry of your air to the chest, hindi naman niya mailalabas agad yung mga gusto nating ilabas from the chest or from the lungs. Okay, so letter dog pa rin yung tamang sagot. 93, that's letter dog. Okay, number 93, that's letter dog. Okay, number 93, that's letter dog. Okay, recap lang. Kapag po na-dislodge siya sa patient, anong gagawin natin? Okay, yung sumagot niyan, funda concept. Iba ang dislodgement tsaka yung disconnection. Yon. You have to have your occlusive dressing, dry sterile dressing. Okay, very good. Kapag naman po na-disconnect, okay, yung tube, ano naman pong gagawin? Okay, very good. Submerge mo muna sa sterile water. Okay, as you are preparing pa. Okay? Di ba yun yung parang first instinct natin kapag na-disconnect, submerge mo siya agad sa NSS para walang papasok na air. Okay, so 93, that's letter dog. Very, very, very good. Confident na ako sa inyo sa funda concepts. Okay? 93, that's letter dog. Occlusive dressing po kapag na-dislodge, ha? Occlusive dressing. In 94, 4 hours post-thoracostomy, the nurse checked on the water seal drainage system. She observed periodic air bubbles in the water seal chamber. She will interpret this observation to signify, okay, letter boy, that air trapped in the thoracic cavity is being removed. Habang binabasa mo yung question, dapat sinasagutan mo na siya kung ito ba ay abnormal or normal. Para alam mo na rin sa choices kung hahanapin mo ay normal or abnormal din ba. Okay, obviously, itong periodic air bubbles in the water-sealed chamber, okay, i-highlight natin Yan yung intermittent bubbling. This one is normal. So that, ang hahanapin mo sa choice is normal din sana. Okay, so 94, letter boy. Okay, 94, that's letter boy. Alam nyo ba, kakabasa ko lang ng mga articles about this one. Yung kung ang gagamitin ba is dressing na dry, sterile, or yung moist na Vaseline. Meron akong isang nabasa na clinical trial, wala naman daw masyadong difference. Pero ang nire-recommend nila is the dry sterile kasi kapag moist yung ginagamit natin, it allows the microorganisms to stay and thrive there. Pero generally speaking, kapag sa practice, wala naman daw siyang masyadong difference. Sabi daw sa Brunner din daw, ang recommended is the dry sterile dressing. Okay? Ayan. Feeling ko ang pinakakailangan ninyong tandaan is dapat occlusive dressing siya. Ma-make sure lang na wala masyadong lalabas or wala talagang hangin na lalabas. Okay, so 94, that's letter boy. Okay, 94, that's letter boy. One more, number 94, that's letter boy. Number 95. Before the end of the shift, the nurse made her rounds to get the total intake and output of the client. She noticed that the drainage was greater than 70 ml. The nurse's priority action would be to. Ayan na naman tayo. Okay, so aalamin muna natin kung normal ba to or hindi. Okay, tapos babalikan muna natin ano bang meron kay patient. Kasi doon magdedepend yung sagot natin. Right? Meron daw siyang pneumothorax. Okay, so ibalik lang natin. Kapag medyo lumalayo na kayo sa situation, isulat mo lang sa questionnaire yung case ni patient para di ka na pabalik-balik. That's pneumothorax. Okay? Ang pneumothorax, that's air, right? It's not supposed to have any drainage. Pero sa kanya kasi is 70 ml. But still, hindi naman siya cause of alarm, right? You still have to document and hand off to the incoming shift for further observation. 95 letter apple. Okay? Ang 70 ml within the whole 8-hour shift is not alarming enough. So continue monitoring. Okay, 95 letter apple. Okay, 95 letter apple. Ano po yung dapat may mga drainage? Let's say pleural effusion. Ano pa? Empyema, yung mga ganyan. Yung may mga pus, yung mga fluid, yung mga ganon. Okay, pero kasi sa kanya pneumo, so that's air. Okay, so 95, that's apple. Okay, dapat less than 100 ml per hour. Okay, dapat less than 100 ml per hour. That's the standard. Okay. Number 96, client with acute episodes of cholecystitis, Nurse Feli did her admission assessment. She understands that the pain is characterized as letter dog, tenderness and rigidity of the upper right abdomen radiating to mid-sternal area. Please do not forget your anatomy and physiology. Okay, so 96, letter dog. We know this, right? 96, that's dog. Number 96, that's letter dog. One more, 96 is letter dog. Number 97, to confirm the diagnosis of cholecystitis, the attending physician ordered the procedure that can detect gallstone as small as 1 to 2 cm and inflammation. Nurse Feli would prepare the client for which specific procedure? Uy, okay, that's letter dog, ultrasonography, ultrasound tayo dyan. Okay, because among all the other choices, ito pong ultrasound natin is the most non-invasive. Okay, siya po yung pinakamura, inexpensive test. Okay, and sensitive din naman siya and mataas din naman po yung specificity rate niyan. Okay, unlike kasi kapag yung letter apple, boy, and cat, syempre lahat yan gagamitan natin ng contrast medium or contrast dye. Okay, as opposed to ultrasound, right? So 97, that's dog. 97, that's letter dog. One more, 97, that's letter dog. Feeling ko, kung 407 tayo dito, at least one of us has experienced having this cholecystitis. Okay, so nakaka-relate sila dito. 97, that's log. 98, the diagnosis was confirmed as cholecystitis with gallstone. The doctor prepared client for removal of his gallbladder. Okay, the client asks the nurse, how will this affect my digestion? The most correct response would be, I am very much aware na repeated daw po itong lumalabas sa recalls, tas iba-iba yung sagot. But we talk, okay, yung mga other lecturers, and sabi nila na pagkasunduan, letter apple po yung final answer. Okay, the removal of the gallbladder usually interferes with digestion but can be for dietary modification. Yan na daw po yung final answer. At sabihin kung yan na daw po yung final answer. Okay, so para wala na confusion, 98, that's apple. Okay, so number 98, that's letter apple. Again, number 98 po, that's letter apple. Number 99, reviewing the lab finding of the client, the nurse found which findings are elevated. Again, anong meron siya? Cholecystitis. So isusulat mo lang dito, cholecystitis. Yan. Number 1, of course, WBC count is elevated kasi may inflammation ka in the first place. Highlight mo yan. Total serum bilirubin. Yes, kasi meron kang obstruction ng bile flow dyan. So it could be elevated. Number 3, alkaline phosphate. Alkaline phosphate, of course, syempre, elevated din yan because there could be a blockage sa bile ducts. Okay, related yan sa cholecystitis natin. However, RBC count, cholesterol, serum amylase, not really. Okay, hindi siya masyadong ina-associate sa chole. So, buburahin mo yan. Again, kung ano lang po yung hinighlight, yun lang yung tamang sagot. 1, 2, and 3, mas kita na natin ngayon. That's letter boy. 1, 2, and 3. Okay, so 99, that's letter boy. Okay, number 99, that's letter boy. Number 100, a T-tube was inserted and the doctor ordered to monitor the amount, color, consistency, and odor of the drainage. Which of the following procedures can the nurse perform without the doctor's order? That's letter dog, emptying the drainage. Paano mo ito magagawa kung hindi mo i-empty yung drainage? Independent nursing intervention naman yan. 100, that's letter dog. Okay, number 100, that's letter dog. Ano po yung elevated sa ALT? Ay, ano daw po yung may block? Tama ba? May blockage po sa bile duct ni patient. Bile duct blockage. Okay, any more questions? Yes, of course. Okay, mag-break tayo. So that's 15 minutes break. Okay, balik na lang po tayo by 8:40. Okay, by 8:40. Thank you guys. Please enjoy your morning break. Okay. Medyo contradicting yung 98 and 58. Okay. Ang 98 kasi, si patient ay pre-op, right? Preparing for the removal of the gallbladder. So, in-assume natin dito na pre-op si patient, immediate post-op, ano yung concern niya? Okay, yun yung concern niya about the immediate post-op, yung diet after. Okay, pero yung question number 58, yun yung sagot natin. Ibalik lang natin. This one, I can eat whatever I can tolerate because here, walang sinabi, okay, na time frame specifically. Okay, kaya letter dog yung sinagot natin. In general tayo. Usually, there's no special dietary instructions. Okay, so 58, letter dog. Parang hindi siya specifically stated na immediate post-op siya. Kaya nag-general answer tayo. 58, letter dog yung sinagot natin. Okay. Yes. Wait lang, ibalik natin. In time, let's say 4 to 6 weeks after your surgery, the patient could eat whatever he can tolerate because yung medyo technical term ito, pero yung ampulla of Vater natin doon sa may gallbladder would function effectively na after. Makaka-recover na kasi yung part na yon. Okay, makaka-accommodate na ulit ng appropriate volume ng bile, yung biliary ducts natin. So, whatever he or she can tolerate is pwede na. Pero kapag post-op, medyo may interference muna sa ibang klaseng foods like the fat and greasy foods. Ganun. $8.40. Okay, $8.40 tayo babalik. Okay. So you wanted to answer letter boy. Pero kasi in comparison to letter dog, siya yung mas encompassing, mas specific na sagot. Okay. So priority answer natin yung letter dog, yung mas kompleto. Okay, so 96 dog tayo. 'Di ba? Mas kumpletong piliin yung letter dog kaysa sa letter boy na parang biten. Eh, umaya ka na ulit. Alright, so balikan ko lang po. Number 62, that's NP3. Pinalitan natin yung answer to letter C. That's the left side with the head of the bed elevated. Still have to remember na kapag pneumonectomy po, we have to lie the patient on the affected side. And kapag lobectomy naman yung ginawa sa kanya, lie on the unaffected side. But still head of the bed elevated to promote for maximal expansion of the lungs. Okay? Tapos, sa number 78, here naman, residual urine kapag sa adults, okay, para masabi mong normal ang post-void residual urine natin, that would be less than 50 cc. Okay? Kapag naman po elderly patient natin, ang post-void residual urine yan must be from greater than 100. Okay. Ayan. So kapag pneumonectomy po, dapat ang position ni patient is to lie on the affected side. Kapag lobectomy yung ginawa sa kanya, you have to lie the patient on the unaffected side. Okay, sa kanya kasi 60, so mataas. All right, so if you don't have any more, yes, less than 50 dapat is normal. Yes, sa elderly, 50 to 100, normal pa yun sa kanila. Pag 100 cc yung sa elderly, normal pa yan. Maininom akong capsule, guys. Ayaw niya bumaba. Andito pa rin siya sa chest ko. Nafe-feel ko. Yes, correct. Correct po. Okay. May nagpapatanong, pwede pong pasilip nung 46 to 50. Tapos naalala ko, 51 pala ako nag-start. Naka-order na ba ako ng McDo? Nakita niyo yun? Nakalimutan ko yung password eh. Nakakaloka. Anyway, NP4 ratio. NP4 ratio. So, this is very, very research heavy. So, sana mag-enjoy po kayo sa NP4 kasi fun ang research, guys. Okay? So, number 1, May Cruz is a nurse researcher in the Research and Development Center of the hospital. She's assigned to conduct a research on the levels of competence of staff nurses. She is given 12 months to conduct the study. Okay, so ngayon pa lang, i-highlight mo na yung study nung bida. Okay, tapos meron kasing binanggit na duration of the study, so it speaks a lot. Baka itanong sa atin yan mamaya, so i-highlight mo na rin. Okay. Number 1, she prepares her proposal. Which design will she opt to use if she decides to assess the competence of the staff nurses upon appointment to the job until retirement? Again, kapag may time duration na binabanggit, edi i-limit mo na yung answer mo to longitudinal or cross-sectional. And as we know, from appointment until retirement, medyo matagal yan, long duration yan. So that must be letter boy, longitudinal. Okay. Ito pong letter boy at letter cat, these are both your data collection methods. Okay. And ito, pag longitudinal, you are collecting data over a period of time. So isusulat ko lang po dito, over a period of time. Okay? Kapag nakita niyo po yung words na retrospective approach or prospective approach, it's not basically the data collection method per se, but it is the approach. Okay? Magkaiba yung data collection method and the approach. So kapag naman longitudinal, ang corresponding approach niyan would be your prospective approach. And when we say prospective, okay, from the present, titingnan po natin or susundan natin yung patients natin up until the future. Okay? Pero kapag sinabi mo namang cross-sectional, one point in time lang yan. Okay, one point in time. So kapag sinabi mo namang data collecting method at one point in time, uupuan mo lang si pasyente, magchichikahan lang kayo together. Let's say, days to a few weeks tapos na yung data collection method mo. Okay, anong klaseng approach naman po kapag cross-sectional? That would be your retrospective approach. Okay, sabi natin cross-sectional, magchichikahan lang kayo. Okay, so that must be your history-taking method. Okay, eh hindi naman na tayo makakabalik sa past. Okay, so titingin lang tayo sa past through your history-taking method. So that must be from the present to the past. So yun yung pinagkaiba ng longitudinal tsaka ng cross-sectional. Okay, so number 1, that's boy. Number 1, that's letter boy. Again, number 1, that's letter boy. May range of time po ba para ma-consider mo longitudinal? Kasi kung sa cross-sectional, that would be from days to weeks. Kapag longitudinal naman, months to years yan. Ganun siya katagal. Months to years. Okay, so number 1, that's boy. Number 2, she realizes that she cannot randomize her subjects due to the nature of the work setting. What research design is selected when randomization is not possible? Ang retro po, that's her cross-sectional, days to weeks lang. History taking kasi yun mainly. Okay? Ito naman, outright nang binanggit sa'yo, randomization is not possible. So that must be letter C, quasi-experimental. And i-recap ko lang ng mabilis lang, kapag nasa mundo po tayo ng experimental research design, okay, automatic meron kang element of manipulation. Di ba tatlong elements yon or criteria? So that's your manipulation. Kapag sabi mong manipulation, kahit anong binigay mo, automatic manipulation yan, intervention or bagong method. Okay, next one is the element of your randomization. Another one is the element of your control. Okay, may tatlo pong magkakapatid kapag nasa mundo tayo ng experimental research design. The first one is what you call your true experimental. Okay, kapag true experimental, yung buong tatlong criteria na to, nandyan, present lahat. Yan. Okay, and with that, ito rin po yung sinasabi natin na strongest design kasi present lahat ng criteria mo Okay, next one is what you call your quasi-experimental. Now, kapag nakita mo yung word na quasi, anong ibig sabihin nun? Half-true na lang siya. Okay, at bakit siya naging half-true na lang? Kasi nagtanggal ka po ng isang element dito sa tatlong yan. Okay, yun yung technical definition yan. Okay, either randomization. Hindi mo po pwedeng tanggalin yung manipulation kasi kapag tinanggal mo yung manipulation, hindi na siya experimental, non-experimental na siya. So pipili ka lang, either randomization or control yung tinanggal mo. Okay? And kapag po sa board exam kasi, usually, yung randomization yung tinatanggal nila, just like in this question. Okay? Kaya letter C yung sagot natin. Okay? At yung pangatlong kapatid niyan is what you call your pre-experimental. Wherein, tinanggal mo na po both randomization pati yung control na wala. Okay? Kung yung true experimental, siya yung strongest design, ang pre-experimental naman would now be your weakest design. Okay? So, balikan lang natin number 2, that's letter cat. Diyan ka lang iikot kapag experimental research ang pinag-uusapan. So, number 2, that's cat. Ano po yung control group? Kung mapapansin ninyo, di ba, meron tayong experimental group tsaka control group. Ang purpose po nila is for the basis of comparison. Because as we know, the more basis of comparison that we have, the stronger your design would be. Okay? Wala to, burahin mo to. Okay, so number 2, that's cat. It's not a research design, yung prescriptive. Okay, so number 2, that's letter cat. One more, number 2, that's cat. Number 3, she plans to implement a new competency-based training design and later evaluate the competency levels of those who underwent and do not underwent the program. Which research design will be appropriate for Marian to use? Ito naman, syempre, since alam mo na yung foundation mo about the world of experimental designs, isa-isahin lang natin. So this one is the manipulation. Okay, tapos ito naman would be the control group. Okay, then implied yung randomization. Okay, ganito guys para hindi kayo malilito kung quasi or experimental as long as hindi outright binabanggit na tinanggal yung randomization. Okay, stick tayo sa experimental. Okay, kapag hindi explicit na sinabi na tinanggal yung randomization, okay, hindi yun quasi. Okay, experimental pa rin yan. So number 3, that's cat. Okay, number 3, that's letter cat. One more, number 3, that's cat. Number 3, that's letter cat. Number 4, she formulates the hypothesis of her study. Which of the following is a simple hypothesis? Alright, dalawa po yung binold ko dito just to show you the technical definition of your simple hypothesis. Balikan lang natin and i-highlight ko pa para sa inyo. Okay? Kapag sinabi mong simple hypothesis, isa lang po yung independent variable mo, tapos isa lang din yung dependent variable mo. In short, that's 1:1. Okay? Ngayon, kapag nagkaroon ka na ng either dalawang IV or DV, okay, basta in short, kapag tatlo na, over 3 variables, ganito na sabihin ko, kapag over 3 na yung variables ng study mo, that is now your complex hypothesis na yan. Okay? Now, technically speaking, kung susundin natin yung definition ng simple hypothesis, tama yung letter boy tsaka yung letter cat, right? Kasi 1:1 yan. And it states you na meron silang relationship to each other. Okay? Pero kasi sa board exam, guys, isa lang po yung tamang sagot. Okay? We will still choose the best answer. Kung ano yung mas kumpleto, kung ano yung mas encompassing, yun po yung isasagot natin. So, buburahin ko po yung letter boy para ang final answer natin is letter C. Okay? So, number 4, that's letter C. I hope we're clear. Okay, so number 4, that's letter C. Tama daw po yung directional and non-directional. Sige, isingit na natin. Kapag sinabi mo naman directional, it outright tells you na meron talagang relationship yung two variables. It's not about the number of the variables. It's about the relationship per se no variables natin. Okay? Ang keywords natin, kapag directional, we could say makakakita tayo ng more or less, increase or decrease. Meron siyang outright na positive and negative adjectives na ginamit. Okay? Unlike kapag non-directional naman, yes, okay, may relationship yung dalawang variable, pero hindi tayo sure kung anong klaseng relationship ba yon. Okay? With that, ano yung mga possible keywords natin para masabi na, uy, non-directional to? We could see yung words na associated with, o kaya naman related with, o kaya naman there is a difference. Mga ganon yung keywords. Alright? Tapos yung konsepto ng simple hypothesis at saka complex hypothesis and directional and non-directional, these are two entirely separate concepts. Hindi sila under ng isa't isa. Okay? Magkaiba yan. Okay? Bakit po mali yung letter apple? Kasi sinabi niya dito na not related. Eh kapag ganito yung usapan natin, simple or complex, we would assume na meron silang relationship with each other. Okay? Kaya mali yung apple. So 4, that's cat. Null hypothesis yung letter apple. Null hypothesis yan. Two independent variable and one dependent variable, that's automatic complex. Pag tatlo pataas, complex na yan. Sa dating ratio po kasi simple yung sagot. Pakipalitan na lang. Ako na magsasabi. Okay, complex po yan. Okay, complex yan. Alright? So number 4, that's letter cat. Number 4, that's cat. Number 4, that's letter cat. Number 5, and Marian introduces a competency-based training program for the staff nurses. Which element of experimental research would this intervention refer to? Okay, so again, this one is your manipulation. Yung kahit anong binigay mong method or intervention or thing sa patients mo, manipulation tawag doon. So number 5, that's cat. Okay. Number 5, that's letter cat. Okay, sige, balikan lang natin. Bakit po pala letter C at hindi letter B? Technically, tama din yung letter boy, right? Kasi 1:1 tayo, 1 IV, 1 DV. Pero kasi sa board exam, isa lang yung tamang sagot. So ipapractice na natin yung maghahanap tayo ng best answer. Kasi hindi po pwedeng dalawa yung isi-shade nyo sa board exam. Okay, kaya letter C yung pinili natin kasi mas kumpleto siya. May population din siyang binanggit. Okay, ganyan. So number 4, that's cat. Itong letter apple, that is your null hypothesis. Ang null hypothesis, pinapredict niya na walang relationship yung dalawang variables. Kaya siya null. Alright? Ganun. Number C, that's cat. Number 4, that's cat. Number 4, that's letter cat. Once you know the research concepts na, fun na siya talaga. Kailangan niyo lang siyang maintindihan ng bongga. Pero mahal kayo ng research, guys. So sana mahalin niyo rin siya. Number 5, that's cat. Okay, number 5, that's letter cat. Number 6, Morian plans her data gathering tool. Which of the following instruments would yield the most accurate data about the entry competence of the staff nurses? That's letter dog. Okay, so i-highlight ko po ito. Letter dog, performance evaluation forms based on observation by the immediate superior because, as we know, itong mga performance appraisals, di ba, familiar kay Ma'am Kapili, Attorney Kapili lecture po ito, di ba? It can also be used for your competency assessment, okay? And alam naman nating lahat that grades do not define our competency. So hindi po tamang sagot yung letter apple. Okay, so buburahin natin to. Ang questioner to be filled up by the nurse managers is a very, very vague word for us. Ang questionnaire na yan. So hindi natin isasagot yung mga bagay na vague, right? Letter C, interview the director of nursing. Hindi naman siya yung focus eh. It's about the staff nurses. So X din to. Letter dog tayo. So number 6, that's dog. Number 6, that's letter dog. One more. Number 6 po, that's letter dog. Number 7, she considers interviewing the training director about the performance of the staff nurses. What type of sampling includes those who happen to be in the training room where the activity is scheduled? Ito yung sinasabi natin na kahit sino na lang type of sampling technique. That's letter apple, convenience sampling. Okay, ito yun, no, who happen to be in the training room, sila na, ganon. So number 7, that's apple. And kapag nakita niyo yung word na accidental sampling, ganon, accidental sampling, may isa pa yan eh, incidental sampling. Okay, iisa lang po yung mga yan. Please, wag na po kayo magpapanik, mag-overwhelm. Iniiba-iba lang po nila yung wording sa board exam, pero alam kong alam niyo yung essence ng question na yun, pati ng concept. Okay, so number 7, that's letter apple. Number 7, that's letter apple. Number 8, she is certain that some staff nurses who are in specialized research setting tend to respond psychologically to the condition of the study. This is referred to as letter C, Hawthorne effect. Okay, that's your Hawthorne effect. Ito yung tipong whether consciously or unconsciously mong alam na may nanonood sa'yo, ang tendency mo ngayon, gagalingan mo. Diba? Kahit yung CI mo na nakatambay lang sa nurses station, pag silip mo sa kanya, nakatingin ka sa kanya, diba? Nakatingin din siya sa'yo. So, anong gagawin mo? Wala ka na maisip na intervention sa patient mo. Nagsa-psychosocial ka na lang, kunwari. Nag-guided imagery kayo, kunwari. Ganun yung Hawthorne effect. Okay, so number 8, that's letter cat. Okay, ano naman, sige, isa-isahin natin yung choices. Letter dog, your instrumentation error. This is one kind of your error wherein ang nagkakamali naman is yung instrumentation, yung instrument mo per se. So for example, you used your pulse ox for the first rounds. Okay, na-assess mo si patient, that's 98% O2 sats, very, very good. GCS 15, awake, alert, conversant. Okay, pagbalik mo sa kanya, second rounds, you use the same pulse ox, pero ano na lang yung reading ng pulse ox na yon? 36%. Okay, over desat si patient, pero tinignan mo naman siya, yung general picture ni patient, hindi naman siya in apparent respiratory distress, GCS 15 pa rin naman, awake, alert, conversant pa rin naman. Okay, so anong mali sa situation na yon? It must be the pulse ox that you used. Okay, baka low bat na siya or baka luma na kasi. Kaya mali na yung reading niya. So yun yung tawag natin na instrumentation error. Okay? Kapag naman halo effect, yung nabasa natin sa choices, ibig sabihin niya, that's another kind of your bias wherein si researcher, kunwari may nakita siyang participant na maganda. Okay? So i-attribute niya na lahat ng any other positive characteristics doon sa magandang patient na yon. Iisipin niya na ay matalino din to, ay competent din to, ay mabango din siya. Ganun yung halo effect. Okay? So nakakita ka lang ng isang positive attribute, feeling mo sobrang taas na ng tingin mo sa kanya. Ganun yung halo effect. Okay? As opposed to your horns effect, okay, magkabaligtad lang yung halo tsaka yung horns effect. Nakakita ka naman ng participant na gusgusin, kunwari, hindi siya nakaayos. So iisipin mo na ay tamad to. Ay ayoko dito kasi parang Ganon. Basta sisiraan mo na siya kasi i-associate mo na yung mga negative attributes sa kanya. Yun yung Horn's effect on the other hand. Okay? When you say selection effect, ang pinaka-technical term natin for this one is the selection bias sana. Okay? So kapag sinabi mong selection bias, okay, hindi ka gumamit ng randomization. You handpick the participants. So hindi masyado ka nagkaroon ng overrepresentation sa isang group. So with that, you also had your underrepresentation sa isang group. So that's your selection bias. Carry na ba tayo? Andiyan na naman si Attorney Kapili. Ulitin ko lang yung halo effect. So this is one kind of your bias wherein, okay, nakakita ka lang ng isang positive attribute sa isang participant mo, generalize mo na lahat ng positive attributes, kinabit mo na sa kanya. Okay, yun yung halo effect. Carry. So number 8, that's cat. Make Attorney Kapili proud. 8-letter cat. Okay, 8, that's letter cat. Number 9. Which of the following actions of Marian demonstrates an application of the right of the subject to beneficence? Okay, that's letter Apple should not place the subjects at a disadvantage or expose the situations they should not have been explicitly prepared. I know. Before you have your arguments, okay, iisipin nyo na non-maleficence to. Pero kasi kapag binasa po natin yung Pollitt and Beck, meron talagang thin line sa definition ng beneficence and non-maleficence. And this one is the technical definition of beneficence at in the first place. Okay, so kapag sinabi mong beneficence, we should not really place the subjects at a disadvantaged position. Okay, so number 9, letter Apple. Okay, that's number 9, letter Apple. And if ever, hindi nyo pinili yung option letter Apple kasi isipin nyo na, ay, baka non-maleficence to. Okay, anong pinili yung option? Letter C. Feeling ko letter C. Okay, i-ration natin. Bakit hindi po letter C? Kasi pwede mo itong ipasok sa konsepto ng informed consent. Hindi siya talaga beneficence, di ba? Subjects' participation will not be used against them. So informed consent siya. Okay, so number 9, that's Apple. Yung letter boy, informed consent din yan. Usually kapag informed consent, anong principle yung nangingibabaw dyan? That's your autonomy pati veracity, right? Ganon. So number 9, that's Apple. Number 9, that's letter Apple. Okay, number 9, that's Apple. Wait lang, sorry. Be prepared ang subjects. What do you mean? What do you mean? Kasi sa bawat subject natin, dapat meron silang informed consent. So, ibig sabihin, prepared sila sa pinapasok nilang procedures. Okay, so number 9, that's Apple. Number 10, maybe you're talking about the blinding, the concept of blinding. Ibang concept naman yan. Okay, number 10, she is certain that she must abide by the ethical conduct in research. Which code of research ethics requires informed consent in all cases governing human subjects? Tapos na-overwhelm na naman kayo. Ano tong mga to? Okay? As you know, Nuremberg Code is the first ever code, okay, na itinalaga, okay, to secure the patient's informed consent because konting history lang tayo. As we know, ang Nuremberg Code po ay tinalaga, let's say, post-Nazi era, post-Hitler era. Because as we know, yung time po ni Hitler, napakadaming violations with regards to human right violations. Kasi merong mga torture na nangyari that was disguised as human experiments. Kunwari, tatanggalin nila yung isang limb na isang tao, tapos ikakabit nila sa isang limb na isang tao. Okay, ganun po yung itsura ng human experiments nila before, kaya napakaraming namamatay. Okay, so kapag meron pong informed consent, guaranteed na voluntary na magpa-participate yung patient at hindi mo siya pinilit. That is under the concept of your Nuremberg Code. Okay, kaya siya yung sagot. Number 10, that's letter boy. Again, ang keyword lang talaga natin kapag Nuremberg Code, it's about the informed consent. Okay, about having informed consent yan, voluntary participation. Kapag naman po Helsinki Declaration or Declaration of Helsinki, actually, kapag ipagtatapat natin yung document ng Nuremberg Code, pati ng Declaration of Helsinki, halos parehas lang sila yung sasabihin sa'yo. Okay, it's about the voluntary participation, the safety of the patients, pero meron kasing additional na sinabi yung Declaration of Helsinki. Dapat daw merong special protection yung mga vulnerable populations. And when you say vulnerable population, andyan po yung too old, too young, mga persons deprived of liberty, mga pregnant patients, dapat daw may additional protection sila. Ano yung tsura ng additional protection na yon? Okay? Sabi daw, if you're trying to do your study which involves this vulnerable population, you have to make sure na hindi applicable yung study na yon sa isang normal adult individuals. Yun yung special protection nila. Parang bago maging subjects, itong vulnerable population, dapat hindi mo na applicable dito sa normal individuals. For example, let's talk about kapag pregnant patients, the presence of GDM. Wala namang GDM yung mga normal adult individuals, right? Dapat sa pregnant patients sila. So yun po yung special protection na yun. Okay? Kapag naman sinabi mong Belmont Report, that's letter C, this is more about the ethical principles and guidelines that should be assist, okay, in resolving the ethical problems arising sa research naman, okay, in general. Okay? Pero kasi ang keyword natin informed consent, so Nuremberg Code. Kapag naman ICN Code of Ethics, this is the document wherein nyo po mababasa yung mga ethical values, responsibilities, and even the professional standards of nurses. Okay, so Code of Ethics for the nurses naman to. Okay, so number 10, that's letter boy. Yes, parang last resort yung vulnerable population according to Declaration of Helsinki. Ganun. You have to make sure na sa kanila lang applicable yon, yung study na yon. Yun yung special protection nila. So number 10, that's boy. Number 10, that's letter boy. And kumpara ko lang last na promise, yung difference ng Nuremberg Code tsaka ng Helsinki Declaration, mas malaking konsepto po yung Nuremberg Code because it could apply with the other health specializations. Pero kasi kapag Declaration of Helsinki, mas encompassing naman ito with regards the world of the physician, sa mga doktor naman ito. Okay, kapag Belmont Report, this is about the basic ethical principles and guidelines about the research. Okay, so number 10, that's boy. Number 10, that's letter boy. Number 11. Ano ginagawa ko, guys? Wala pong ginagawa. Pero thank you so much. Number 11, which of the following code of ethics differentiate whether the research study has a therapeutic value or which essentially yields new knowledge and has no therapeutic value? Again, ang Nuremberg Code, okay, it is a set of codes. Okay, instruction siya. Okay, I think it is composed of at least 10 ata. 10 codes ata yon. And mababasa niyo po ito sa code number 2 ng Nuremberg Code. Okay, so number 11, it's letter apple. Okay, number 11, it's letter apple. Thank you. Thank you. Thank you po. Pero sana natututo kayo sa mga kaartehan ko sa buhay, guys. Para to sa inyong lahat. Okay, number 12, some subjects are considered vulnerable as subjects for clinical research. Which of the following are not considered as vulnerable subjects? Na isa-isa na natin sila, right? So, i-highlight ko po yung word na not dito para mas kita natin, mas obvious. Tapos lagay ko dito negative sign. That's letter dog, adult woman. Okay, that's adult woman. Ano pong ibig sabihin no institutionalized people, 'di ba? So yes, correct. It could be the people in jail, it could be from the nursing homes, home for the aged, mental health facilities, yung mga juvenile centers, and as we know, kapag ang isang tao ay naging institutionalized, gradually, eventually, they would become able to less they would be, naubusan ako ng English, nababawasan, okay, yung ability nila to think and even act independently. Okay, so with that, nagiging vulnerable din sila. Okay, so number 12, that's dog. Okay, number 12, that's letter dog. One more, number 12, letter dog po. Isa pa, number 12, letter dog. Number 13, wala akong ginagawa. Bakit biglang ganyan yung mga feedbacks nyo? If one of the subjects signifies his intention to disengage from the study, which of the following actions would be appropriate for Miss Rachel to take? Again, guys, in a general sense, the rule of the world is that kapag may umaalis or may gusto umalis, okay, malulungkot lang tayo for 5 seconds, pero hayaan natin. Let's letter apple, allow the subjects to withdraw anytime. Okay, kasi in the first place, kasama po yan sa pinag-usapan natin. Okay, kasama po yan sa pinirmahan nila sa informed consent. Okay, so number 13, that's letter apple. Okay, there are no rules, there's only agreements. Okay, so number 13, that's apple. Again, number 13, that's apple. Random na po yung mga emotions kasi ang lapit na ng words. Very, valid, very valid yan. Number 14, which of the following measures will best prevent manipulation of vulnerable groups? Of course, kanina pa natin pinag-uusapan informed consent. So that must be letter apple, 14 letter apple. Okay, number 14, that's letter apple. Yung sinasabi dito to prevent manipulation, that is to prevent the abuse, to prevent the exploitation, ganon. Kailangan ma-informed consent because pag may informed consent, guaranteed na voluntary yung participation nila. Okay, number 15, which of the following procedures ensures that Miss Rachel blank the study and the subject's rights? Parang kulang yung question. That's letter C, informed consent. Okay, that's letter C, informed consent. Kailan ko po isasagot? Okay, yung confidentiality, yung privacy, yung autonomy, yung self-determination. Again, recap ko lang, mabilis na mabilis lang. So, kapag ang tinatanong ay, ito yung kagandahan or ito yung essence ko, bakit tayo nag-highlight para malinaw sa'yo kung ano yung tinatanong. Okay, kapag ang tinatanong is about ethical principle, okay, ang isasagot mo po ay autonomy. Okay? Kapag ang tinatanong sa'yo ay right ng patient, okay, ang isasagot mo ay self-determination. Ganon. Okay? Kapag ang tinatanong sa'yo, again, ay ethical principle, ang isasagot mo ay confidentiality. At kapag ang tinatanong sa'yo ay right, ang isasagot natin ay right to privacy. Ganon. Okay? Ang ethical principle is not equal to the right. They're just corresponding to each other. Okay, ang ethical principle is not a right, corresponding sila. Okay, so ayan po, nasa harapan na po ninyo ang mga kasagutan sa tanong. Okay, and kapag informed consent, ang tinatanong sa atin, ang nangingibabaw na ethical principle, of course, is the autonomy and your veracity. They go hand in hand, magkapatid sila dyan. Same po ethical principles, autonomy and confidentiality. Yes, parehas na ethical principle ang autonomy and confidentiality along with your fidelity, veracity, beneficence, non-maleficence. Ganon yung mga ethical principles. Okay? Ano naman po ang right kapag ang ethical principle ay sabihin natin, liitan ko lang okay? Kapag ang ethical principle is ethical principle, beneficence, and non-maleficence. Okay, they share the same right actually. That is the right to freedom from harm. From harm. Ganon. Ganyan. Okay, ayan. So 15, that's letter cat. 15, that's letter cat. Again, number 15, that's letter cat. Number 16. The study is said to be completed when Miss Rachel has achieved which of the following activities. Ito na nga po yun. Diba? Kung na-handle ko po kayo sa research before, we were asking you, how do we know if the research is already done? Right? Letter apple, kapag na-publish na ang findings, or letter boy, kapag na-utilize na ang findings sa population. Letter cat. right? Kapag na-utilize mo na yung findings in practice, tapos na yung research mo. Number 16, that's letter cat. Okay? Etong letter apple and letter boy, basically, these are your communication of findings. Second to the last lang siya. Okay, second to the last step lang siya. So number 16, that's cat. Again, number 16 is letter cat. One more, number 16, that's letter cat. Number 17, situation. Paul is a new research staff of a tertiary hospital tasked to conduct a research study about the increased incidence of nosocomial infection in the hospital. Which of the following is the best tool for data gathering? All right, ang best answer natin dito is letter apple, the interview schedule, because basically, baka lang may magko-contest, hindi po ba letter boy? Ang tinatanong kasi sa atin is the tool. Magkaiba naman po kasi yung tool sa methods. Okay, so kapag ang tinanong naman sa inyo is data gathering method, okay, anong mga isasagot mo? Pwede yung records review, doon na papasok yung use of laboratory data. Okay, pero kapag tools kasi, that could be the use of your pen and paper, such as your interview, your questionnaire, mga ganyan. Okay, so 17 apple tayo. Okay. Number 17, that's apple. Between your interview and questionnaire, mas gusto natin isagot yung interview because face-to-face natin nagagather yung information, and between the interview and questionnaire, mas mataas kasi yung bias kapag questionnaire. Diba? Pwedeng i-deviate nila yung sagot towards to what is the expected. Ganun kasi yung cons kapag questionnaire yung ginagamit mo. So interview tayo. Okay, number 17, that's apple. Okay, number 17, that's letter apple. Di ba minsan, kapag gumagamit or sumasagot tayo ng questionnaire, isipin natin, ano nga ba ulit yung expected answer nila para di ako mapapahiya, parang ganon. So 17, that's apple. Again, number 17, that's letter apple. Risky in what sense? In what sense? Yung interview. Plain interview lang. And when you're interviewing a participant, of course, you have a set of questions available. Okay, so number 17, that's apple. Number 18, which of the following ethical issues should he consider in the conduct of his study? Again, sa the question, we meet again. Okay, wala po tayong sikreto dito. Patience is the key lang yung gusto kong i-share. Okay, so ethical issues, of course, number 1, confidentiality, kasama yan. Self-determination, yes, kasama rin yan. The privacy or the right not to be exposed publicly, yes. And full disclosure, of course, yes. So, kung ano lang hinighlight natin, yun lang po yung tamang sagot. So, that's 1, 2, 3, and 4. All of the above. Letter apple. Uy, feeling ko ulan. Dumidilim. Okay, number 18, that's letter apple. 18, that's apple. Wait lang po. Yan, I'm back. Number 18, that's letter apple. Number 19, in the statement, frequent hand washing of the health workers decreases the incidence of nosocomial infections among post-surgery patients. The dependent variable is, that's letter apple, incidence of nosocomial infection. Okay, so number 19, that's letter apple. Okay, kapag ganito naman yung tanungan, independent versus dependent variable, kapag sinabi mo independent, that is the presumed cause. Okay, this is the one that is being manipulated. Tapos titingnan natin yung results sa dependent variable. Now, sa dependent variable naman is the presumed effect naman yan. Okay, so in this study, the independent variable is the increasing incidence of the nosocomial infection. Okay. And the dependent variable, wait lang. Mali, baliktad, sorry. Ang independent pala is the frequent hand washing rather. Tapos yung dependent is the incidence of the nosocomial infection. Ganon. There you go. So 19, that's apple. Okay, 19, that's apple. So sana po pala wag palang umulan para hindi po maano yung signal ninyo. Ayan. So 19, that's apple. Number 20, Paul knows that he has to protect the rights of human research subjects. Which of the following actions of Paul ensures anonymity? Now, anonymity naman. Just to tell you this, anonymity is not a principle. Okay? Anonymity is not a principle. Anonymity is not a right even. It's just a plain word. Word lang siya. Okay, kapag sinabi mo namang anonymity, ayaw mong i-link yung pangalan ng participant or yung identity ng participant doon sa data na nakalap po sa kanya. So ang pinakamagandang example naman kapag anonymity ang pinag-uusapan is when we are having your survey forms. Ayun. So kapag nagpapa-survey po tayo, if you would notice, nakalagay sa survey form natin na name, age, address, optional. Diba? Optional lang siya. So that kapag inanalyze mo na yung data, hindi mo isasama yung identifying information doon sa data analysis mo. Okay? Yes, anonymous. Okay, magiging remain anonymous lang sila. Kaya anonymity. 20-letter apple yan. Okay, number 20, that's letter apple. Pero kasi in comparison to confidentiality, you are trying to protect the information per se. Kapag kasi anonymity, the identity of the subject. Okay, so number 20, that's letter apple ulit. 20, that's letter apple. Again, 20 apple, 21. He develops methods for data gathering, which is the following criteria of a good instrument refer to the ability of the instrument to yield the same result upon its repeated administration. Ito lang naman din yung talagang description ng letter dog, reliability. And when you say reliability, this is about the consistency of the instruments being used. Okay, so for example, ako po ay isang staff nurse sa public tertiary hospital. Na-board po ako isang araw. Di ba? 12 patients per shift, na-board ka pa. Okay, na-board daw ako isang araw. So naisip ko bigla, what if gumawa ako ng isang questionnaire that would lead us to a better nursing diagnosis sa patients natin sa ward? Okay, so I produced this questionnaire, okay, na magli-lead sa aming mga staff nurses to have a better nursing diagnosis. Okay? One time, ginamit ko siya sa pasyente, let's say kay Ma'am Marie. Okay, ma'am, okay, gagamitin ko to sa yung questionnaire na to. Okay? Nung ginamit ko sa kanya, it led me to having ineffective airway clearance as the nursing diagnosis of this patient. Okay? Para masabi kong reliable yung instrument na ginawa ko, ipapagamit ko po siya sa ibang staff nurse. Sabihin natin kay Ma'am Hana. Okay? Sabihin ko, Ma'am Hana, patry naman ng questionnaire na ginamit ko. Okay? Pakitry po kay same patient, kay Ma'am Marie. Tapos tingnan natin kung same tayo ng nursing diagnosis. And apparently, ineffective airway clearance din yung nakuha niya. So, ibig sabihin, consistent po yung instruments na ginamit namin. Yun yung reliable. Mataas yung reliability ng instrument na yun. Same setting, same results. Okay, so 21, that's dog. Okay, 21, that's letter dog. To be honest, ang research ay nakakalat lang yan throughout the NPs. Hindi siya heavily concentrated sa isang NP. Okay, pero this time sa NP4, heavily concentrated siya. Pero who knows, di ba? Baka mag-ibang ihip ng hangin. Okay, so 21, that's letter dog. Okay, 21, that's letter dog. Pag sinabi mo namang sensitivity, okay, ang keyword lang natin dyan is about the true positives, the ability of this test to detect the true diagnosis of the patient. True positives tayo dyan. Okay, kapag specificity, okay, that is the true negatives. Okay? Kapag validity naman, ang tinatanong sa atin, kapag validity naman ng question, ang itatanong mo naman sa sarili mo would be, how confident are we to say that the independent variable is the real cause, okay, of these dependent variables? Ibig sabihin, para masabi mo mataas ang validity ng isang research natin, dapat po less ang bias, dapat po less ang confounding variable. Okay? Para mas masabi natin that the independent variable is the real cause of this dependent variable. One example of the threat of your internal validity, we could say maturation threat. Okay, ito pong maturation threat, yung kapag i-compare natin yung independent variable, okay, it is compared against the physiologic changes over time. So kapag ang study mo, let's say, uy, nakikinig pa ba kayo? Baka nag-zone out na kayo dyan ah. Maturation threat yung gusto kong explain under the concept of your internal validity. Okay? Kunwari, ang study natin is breastfeeding increases the infant's length in 14 days. Okay? Tapos, internal validity. Sabi natin, ang itatanong sa sarili mo ay, how confident are we to say that the independent variable is the real cause of the dependent variable? So, in application with that study, how confident are we to say that the breastfeeding is the real cause of increasing infant's length and not because kahit naman wala kang ipainom dyan, kahit naman wala kang gawin sa bata, isa pong natural course of development ng infant is mabilis silang humaba, mabilis silang lumaki. Okay, so yun po yung ibig sabihin ng maturation threat. Iko-compare mo yung independent variable versus the normal physiologic changes of a person over time. Okay, another example, ito yung study. The use of SSD improves the patient's wound healing rate. Ganon. Okay? And in application of your internal validity, how confident are we to say that the use of this silver sulfadiazine is the real cause of the improvement of the patient's wound healing rate and not because kahit naman wala kang ipahid dyan, kahit naman wala kang gawin sa sugat ng isang tao, over time, ay liliit yan. Diba? Nature niya yan eh. Okay, ganun po yung maturation threat. And for us to lessen the chances of having more threats and bias, okay, babaan mo yung confounding variables, babaan mo yung bias para tumaas yung validity. Okay? Okay, so that's the concept of your validity. Same po yung confounding variables sa extraneous variable, isa lang po sila. Ang accuracy, okay, pwede mo itong ipasok sa concept ng validity eh. So, hindi ito yung tamang sagot. It's not the appropriate term even. Mas gusto natin yung validity if we're trying to know the accuracy of the variables and even the research. Okay. So with that, 21, that's letter dog. Okay, so 21, that's letter dog. 22. Paul is aware of the importance of controlling the threats to internal validity for experimental research. Which of the following refers to the condition where a patient dies in the hospital, hence the number of subjects is decreased. So with this, kapag umuonte yung subjects mo, that's what you call your mortality threat or your attrition rate. Kapag nakita mo tong word na yan, iisa lang yan, mortality threat, attrition rate. Okay, so 22, that's letter C. Again, number 22, that's cat. One more, number 22, that's letter cat. Number 23, Chloe is assigned to conduct a study on the changes in the quality of life of nurses who are permanently assigned in the graveyard shift. Now, which of the following titles would be the best for this study? And as you know, kapag titles naman yung pinapahanap sa atin, ang pipiliin natin is as complete, as encompassing as possible. Obviously, that's letter boy. Changes in the quality of life among nurses assigned permanently on the night shift. Okay, so 23, letter boy. Halos nabanggit niya na nga eh, yung buong study. Okay, so siya yung the best. 23, that's boy. 23, letter boy. Uy, nakikita ko na naman si Queen Yasmin sa buhok ko. Nagiging Queen Yasmin na naman tayo today. Nakakaloka. 23, that's boy. Number 24, Chloe plans to determine the relationship between the time shift and the quality of life among nurses. Which type of research will she probably use? Yes, Queen Yasmin, the best. Okay, 24, that's letter boy, descriptive. Now, Kapag nakita mo yung keyword na relationship, tapos na usapan, maghahanap ka na lang sa multiple choices. Okay? You wanted to look for the word correlational specifically, pero since wala siya dyan sa choices, correlation is an example of your descriptive type of research. Therefore, 24 letter boy, descriptive research. That's descriptive correlational. To be more specific. Okay, 24, that's boy. 24, that's letter boy. One more, number 24, that's letter boy. 25, she decides to administer a new administrative intervention, which is a self-governance guide with the goal to enhance the quality of life of the nurses. Which type of research would be appropriate? Again, basta meron kang binigay na manipulation, automatic, that's experimental research design. So 25, that's boy. Okay? Ito yun, no? New administrative intervention. Manipulation niya yan. So, 25, that's boy. Okay? Laban lang, okay lang na maraming mali. At least ngayon ka na nagkakamali. Sa actual boards, hindi na po pwedeng magkakamali as much as possible. Okay, strictly speaking, right? If you want to pass and even top the boards. Okay, so 25, that's letter boy. Again, i-explain ko lang po, when you say exploratory kind of research, that's like your descriptive research. It would begin with your phenomenon of interest, okay, yung gusto mong topic or konsepto. Pero instead of simply observing and describing this situation, kapag exploratory po, you would want to investigate the full nature of that certain phenomenon or situation. As in literal na mag-explore ka doon. Okay? Ayan. So 25, that's boy. 25, that's letter boy. 26, she formulates the hypothesis of the study. Which of the following describes a hypothesis? Walang kasawaan, promise. Magtatanong sila ng ganito kadaling tanong, as in magde-define ka lang doon. Kapag yung tipong hindi mo pa masagutan, parang sobrang manghihinayang ka. Okay? Based on experience kasi talaga, guys. Okay, marami pong research question na ipapa-define lang sa'yo yung term. Yung ako po yung nagte-take ng board exam, marami kong hindi nasagutan na research simply because honestly speaking, I neglected it during the board's review. Mas nag-focus kasi ako sa weakness ko. Okay, so yun yung gusto kong ipa-remind sa inyo. Please treat every information as equally, okay, as possible kasi hindi natin alam kung anong lalabas. Huwag kang mag-hyper-focus, okay, sa isang information, makakalimutan mo na yung isang concept, sayang yung point. Okay, so dapat equally distributed yung time and effort and attention mo sa isang concept. Okay, so here, 26, that's letter apple. 26, that's letter apple. And may time pa po kayo to do that. Okay, so 26, that's apple. Number 27, the researcher would like to determine the effectivity of a new system of scheduling and staffing in a particular tertiary hospital to prevent sudden shortage in the ratio of nurses to patients. This type of research method is called, that's letter boy, experimental. Okay, so number 27, that's letter boy, experimental. So again, meron kang manipulation dito na binigay. Is automatic, that's experimental. Okay, balikan ko lang po yung previous question. Bakit daw hindi exploratory? Kasi obviously, meron ka po manipulation na binigay. So experimental tayo. 25, that's boy. Diba? Okay. Mali yung focus nyo, kaya kayo nalito. Sabi daw kasi kapag quality ay exploratory, it's not really about di ito yung focus. Kasi tingnan mo, basahin mo siya in general, which is a self-governance guide with the goal to enhance the quality of life of the nurses. Sinasabi lang niya na ito daw yung goal ng bagong manipulation na gusto mong ibigay. Okay, hindi siya yung focus. So 25, letter boy, experimental. Gets? Yes, it's not the design itself. Okay, so 25, that's letter boy. Again, 25, letter boy. Diba? Pag mali kayo na highlight or keyword, mali na rin yung tamang sagot. Okay, so here naman, 27, since obviously may binigay na manipulation, automatic, that's letter boy, experimental. Di ba, bawat manipulation na makikita mo, automatic experimental yun. Or may binibigay na intervention or treatment, experimental. 27, that's boy. Yes. To prevent sudden shortage in the ratio. Yes, letter boy talaga tayo. 28, if the researcher implemented a new structured counseling program, yon, with a group of subjects and a routine counseling program with another group of subjects, the researcher has utilized which design? Baka lang merong malito na sabihin comparative daw ito, but wala naman siya sa choice, so hindi ata kayo malilito dito. So obviously, again, that's letter boy, experimental, kasi may manipulation, tapos may control group siya. Okay, may control group kasi dito. Okay, so 28, that's letter boy. Okay, 28, that's letter boy. Okay, here sa mga studies na binibigay, okay, experimental tayo kasi hindi naman outright sinabi na wala siyang randomization na binanggit. Di ba yun yung pinagkasunduan natin? Okay, as long as walang outright na sinabi na there is no randomization, blah blah, okay, hindi quasi ang isasagot mo, automatic experimental pa rin yan. Okay, so 27, that's boy. Basta walang binanggit na outright na wala daw siyang randomization, hindi yan quasi, experimental yan. Okay, ayan. Overthinking yan, yung ginawa mo. Okay, so you have to stick with the question itself. Okay, 29, based on the case above, the use of said researcher design are characterized by the following example. Yun na yun. Kanina pa natin pinag-uusapan, randomization, control, manipulation, except letter dog, theorize. Okay, 29, letter dog, theorize. 29, that's letter dog. One more, 29 is dog. Number 30, there are two research projects under study. The first is entitled Effects of Nurses Contraceptive Counseling on Unwanted Birth, and the second is entitled Effects of Unwanted Birth on the Incidence of Child Abuse. Which of the following is true regarding these two studies? That's letter dog. The dependent variable in the first researcher problem is used as independent variable in the second one. Okay, so number 30, letter dog. Para mas ma-appreciate ninyo, i-highlight natin. Tsaka kapag ganito pala yung template ng study, kung ano po yung variable after the word effect, automatic, that's the independent variable. So for example, effects of nurses contraceptive counseling on unwanted birth. Okay, so this must be the independent variable kasi siya yung after the word effect. Okay, tapos yung dependent variable, unwanted birth. So i-highlight ko yan. Okay, dito naman, effects of unwanted birth on the incidence of child abuse. Itong dependent variable mo sa first statement becomes your independent variable, obviously. Okay, tapos yung dependent variable natin, incidence of child abuse. Kaya letter dog yung sagot natin. Okay, 30, letter dog. That's letter dog. Okay, number 30, that's letter dog. Di ba mas kita, yung dependent variable dito naging independent na ngayon. Ganon. 30, that's dog. One more, number 30, that's letter dog. Number 31, in the research study entitled Effects of Timing in Initial Bath on the Temperature of the Newborn, which of the following is correct? That's letter dog. The presumed cause is the timing of initial bath. Okay, the presumed cause talks about your independent variable, which is true naman. Okay, so 31, that's dog, the timing of initial bath. Okay, number 31, that's letter dog. Number 31, that's dog. Number 32, it states the expected relationship between the independent and dependent variable, that's letter boy, hypothesis. Basta mga expected relationship, that's hypothesis. Okay, letter boy. 32, that's boy. Again, 32, that's letter boy. Ganito lang yung tanungan sa board exam ng mga research concepts. 33, primipara who receives instruction about breastfeeding will report a successful breastfeeding experience. This is an example of, yun na yun, directional hypothesis. So 33, that's apple. Because basically, you have your one independent variable and one dependent variable. Tapos alam natin kung saan papunta yung direction ng hypothesis, successful breastfeeding experience. So positive side yan. 33, that's apple. Okay, number 33, that's letter apple. One more, number 33, that's apple. 34, based on the above stated problem, the most applicable research design, according to the dependent variable presented, is that's letter dog, qualitative research. Okay, so here about the breastfeeding experience, so that must be letter dog, qualitative research. Ano po yung basic research? Okay, pag sinabi mo basic research, it talks about the purpose of the study basically. So kapag basic research po, at saka pure research, iisa lang po sila. So ang goal lang ng basic research is to contribute new information, tapos ang research. Okay, so kapag nakakontribute na siya ng bagong information, tapos na research niya, basic research yun. Okay, in comparison to your applied research, on the other hand, kapag sinabi mo namang applied research, ang kino-contribute naman ni researcher is a new method, a new process, and even new intervention. Okay? Ayan. So yun yung difference ng basic versus applied. So kunwari, a researcher wants to study about the causative factors of HIV. Is that basic research or applied research? Ganon. Basic lang siya, di ba? Kasi bagong factors lang yung gusto niyang ma-explore dyan. What about this one? The researcher wants to find out about the new intervention about the safety of the epileptic patients in the ward. Ganon. Applied na obviously, kasi may bagong intervention siyang gustong ma-produce. Okay, so yun yung difference ng basic and applied. Carrie? Okay. Kapag qualitative research naman, ang focus mo is about human experiences. Basta human experiences, that's your qualitative research. Okay? Eh, ang human experiences, iba-iba naman tayo ng experiences sa buhay. So therefore, subjective yan. Okay? Ayan. 35, above all, do no harm. This principle in research is under the ethical consideration of letter dog, non-maleficence. Walang kahirap-hirap. Okay, so 35, that's dog. 35, that's letter dog. One more, 35, that's dog. 36, Priscilla Regina RN. Pabalik po sa 34. Here. Are we going too fast or sakto lang? Okay. Ayan. So 34, that's dog. 35, that's letter dog. Number 36. Uy, sabihin niyo pag hinihingal na kayo guys ha, ang bago nating code word ay mercy. Sabihin niyo lang mercy and I will stop. If it becomes too painful, if it becomes too fast, kung masyado na mahapde, okay, yung puso ninyo, pakisabihan po ako. Okay, so 36, that's letter apple. Historical presentation. Okay. Hindi na binasa yung question. Sorry. Okay. Working on her masteral thesis, conducted a longitudinal growth study following an initial utilizing a method that children from 6 months of age to adulthood. Importance is letter apple, historical yan. Okay. From 6 months to adulthood. Yan. Longitudinal. Okay. So 36, that's apple. 36, that's letter apple. One more. Sorry. Sige, bagalan pa natin. 36, that's apple. Bakit po hindi letter B? Kasi wala namang letter B. Burahin mo yan. Okay? Ganon lang. Number 37, to investigate the effects of a specified tranquilizing drug on the learning behavior of boys identified as switch active using random assignment, specific tranquil. Ano na nangyayari? Doon may pating-ting-tang-tang na dito. Okay, tranquilizing drug ata yan. Of the learning behavior of boys identified the research work. That's letter dog through experimental research method. Okay, number 37, that's letter dog through experimental. So of course, meron siyang binigay na manipulation. Tapos meron din siyang random assignment over here. So through experimental din yan. Okay, obviously, that's 37, that's dog, 38. Studies previously done and options of experts that provide informational insight to the problem area on their study is considered A. Okay. Sorry. So yung historical presentation, since di ba yung sa situation kanina, simula pagkabata hanggang sa adulthood niya, anong klaseng data collection method yung isipin natin? Longitudinal. Di ba? Kapag more than one point of time or extended periods of time, longitudinal yon. Okay? Tsaka yung term na longitudinal, data collection method siya. Ha? Hindi siya research design. Data collection method siya. Okay? So 38 here, medyo objective yung dating nung tanong, sagutan lang din natin. That's letter dog, documental literate. Okay, anong keyword mo dito? Informational and insight to the problem area. Kapag letter apple, conceptual literates, ano yung mga possible words na pwede natin i-associate dito? So you could have your development of your understanding with the interrelated concepts. Interrelated concepts. Ganon. Kapag naman research literate, ito naman is about determining and diminishing. Sulat natin. Determining the knowledge gaps. Okay, determining the knowledge gaps naman yan. Okay, so of course, when you're trying to do when you are describing a research literate, okay, of course, you know the methods of the inquiry. You possess these research skills. You navigate about the world of research very, very well. That's your research literate. So kapag naman social literate ang pinag-uusapan, this is about the understanding of the social skills. Social skills, idagdag na rin natin organizational skills, mga ganyan. Even the communication skills. Yan. Ganon. Kapag social literate. Okay? So number 38, that's letter dog po, documental literate, information and insight to the problem. And gusto ko lang din pong i-prepare kayo ahead that there could be questions sa board exam na sobrang hindi mo na-encounter at all, such as this one, na first time encounter lang. But I still believe in you guys. Okay, just use your analysis, just use your context clues, kayang-kaya masagutan yan. Okay, so number 38, dog po. Okay, number 38, that's letter dog. 38, that's letter dog. Number 39, researcher Brenda D. embarked on an intensive study of health problems affecting the residents of Barangay Chiripia, San Carlos City. She decided to study every third family responding the total population in the said community. Ito pa lang yung nababasa mo. Alam mo na agad kung anong klaseng sampling technique to, right? That's letter C, systematic sampling. Okay, systematic sampling. Na-eliminate lahat. Ano nang sagot? Okay, so 39, that's letter C. Okay, and how do you get the kth element? Diba kasi kapag systematic ang keyword natin is every kth element. So for us to get that kth element, so that is population over your sample. Big letter N over small letter n. Okay. Ang systematic sampling is this probability or non-probability sampling. Probability. And kapag sinabi mong probability sampling, this is very, very well randomized, right? Probability. So randomized, so wala kang bias dyan. Okay? along with your random sampling, with your stratified sampling, and your cluster sampling. Itong incidental sampling or convenience sampling, this one is non-probability. Okay, so 39, that's cat. 39, that's letter cat. Wag mo naman i-eliminate yung tamang sagot. Okay, number 40, the report of person relates a testimony of an actual witness or participant in an event. That's letter boy, secondary source of information. Okay? Kapag primary source, that could be your actual witness. Pero kapag naki-merit test na lang siya, di ba? Kinuha mo yung information from the actual witness. Secondary source na lang yan. Okay, so 40, that's boy. Okay, number 40, that's letter boy. 40, that's letter boy. Number 41, a change in level 2. Sorry. Okay. So here, kapag primary source, kapag galing siya mismo sa actual witness, first hand mo nakuha yung information na yon. Pero kapag secondary source naman, kapag naki-merit test lang, yung na-interview mo is naki-merit test lang from the actual witness. Pinapasa na lang sa kanya yung information. Okay, secondary source na yon. Okay, so 40, that's boy. Number 40, that's letter boy. Buti na lang, hindi ka pwedeng manood ng Guardians of the Galaxy sa actual board exam. So, hindi na masyadong marami yung mali mo. Okay? Here naman, number 41, change in level 2 nursing students observe behaviors in the administration of insulin among diabetic women that occurs merely because they know that they are being observed and graded by their clinical instructors. Ito na nga po yun. Diba? Dali-dali po natin hanapin ang Hawthorne phenomenon. 41, that's apple. Very good. Okay. Number 41, that's letter apple. One more, number 41, that's apple po. 41 apple, 42, there is no difference between nursing and non-nursing students in the source of satisfaction and stress in their individual areas of experience. This illustrates as, that's letter apple, null hypothesis. Okay, pag sinabi mong null hypothesis, explicitly stated that there is no relationship between the variables of the study. Okay, so 42, that's apple. 42, that's letter apple. Okay, number 43, condition or characteristics that the researcher manipulates in his attempts to ascertain the relationship to the observed phenomenon. That's letter boy, independent variable. Okay, so 43, that's letter boy. Ang keyword natin dito is minamanipulate mo. So 43, that's boy. 43, that's boy. Okay. So kapag sinabi mong inductive hypothesis, so these are the initial facts, okay, about the statement that we're trying to prove. Ibig sabihin, kapag inductive hypothesis po, ito yung mga statements that we must have before we start, the information we must have before we start. Kapag na mga alternative hypothesis, kapag nakita mo yung code ata yung word doon, yung HA, okay, that's the alternative hypothesis. And that is the other answer to the research question. Okay. So, kunwari, ang null hypothesis is there is no difference. Ang alternative hypothesis mo, there is a difference. Kapag naman operational hypothesis, it defines exactly about the variables of the interest natin and how they are related to each other. That's the operational hypothesis. Okay. This signifies your UHA is yung alternative hypothesis. Kapag nakita mo yung H0, that's your null hypothesis. Pwede ring H1 for the alternative hypothesis. Ganon. Okay. Inisa-isa ko lang yung definition. So 42, that's apple. 42 apple. Pag operational hypothesis naman, it defines the variables of interest and how they are related with each other. Okay, about sa variables naman yung operation. Okay. 43, that's boy. 43 boy, 44, which among the following is a qualitative research? Napakadali. Basta it talks about your human experience, automatic, that's quali, that's letter boy, study on the effects of death in the coping mechanism of widowed individuals. Okay, 44, that's letter boy. Obviously, if you try to make isa-isa of the choices, ang konyo. Okay, lahat yan, quanti. Kapag meron ka ng mini-measure na data, automatic quantitative na yon. Anxiety, BP, okay, pain meds, anxiety on the heart rate, mga ganyan, quanti yan. Okay, so 44, that's boy. 44 boy, 45, which is considered to be descriptive research in character. Okay, that's letter C, study of the diseases that erupted. Ay, wait lang. Palitan ko yung sagot dito. Letter dog tayo, please. Okay. Letter dog tayo. Descriptive kasi yung tinatanong. Pag letter apple, this one is case study. Okay. Itong letter boy, effectiveness of a new drug solution, this is experimental. Okay. Letter C, this is historical. Okay, so letter dog. 45, that's dog. Okay, 45, that's letter dog. One more, number 45, that's letter dog. Yes, quali rin yung yung case study. Qualitative din naman yung historical. Okay. So 45, that's letter dog. More specifically, letter dog ang isasagot natin. Okay, 46, which of the following studies is based on qualitative research? Pakitama na lang po ha, kapag mali yung sa G-form. Letter dog yung final answer. Based on quali research, that's letter C. Client's reactions to stress after open heart surgery. So again, reactions, human experience. 46, that's cat. Okay, 46, that's letter cat. This one is 45. Okay. Wala, ina-analyze ko lang. Si attorney para may shinare siyang technique. May shinare siyang technique, right? When it comes to the research designs, kung paano malalaman sa isang tingin lang. Ayan. Yun yung sundin yung ilaw, guys. Okay, so number 46, that's letter cat. Okay. Ito kasing letter dog, observational research. Could be descriptive research din siya. Okay. Siya talaga. Siya talaga eh. Okay, kasi kapag letter apple, obviously case study, letter C, that's historical. Wala tayong ibang choice. Letter dog tayo. Okay. So 46, that's cat. 47, a patient who is to undergo surgery will be signing a consent form. The nurse's main responsibility whereas informed consent is obtained to, that's letter boy, validate that the patient understands the procedure of the treatment. Okay, number 47, that's letter boy. Umbrella answer kasi to. Okay, so 47, that's boy. Again, 47, that's letter boy. Number 48, a surgeon provides necessary explanation to a patient who will be undergoing a procedure. The patient refused. Her right to refuse is based on what ethical principle? That's letter apple, autonomy. Okay, so number 48, that's letter apple, autonomy. To protect the patient's right to self-determination. Okay, 49, a client tells the nurse regarding his decision to refuse BT, which of the following is the most appropriate initial nursing action? That's letter apple, notify the physician of the client's decision. Okay, so 49, that's apple. I-refer mo muna kay doc. Okay, 49, that's letter apple. Number 50, the nurse knows that responsibility for obtaining informed consent for a procedure rests with letter apple, the person who will perform the procedure. Okay, so number 50, that's letter apple. 50, that's apple. Saan? Ah, okay. Bakit po hindi letter boy? Because kung gusto nating isagot yung document, dapat ida-document natin siya sa chart ni patient and hindi sa nursing care plan. Okay, so ECHIS kasi yung nursing care plan. It has to be the patient's chart, okay, for documentation. So number 49, Apple tayo. Okay, pero tama yung concept nyo na document first, then notify. Dapat tama lang kung saan tayo nagdo-document. Okay, so questions pa more? If you don't have any questions, 5 minutes break first. Okay, bladder break lang, water break, tapos balik tayo. Okay, I'll be here guys. I'll wait for you. Thank you so much. Ayan. Kay Attorney Kapili ba yon yung lecture na document first, then notification? Ayun, yun yung sinundan natin. Pero kasi here, mali yung place kung saan siya nag-document. So, nag-notify tayo. Okay? When you say obtain kasi sa Tagalog, sino kukuha ng informed consent? Who has to do the informed consent? O sino yung gagawa ng procedure? Okay? The nurses can secure, pwedeng siya yung magtago, pero hindi siya yung pwede mag-obtain. Kapag daw po may question, ang random. Kapag daw po may question kayo kay Sir Raymond regarding the pre-boards 2, paki-PM daw po siya. Tapos lilinawin daw po niya ang mga bagay-bagay. Okay? Kapag daw po may question kay Sir Raymond with regards to the PB2 ratio, okay, paki-PM daw po siya. And then he will explain everything. Okay? Yan po ang magandang balita. Asan po si Sir Raymond? Siya po ay nasa puso at isip ng bawat Pilipino. Opo, masaya po siya ngayon. Hindi ko alam kung nasan siya, pero yun yung pinadala niyang message. Okay, so number 50 here, that's letter apple. Okay. 51. When informed consent is obtained from the patient, the explanation of the surgical procedure, possible risks, complication alternatives is the responsibility of the. Diba? Hindi pa pala tayo tapos sa research. Ang haba. So that's letter boy, the surgeon. Of course, who will do the procedure, siya po yung may responsibility to get the informed consent. Okay, so 51, that's boy. Okay, 51, it's letter boy. May na-manifest niya na naman si Sir Raymond. Number 50, that's apple po. Okay, 50, that's letter apple. Again, 50 is apple. Number 51, that's boy. 51, boy. 52, through the nursing process, the nurse plans and delivers patient care by letter apple, planning nursing interventions and assigning necessary staff. Okay, so number 52, that's letter apple. Obviously kasi planning. So planning din dapat yung hahanapin. Okay, so 52, that's apple. 52, that's letter apple. One more. 52, that's apple. 53, which statement describes what a nursing diagnosis does? Okay, simple description lang. That's letter boy. It facilitates comprehensive nursing care by identifying the health problem and validating the contributing factor. Okay, magkaiba po yung nursing diagnosis sa nursing process. Okay, ang diagnosis part lang siya ng process. The rest of the choices, it talks about your nursing process. Okay, so number 53, that's boy. Ganon. 53, that's letter boy. Funda na po tayo. And if you want to read more about the funda concept, si Cosrin Herb po ang takbuhan natin dyan. 54, based on physician's order, for oxygen by nasal catheter at 3 liters per minute, an appropriate nursing order would be, that's letter C, add sterile distilled water in the humidification container as needed. Okay? Alam niyo ba, merong isang pagkakataon sa ward. Meron isang pasyenteng nagdesat as in, syempre public hospital yon, so anyone could be with the patient. So pati mga intern, syempre, nag-assess, bakit siya desat and everything. Okay naman, breath sounds. Nakakonect naman siya sa auto support. Pero ubos na kasi yung humidifier niya, guys. Okay, so the way that you have to assess for the patient, dapat as holistic as possible. You have to get the general picture of the patient, okay? Para mako-correlate din natin yung findings. Okay, so number 54, that's cat. Number 54, that's cat. Sorry, balik po tayo. Wait lang. Ito kasing letter apple, tsaka letter boy. This one is for the NGT insertion. It's not about the O2 support. Okay? Itong nasal cannula yan. Nasal canyon eh. Okay? $52. Bakit po A at hindi letter boy? Because this is the 5 phases of the nursing process. Gusto lang nung question is planning phase lang. Yung gusto niyang kunin sa'yo. So that's apple, not the whole nursing process. Okay. So 52 apple. Carry, 53, that's boy. 54, that's cat. Uy, sana okay tayo sa cat ha. Yung A and B kasi NGT yan. 55, the evaluation phase of the nursing process. Okay, I would like to change our answer here. It's not letter dog, it's letter apple. Okay, because pag evaluation phase, as we know, it continuously changes. Okay, along with our assessment. Okay, ang letter dog kasi, this talks about the planning phase. Okay, mas planning kasi siya kaysa evaluation. So 55 plus 1, guys, letter apple. Okay, 55, that's letter apple. Okay, number 55, that's letter apple. Tuwang-tuwa na naman sila. Yes, 55, that's apple. Ako na -1, DM na lang. Hindi ko ma-everyone. 55, that's apple. 56, it's okay, it's okay. Okay, the four main concepts common to nursing that appear in each of the current conceptual models or letter dog, person, environment, health, and nursing. If you would try to analyze the different nursing theories that we have, halos lahat sila may say about these four factors. Okay, so number 56, that's dog. And collectively, kapag narinig niyo po yung term na meta-paradigm nursing or for nursing, okay, it talks about these four factors. Okay, so 56, that's dog. 56, that's letter dog. One more, number 56, that's letter dog. 57, which of the following nursing theories develop a conceptual model based on the belief that all persons strive to achieve self-care. Uy, favorite natin to, self-care theory. Si Dorothea Orem po yan. Okay, so number 57, that's letter boy. 57 is boy. Para mas masaya, isa-isahin natin. Okay, itong si Martha Rogers, naniniwala daw po siya na tayong human being, pati ang environment where we are living in, is one and the same. Ganon. Isa lang daw po tayo. Medyo transcendental yung approach niya to nursing. Okay, kapag naman po letter C, si Mother Ida Jean Orlando, it talks about the nursing process naman. Yung buong ADPI. Okay, kay Mother Orlando yan. Ito namang letter dog, Sister Calista Roy. This one is adaptation. Very good. Adaptation theory. Ganon. Okay, so 57, that's boy. 57, that's letter boy. Again, 57 is boy. May mnemonics po kayo for nursing theory? Sadly, wala po. I memorized it the hard way, the long way. Si Martha Rogers, it is about the unitary human beings. Yan. Okay? Diyan siya sikat. So 57, that's boy. Again, number 57, that's letter boy. Number 58, which of the following nursing theories is credited with developing a conceptual model specific to nursing with man as the central focus? That's letter apple. Si Martha Rogers po yan. Okay. 58, that's letter apple. Itong si Dorothy Johnson, it talks about the behavioral systems models. Ayan, 58, that's apple. Again, number 58, that's apple. One more, 58 is letter apple. Well, to be honest, na-refresh na lang naman din ako sa mga nursing theories nung mag-aaral na ako sa boards. Hindi kasi siya masyadong pinag-usapan nung college, dinaanan lang siya. So 58, that's apple. Number 59, in Maslow's hierarchy of physiologic needs, the human need of greatest priority, that's letter dog. Oxygen, of course. Diba? It only takes 6 minutes to kill the brain. Memorize nating lahat yan. Okay, so 59, that's letter dog. Akala ko po love. Hindi. Oxygen muna. Yan. 59, that's letter dog. Parang newspaper po yung book namin dyan. Paano? Okay, so 59, that's letter dog. Okay, 59, that's dog. Number 60. Gas-gas na ba yung statement na yun sa inyo? A nurse's initial priority in creating a therapeutic environment for a patient should be letter C, providing for his safety, of course. Okay, safety priority. 60, that's cat. 61, one of the advantages of primary nursing care is that letter boy, it increases nurses' accountability and independence. 61, that's boy. Okay, number 61, letter boy. Number 62, a patient is admitted to the hospital with complaints of nausea, vomiting, diarrhea, and severe abdominal pain. Which of the following would immediately alert the nurse that the patient has bleeding from the GI tract? Okay, so bleeding from the GI tract, of course, that's the Gaiac test, letter boy. Ito po yung FOBT test, the fecal occult blood test. Okay, so 62, that's boy. 62, that's letter boy. One more. 62, that's letter boy. 63, the best way to observe whether a patient is complying with fluid restriction is true. That's letter boy, fluid intake and output records. Totoo talaga na wag na magpapalit ng sagot, huhu, kapag di sure. Okay, so alam ko na meron kayong concern dito. Okay, so let me explain clearly. So, fluid restriction kasi yung tinatanong, i-highlight mo yan. Kapag ang i-highlight natin or kapag ang tinatanong sa atin is about the fluid retention, okay, dun mo isasagot yung weight. Okay, because weight is the best indicator for the patient's overall body volume status. Okay, pero kasi fluid restriction yung ginamit na word. So IO tayo. Okay, 63, that's boy. Gets? Yan. So 63, letter boy. Pero tama yung concept nyo ha, that weight is the best indicator for fluid retention. Okay, magkaiba kasi yung retention sa restriction. Okay, 63, that's boy. 63, that's letter boy. Okay. Tama po ba na if, fluid, pakikumpleto po ng word para sure tayo. 64, high-pitched gurgles heard over the right lower quadrant or letter C, normal vowel sounds. Normal finding yan. Okay. Kapag naman hypo, active vowel sounds, ilang sounds lang per minute yan? 2 to 3 vowel sounds lang yan per minute. Okay, kapag naman hyper, active ang vowel sounds, syempre kahit hindi mo na i-auscultate, rinig na rinig natin yan. Okay? Kapag naman vowel obstruction, kapag may obstruction naman sa vowel ni patient, ano maririnig mo? High-pitched, tapos tinkling yung sound niya. Okay, high-pitched tinkling sound. Okay, 64, that's letter cat. Sorry po. Okay, sulat ko na lang. Kapag hypoactive, vowel sound, so that would be less than 3 lang. Okay, yung maririnig mong vowel sound per minute. Okay. Kapag hyperactive, actually iba-iba yung reference kapag hyperactive, sabi daw kapag greater than 30 or kahit na do not require auscultation kasi maririnig mo siya sa sobrang hyperactive niyan. Okay? Then kapag naman vowel obstruction, high-pitched, tinkling sound. Ayun. 64, that's letter C. Minsan talaga may mga theoretical concepts na mas ma-appreciate mo kapag gamit mo siya in practice. Feeling ko ito yung one of it. So 64, letter C. Mas ma-appreciate mo to kapag in-auscultate mo na siya directly. So okay na tayo dito, letter C. Wait lang, nalilito kayo kasi pinaghahalo-halo niyo yung concept. So kapag po kasi fluid retention ang issue, that's the weight. Okay? Kapag fluid restriction naman, that's the IO. IO tayo dyan. Ang fluid resuscitation, okay? Kapag fluid resuscitation, anong main issue nito? Fluid resuscitation. Pwedeng hypotensive si patient, resuscitation. Okay, pwedeng hypotensive. So, for us to monitor kung okay na ba si patient with regards to fluid resuscitation, pwedeng IO. Okay? Yes. Sa resus, sabi ni Sir Lian. So, pares kami. Okay, so 63, letter boy tayo. Okay, I hope mas clear. Sana mas clear. Okay, so 63, that's boy. 64, cat. 65, the usual sequence for assessing the vowel, that's letter apple. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, ito lang po talaga yung sequence that would follow the anatomy ng vowel natin. Yun yung basis. Okay, 65, letter apple. Okay, 65, that's letter apple. Okay, sulat ko po, follows the anatomy of the vowel. Ganon. So 65 apple. Again, 65, that's letter apple. One more, 65, that's apple. 66, which of the following statements about vowel sounds is accurate? Okay, bago ka finalize na all of the above na sagot mo, isa-isahin mo muna yan. Peristalsis causes vowel sounds, of course, that's true. Rapid high-pitched, hyperactive sound indicate increased peristalsis, yes, true rin. Decreased vowel sounds can be a symptom of paralytic ileus, yes, that could be true as well. Okay, so A, B, C, tama. So 66, that's dog. Okay, 66, letter dog. One more, 66, that's letter dog. 65, apple. Screenshot na po. 65, that's letter apple. 65, that's apple. Number 66, dog. Number 67, Nurse Jaco is performing. Ang arte talaga magsalita, di ba? Nurse Jaco lang sa amin yan, ma'am, is performing assessments to different clients. He knows that initial assessment of abdominal distension due to flatulence is best done by. Okay, ito naman, gusto niyang sabihin sa'yo, okay, ay wag ganon, okay? Gusto niya sabihin sa'yo yung sequence, okay, kung paano ba tayo mag-assess ng abdomen ng patient. Okay, the very first thing that we should do is to inspect. Okay, so 67, that's cat. Inspecting the abdomen for movement of flatus. And baka lang kasi i-take nung ibang students literally yung movement of flatus. So mas ma-appreciate natin to kapag mayroong abdominal distension for that. Okay, so 67, that's cat rather. Okay, 67, that's letter cat. Friends po ba kayo ni Ma'am Shannon? Bakit po? Anong chika? Anong chika? Okay, 67, that's letter cat. Number 68, Nurse Jaco understands that the best method to know whether a patient's coughing and deep breathing exercises have been effective is to let their dog auscultate the lungs. Syempre, if we auscultate the lungs after performing coughing and deep breathing exercises, sana expected natin na wala na tayong adventitious breath sounds. Okay, 68, that's dog. Okay, 68, that's letter dog. Ako tsaka si Ma'am Shannon, classmates kami since first year high school. Hindi na kami nagkawalay hanggang graduate kami ng college. At parehas rin kaming na-delay ng college. Ayan. Hanggang mag-ratio. Sobrang nakakatuwa yung takbo ng buhay namin. Hindi namin siya plinano actually. Nangyari lang talaga. Ayan, sa Los Piños Science High School po kami nag-high school. Pero hindi kami same time nag-exam kasi nag-work muna siya. Nauna ako, pero nag-top din afterwards. Ayan. Si Sir Wong tsaka si Sir Daklis, yon. So 68, that's letter dog. I'm so proud of her. Okay, 68, that's letter dog. Again, number 68, that's letter dog. Number 69, which among the following assessed data should Nurse Jaco report immediately for a child named Charlene who is having croup? Oo, alam ko yan. Si Sir Wong tsaka si Sir Duckley. Super duper cute nila. Ipalitan natin yung sagot dito. Okay, letter apple tayo because upon further reading, hindi naman masyadong associated yung vomiting tsaka yung croup. Okay? Pero kasi itong letter boy tsaka letter cat, expected ito sa batang merong croup. Pero kapag nag-flare na po yung nostrils nila, respiratory distress na ang patient. Okay, so 69, that's apple. Okay, 69, that's letter apple. Bakit may nalulungkot na? Tara dito, magyakapan tayo. Mag-comfortan tayo dito. Si Sir Miggy din po ba ay naging kaklase nyo? Yes, naging classmate ko rin si Sir Miggy. It's just that na-delay kasi ako, so nauna siyang graduate. Yan, sumunod kami. Okay? Yan. 69, that's apple. Again, number 69, that's letter apple. Sir Miggy, hands down din ako sa kanya. Sobrang galing. Okay, number 17, Nurse Jaco is taking care of a 69-year-old male patient named Lolo Marco, who is assessed of having urinary incontinence. The nurse should, that's letter C, apply an external catheter. All right, ang urinary continence, sakit ba to? Is this a disease? No, not at all. It is a symptom rather, and it can be manageable, it can be treatable. Okay? Here kasi, urinary incontinence, yung pinaka-focus ng question, tapos kasi ang pasyente mo ay si tatay. Okay? Just because may urinary incontinence ang isang pasyente, it doesn't really necessarily require na pasukan natin yan ng indwelling catheter or ng Foley catheter. Ano ba yung indications ng indwelling catheter? Let's say merong urinary retention si patient. Pwede tayo magpasok ng Foley cath. Pero kasi here, urinary incontinence, ang mga primary signs and symptoms niyan, syempre, hindi niya makontrol yung labas ng ihi. So mas okay kapag letter C, external catheter yung gagamitin, and yes, very good. An example of your external catheter is your condom catheter. Okay, okay na tayo dyan. Number 70, letter C. Okay. Letter D po yung G-form, pakipalitan na lang po. Okay. Not really diaper. Kasi this is an exact urinary tract condition or situation. Pag magda-diaper tayo, siguro pwedeng pag may bowel issue rin. Yan. Okay? Or kaya naman magda-diaper kapag naman kailangan i-bed rest ni patient. Pero not enough na qualification for the indwelling cath, mga ganyan. So letter C talaga yung best answer. Okay, condom cath. Okay yan, medyo yan. Social ang condom cath. Social. Masabi lang. Okay, balikan ko lang. How do we assess daw for the fletus? You have to inspect if the patient has abdominal distension. Okay, yun na yun. So kapag distended yung abdomen ni patient, baka may hangin sa loob. Okay, so 70, that's cat. Number 71. 70 po, letter C, condom cath. Para rin hindi ma-restrict yung activities ni patient. Okay. Tsaka kasi kapag naka-condom cath ka, hindi mo na kailangan na masyadong masyadong meticulous na skincare. Okay. So 70, that's cat. Number 71, Nurse Jacko is having difficulties in assessing for cyanosis, a patient whose body and skin was deeply suntanned. The nurse should examine the clients. Okay. Letter dog, skin on the inner aspects of the wrist. Bakit po letter dog at hindi letter boy or cat? Kasi meron siyang additional criteria. Okay, normally, usually, if you want to assess for cyanosis, that is really most evident sa nail beds ni patient, sa lips ni patient, kahit sa oral mucous membrane niya. So tama yung boy and cat. Pero kasi may additional criteria daw. Kapag dark-skinned yung patient natin, medyo dark yung kulay ng skin niya, mas ma-appreciate mo daw yung cyanosis kapag ang chinek mo is yung conjunctiva and not the retina. Okay, it's the conjunctiva sana. Okay, pati yung palms and soles ng patient. Okay, ano yung pinaka-closest answer sa palm o kaya sa sole? Letter dog. Okay, number 71, that's dog. Okay, number 71, that's letter dog. All right. Sige, usual patients, okay, to assess for cyanosis. Okay, pwede yung sa nail beds, pwede po sa lips, oral mucosa, pwede rin. Oral mucosa. Okay, pero kapag dark skin si patient, okay, to assess for cyanosis, pwedeng sa conjunctiva ni patient, pwede rin po sa palms and soles. There you go. Yan yon. Kaya letter dog yung pinili natin. Kasi yung boy and cat, sa normal patient yan. Dark skin siya, deeply suntan. Ganon. So 71, that's letter dog. Oh, Kapag nagpaitim sa sun, anong color ng skin niya? Dark na rin. Hindi ba lang nila yung wording? Okay, we were talking about the cyanosis for the peripheral circulation. Punta concept ito guys. Wait lang, nalilito. Okay. Ayan. So 71 letter dog po tayo. 71, that's dog. Again, number 71, that's letter dog. Number 72, nurse Mark D is caring for a client who is receiving total parenteral nutrition. The nurse implements which action to decrease the risk of infection? Okay, that's letter dog. Use aseptic technique in handling the TPN solution and tubing. Okay, number 72, that's letter dog. We're talking about the infection. Okay, so syempre, aseptic technique tayo. Yung closest kasi, kaya letter dog. 'Di ba we would want to answer sana palms or soles. Eh wala ka naman nakita doon. So nag-inner wrist tayo. Here. Inner aspect ng wrist. The closest to the palm. 71 dog. Okay. Number 73. Nurse Mark inserted NGT into the stomach of a client named Glenn and prepares to check for accurate tube placement. The nurse should avoid which least reliable method for checking the tube placement. Let's change our answer here to letter cat. Okay, so number 73, the best answer is letter cat, placing the end of the tube in water. Okay, to check for bubbling. Number 73, that's letter cat. So sobrang hindi siya reliable. Halos wala tayong makitang references or articles talking about this method. So 73, letter cat. Okay, number 73, letter cat. Sorry na po kung nagkakamali ka. Ako na namali pa, sorry po. Okay, pero ito talaga yung letter, ito talaga yung mga tamang sagot na binibigay ko sa inyo. No joke, okay, no joke. Okay, gusto bang tama ka pero alam mo naman deep inside mali ka? 'Di ba? So mas okay na alam mong mali ka outright, loud and proud. At least alam mo, 'di ba? So 73, that's cat. Least reliable kasi, alam mo, kung iisipin, halos lahat yan ay hindi naman talaga reliable. Pero kasi least, okay, so letter C. Okay, letter C tayo. Okay, number 73, that's letter C. Yun din po sabi ni Sir Lian, letter C din daw. Tsaka sabi rin to ni Sir Raymond, letter C. Hindi ko lang to sinabi. Okay, maraming nagsasabi. Okay, so 73, that's cat po. Okay, check your notes daw, sabi. Lalabas daw yun. 74, Nurse Mark is assessing a client who has just been measured and fitted for crutches. The nurse determines that the client's crutches are fitted correctly if letter apple. The elbow is at 30-degree angle when the hand is on the hand grip. Okay. Option letter A is talking about the angle of the elbow flexion, okay, which is about 30 degrees sana. So 74, that's apple. Number 74, that's letter apple. Number 75, minimizing risk of fall while ambulating a patient with the crutches. It involves which of the following? Letter boy, remove scatter rugs in the home. Of course, to reduce the risk of injury and falls, kailangan walang masyadong obstructions or obstacles doon sa bahay ni patient. So 75, that's boy. Okay. Bakit po letter apple? Why not letter apple? Because it will not necessarily assist the client while walking with the crutches. Diba? Tsaka limited ka lang na may crutches ka pa ba sa shower? Okay, so letter boy talaga yung best answer. It's okay. Okay, so number 75, that's letter boy. Again, paano po yung letter C, keep all pets out of the house? Hindi naman lahat ng pets ay trip hazard. Paano ko yung pet ko ay, let's say, lizard? Ganon. May pet lizard ako. Ganon. Ay, hindi naman siya trip hazard, right? So, okay lang yan. O kaya birds, o kaya fish, ganyan. Okay. So, 75, that's letter boy. Iba na ata kapag kuto na yung pet. Huwag kang ma-attach sa mga kuto, dapat tinatanggal yan. Okay, huwag kang ma-confuse kung ano yung pet sa parasite. Okay, number 76. When performing chest physiotherapy, Nurse Mark should know that's letter boy. It should be done anteriorly and laterally or only. Okay. Number 76, that's boy. Okay, number 76, that's letter boy. Yung letter C, it should be done at least 30 minutes before meals. Medyo masyadong maaga or mabilis. Yung 30 minutes, we could say 1 hour before the meals. Okay, and 3 hours after the meals. This is 76, that's letter boy. Balikan lang natin yung sa least reliable method to check for the NGT. Letter C po talaga yung tamang sagot doon. Yung end ng tube sa bubbles. Okay? Pero if you would try to read the choices, right, lahat naman sila kasi ay hindi na rin ginagawa. Lahat yan ay hindi naman din talaga reliable. Pero we have to choose the most best answer kasi. So letter C. Okay, letter C po. Okay, number 77. Research na naman. Nurse Camille performs a research study on the effectiveness of the use of warm saline solution as compared with the use of cool oatmeal bath to promote wound debridement among patients admitted with crusty and scaly skin condition. The most appropriate research design, that's letter C, experimental research. Again, okay, wag tayong lalayo na basta merong binigay, okay, na manipulation or intervention, that's automatic experimental. Okay, 77, that's cat. Number 77, that's letter cat. Again, number 77, that's cat. Tama naman po, yung 74. Tama tayo dyan. Pasok pa rin. So, if yung reference mo is 20 to 30 degrees, 30 degrees naman yung sinabi ng option letter apple, okay rin. Ganyan po ba yung type ng question sa board exams? Yes, ganito yung mga tanungan doon. This one is 76. Ayun. Palapit na ng palapit ang board exam. There is no room for overthinking anymore. Okay? I do believe, okay, that I live for art and I live for love, guys. Okay? Etong board exam, gusto kong i-apply yung quote or mantra ko na yon because as we know, nursing is both science and art. Right? Yung science part ng nursing is the actual profession itself, the actual things that we do sa nursing profession. But the art of taking the board exam, ito yon. Okay? It's how we do or answer the board exam per se. It's how we strategize in taking the board exam. That's the art of it. And I also would like you to appreciate the art of taking the board exam because syempre kapag binarabara natin, kapag minadali natin yung proseso, kapag walang art, walang quality on how do we handle this hurdle sa buhay natin, pangit din yung kalalabasan. Hindi rin natin ma-appreciate yung panalo natin sa dulo. So please ngayon pa lang, okay, i-practice nyo na, okay, yung deep appreciation sa process because it is worth it. Okay, worth it talaga siya. Okay, you also have to love the profession. Yung iba dito, I really understood na pilitan lang na mag-nursing for whatever reason, pero hindi ko na-explore yon. Pero still, you have to love the profession because na-endure nyo siya for 4, 5 years, 6 years even, yung iba 10 years na after graduate, tas magtitake na for the board exam license. So, I'm pretty sure na hindi naman puro, hindi naman natin inantagonize fully yung profession or yung process itself. I'm sure yung iba, torturous yung pinagdaanan, yung iba kailangan mag-endure talaga ng malala. Pero I tell you this, once you have and feel your own license on your hand na mismo, it's very, very worth it. Talaga, promise. And once you have your own license, no one would take it from you. Alam mo yun, hindi mo siya pwedeng masanla even kasi utak mo yun eh. That's your knowledge. Knowledge is power as well. Okay, so please be proud of taking the board exam and please be proud then once you finally pass and even top the board exam. Okay? Hindi ko alam kung paano tayo napunta dito, pero nakikita ko na naman si Queen Yasmin. Okay, mas nai-inspire tuloy ako lalo na mag-share ng knowledge. Okay? So yun guys, kapit-kapit lang tayo, malapit nang matapos to. We're all in this together. 'Di ba? Kailan ko kayo na-meet? January, May na, magkakasama pa rin tayo. Okay? Hopefully after this one, hindi na tayo magkita. Okay? At kung magkikita man tayo, sana as kulig na here in Top Rank. Okay? Ayan. So, balik daw tayo. Number 76, bakit daw letter boy yung tamang sagot? Okay, yung positioning ng chest physiotherapy yung gusto niyang i-focus dito. Okay, hindi po kasi matotolerate ng pasyente kapag naka-head down position, for example. Okay, so pwede pong side lying position yan. Okay, so 76, that's boy. 76, that's letter boy. Okay, number 77, that's letter cat. Again, number 77, that's letter cat. Number 78, if Nurse Camille utilized a sample those patients who were newly admitted in her floor, she's using what sampling method? Okay. More specifically, gusto sana nating hanapin yung convenience sampling. Yung kahit sino na lang. Ganon. Pero wala kasi dyan. So, letter dog tayo. Non-probability. O yung iba, after 13 years, tsaka magte-take ng boards. Okay, okay lang din yan. Okay, if it's for you, it's for you. Kukunin mo na lang yung blessing. I-claim mo na lang siya. Okay, so number 78, that's dog. Okay, number 78, that's letter dog. Number 79, Camille knows that the purpose of her study is letter apple, improve system of care. In general, di ba? Kasi gusto niyang, may gusto siyang bagong intervention, so that is towards the improvement of the system of care na gusto niya i-provide sa patient. Okay, so number 79, that's letter apple. Okay, number 79, that's apple. Number 80, the result of the study shows that both methods have proven to reduce crust and scales in patients' skin from mild to moderate condition or from moderate to mild. The method of measurement is, that's letter boy, ordinal. Okay, letter boy, ordinal. When you do your cupping sa CPT, di ba we could also do it anteriorly? So okay yung choice na yun. Okay, so 80, that's letter boy, ordinal. Ang palatandaan lang natin kapag nominal versus ordinal, kapag nominal, basta categories ng data. Okay, categorical data. Male, female, marital status, single, widowed, married, religion, Catholic, Muslim, Adventist. Basta categorical data, that's nominal. Okay? Kapag ordinal naman, it talks about the ranking. It talks about the ordering. Okay? Kapag binigyan ka po ng skills, as an example, kunwari, Likert scale, FACES scale, pain rating scale, basta may scale na nabanggit, that's your ranking, ordering, ordinal data. Okay? Kapag interval naman, that's the third level of measurement, is kapag wala ka pang no absolute. Okay, if you have no absolute, zero. Okay, ang pinaka-common na example nito, para lang hindi na kayo malito, isipin nyo lang yung temperature. Okay, ang temperature natin, pwede siyang mag-negative, right? You could have your negative 5 degrees Celsius, you could have your negative 30 degrees Celsius, and then, okay, the temperature of the water or the water itself is still present. Gets mo ba? Kapag kasi meron kang absolute zero, for example, sa ratio, sulat ko dito para makakompare natin. Okay? So here, kapag sinabi mong has absolute zero, pag zero na talaga, may meaning yung zero niya. So let's say, heart rate. Kapag zero na yung heart rate, zero na yan. Diba? Kapag zero na yung blood pressure, zero na yan. Wala na blood pressure. Pag wala na. Okay? Pag zero na yung RR, ganun din. Okay? Unlike, kapag zero na yung temperature, okay, may zero temperature pa rin, pwede pa siyang mag-negative. Yun yung pinaka-difference no ratio tsaka no interval. Okay? Ito kasi scale yung binigay sa atin. So, letter boy. Carry. Okay. Number 80, that's letter boy. 81. Napapagod na ba kayo? Another research study is entitled A Study on the Occurrence of Nightmares and Flashbacks Among Patients Who Were Victims of Domestic Violence, the Appropriate Research Design, that's letter boy, descriptive design. Okay, scriptive research yan. 81, that's boy. Again, 81, that's letter boy. Ito po yung number 80. 79, that's apple. 79 apple, number 80, that's boy, 81 boy, 82. The cause of the study in the above stated research study, that's letter boy, domestic violence. The cause of the study must be your independent variable. Okay, itong nightmare and flashbacks is the dependent variable. 82 boy, 82, that's letter boy, number 83. Okay, a study is entitled A Study on the Relationship Between Poverty and Mental Illness. To the given study, what is the research design applicable? That's letter apple, descriptive design. Okay, syempre may word na relationship, Susana correlational. Hindi na naman natin nakita dito, so letter apple tayo, descriptive correlational. 83 apple. 83, that's letter apple. 84, thesis in nursing is entitled Effects of Pre-Op and Non-Pre-Op Teaching on the Post-Op Pain of Patients at San Isidro Hospital. The appropriate design is letter boy, experimental pa rin. Ano yung manipulation mo dito? Yung teaching mismo. Okay, yan yung binigay mo, right? 84, letter boy, experimental. Okay. Ay, wait lang. Matatapos na yung yung NP4, pero hindi ko pa nadi-differentiate sa inyo yung experimental versus non-experimental. Baka lang may malito. So, basta experimental, may manipulation. Anything that you give. Meron din tong special criteria na dapat daw lahat ng ibibigay mo is beneficial to the patient. Okay, so for example, this one, health teaching, massage, guided imagery, yun yung mga manipulation beneficial. Okay, kapag naman non-experimental, basically, wala kang manipulation, wala kang ibibigay. Okay, bakit hindi mo pwedeng ibigay yung topic of interest mo? Because it could be harmful, it could also be unethical. For example, ang gusto mong focus ng study mo is about cigarette smoking. Diba? Pwede mo bang ibigay ang sigarilyo sa pasyente? Hindi po pwede. Okay, another example is the use of illegal drugs. Pwede mo bang ibigay yung drugs sa pasyente? Hindi po pwede, right? So kaya non-experimental design yung gagamitin mo kasi hindi mo kayang ibigay yung intervention na gusto mong pag-aralan. Okay, so with that, ano na mangyayari sa study ko kung hindi ko pala siya pwedeng ibigay? Instead, hahanap ka na lang ng population na inherent na sa kanila yung characteristic na gusto mong pag-aralan. Okay, so hahanap ka na lang ng tao na nagda-drugs na, nag-addict na. Okay, as your subject, maghahanap ka na lang ng subject na naninigarilyo na in the first place so that hindi mo na siya ibibigay. Okay, but still, non-experimental yan. Okay, so yun lang yung pinaka-difference na experimental tsaka non-experimental. Titingnan mo lang yung independent variable kung kaya mo ba siyang ibigay or kung hindi mo siya kayang ibigay. Kasi kung pwede mo siyang ibigay, experimental. Kung hindi mo siya pwedeng ibigay, non-experimental. Okay? So, yun lang. Hinabol ko lang kasi patapos ni NP4, hindi pa siya nababanggit. Okay. Kapag non-experimental, if you would notice, yung independent variable sa study ay hindi mo siya po pwedeng ibigay, hindi mo siya kayang ibigay. For example, illegal drugs, maternal age, yung mga age, hindi mo naman pwedeng ibigay yan, cigarette smoking, ganyan. Okay? So instead, hanap ka na lang ng population na inherent na sa kanila, okay, na naninigarilyo na or nagda-drugs na in the first place para hindi mo na siya ibibigay. Okay, so kapag wala kang ibinigay na manipulation, okay, non-experimental yun. Ang case study that is under your qualitative research, qualitative ang research. Meron kasing descriptive na non-experimental. Okay? But the case study, it falls under the quali. I hope I answered your question. Nag-make sense ba yung sagot ko? Ayan. Kasi kapag descriptive na non-experimental, quanti yun. Eh yung case study kasi quali. Along with your historical, your phenomenological, mga ganyan. Grounded theory, quali yun. Carrie, 84, that's boy. 85, based on the above stated research problem, yes, tama yan. Okay, the researcher knows that the cause of the study is letter boy, absence and presence of pre-op teaching. So 85, that's boy. 85, that's letter boy. Ang criteria for the population, we're talking about the sampling techniques naman yun. Diba? So if you have your criteria for the population to get your sample, that would be your purposive sampling. Okay, so 86, the proper method to measure the result in this study is through letter boy, ordinal. Okay, bakit nga ulit naging ordinal? Balikan ko nga. Okay, the pain of the patients kasi pain rating scale. So pag may scale, ordinal siya. Ganon. Okay, so 86, that's boy. 86, that's letter boy. Number 87, while looking for a sample that will be involved in this study, the nurse researcher immediately chose all surgical patients listed and recorded in her shift in the OR as her sample. This sampling is called letter boy, incidental sampling. Okay, incidental sampling. Pag numerical na pain scale, yes. So ordinal siya. Di ba lahat ng scale ay ordinal? Kaya ordinal tayo. So 87, that's boy. Number 88, a study among children who were victims of child abuse was conducted by a group of nursing students. During the data collection stage, a patient became numb, speechless, and quiet upon seeing that the appearance of the interviewer was similar to his aggressor. Okay, this study is called, as this method is called, nalulurler na yung gumawa ng question. Hindi niya na alam kung anong itatype niya. Okay, but the best answer is letter C, experimenter's effect. Okay, pag sinabi mo pong experimenter's effect, that is the tendency on the part of the researcher to influence the participant. Okay, sabi kasi no subject, parang kamukha mo yung aggressor ko. Di ba? So, experimenter effect yun. Nagkaroon ng influence si researcher towards the subject. Okay? At ito po experimenter's effect, it could be positive or negative way. Okay? Basta na influence mo siya, experimenter's effect yun. Okay? So, 88, that's letter cat. Okay? Number 88, that's letter cat. Okay? 88, that's cat. Number 89. Yes, kapag pain rating scale, ang focus kasi is, ginawa mo siyang scale, automatic ordinal. Basta scales, automatic ordinal yon. Okay? Number 89, if the anxiety levels of the victims were surveyed successively by the researcher over an extended period of time, this method is called letter apple, longitudinal. Longitudinal po yan. Okay, so 89, that's apple. Okay, kapag reactive effect naman, ito yung tipong the subjects that you're trying to observe would behave less naturally kasi alam nilang pinapanood sila. Okay? Parang rin siyang somewhat na hot turn effect. Ganon. So 88, letter C pa rin. 88, that's cat. 89, that's apple. Last na talaga to, guys, promise. Gusto ko lang i-explain yung age. Saan natin yan ipapasok? Ratio or interval? Kasi yung iba nalilito pa between ratio and interval. Okay. Ayun. May sumagot na ng interval. But this one is ratio. Diba? Kasi pag zero na yung age, zero na talaga. May meaning yung zero mo. Pero kasi, meron akong nabasa na isang article na nilagyan niya ng asterisk yung word na age. age, pero under ratio pa rin siya because kapag mag-a-apply tayo ng cultural factors, in some culture daw po kasi, nasa loob pa lang ng chance si baby, kino-consider na yung age as 0. So with that, nagiging interval siya. Okay, so magkakatalo lang naman. Okay, yes. So kapag dinagdagan mo ng culture aspect, nagkakaroon na ng 0, kaya interval na siya. Oo. So for you not to be confused with ratio or interval, isipin mo na lang, kapag nag-0 tong value na to, ay 0 na talaga. Hindi na siya mag-exist anymore. Okay, ganun yung ratio. Okay? Yes, siningit ko lang. Proceed, number 90. A study that a nurse researcher initiated is the sudden increase in the turnover of nurses in hospital who utilizes autocratic leadership style. The presumed cause of the study is called letter apple, autocratic leadership. Presumed cause, so this must be your independent variable. Okay, so 90, that's apple. Number 90, that's letter apple. Number 91, the independent variable is study on the effects of frequent hospital visit by family members on the ICP. So again, yung secret natin, basta the word after the word effect is your independent variable, that's letter apple, family visit. Okay, 91, letter apple. Konti na lang, guys. Kapit-kapit tayo. Okay, 92. Well, the dependent variable in the above stated research problem is letter boy, ICP. Okay, so 92, that's letter boy. Again, number 92, letter boy. 93, ICP as the data collected by Marco in his study is usually measured by what method? Okay, letter dog, ratio method. So may meaning yung 0 niya. Pag 0 ICP, wala na ICP. 0 is 0. Okay, 93, that's dog. Okay, number 93, that's letter dog. Uy, gusto ko yung meme nyo kay Sir Daclisa. 94, the method to be used in accordance with the data collected in this study is letter boy, quantitative method. Okay, syempre quantitative, may measurement ng mga data, so quanti yan. Okay, ang ICP kasi, di ba, kapag 0 na yung ICP mo, 0 na talaga, so that's ratio. 0 is 0. 93, that's dog. 94, that's boy. 95, Marco is formulating his research problem. He knows that the following are sources of research problem except, that's letter dog, workplace of nurses. Okay, baka lang may magtatanong, bakit po workplace of nurses? Okay, pwede nating i-consider yung clinical experience sa workplace ng mga nurses. But just because may word na workplace of nurses, it doesn't necessarily mean or automatically mean na merong clinical experience. So 95, that's letter dog. Okay, number 95, that's letter dog. Again, 95, that's dog. 96, Marco knows that the following are the considerations to determine a good problem. Which one is the least given consideration? That's letter dog, available instrument. Okay, 96. Nag-iwan na yung pronunciation ko, guys. 96, that's letter dog, available instrument. So, ito naman po is papasok sa concept ng feasibility of the research. And just because hindi available yung instrument mo by the time or by the start of your research, doesn't mean na hindi siya feasible because meron mga study na pwede tayong gumawa ng instrument along the way. Right? So ito po money, it talks about the financial aspect of your research. Okay, so kasama yan, yung funding, kumbaga. Diba? So 96, that's letter dog. Okay, so 96, that's letter dog. Again, number 96, that's dog. Number 97, Marco is conducting a study entitled the Study on the Status of Enrollees among nursing schools in Manila. The appropriate research design is letter apple, descriptive research. I-describe mo lang yung study ng mga, yung status na enrollees. So 97, that's apple. Again, number 97, that's letter apple. Number 98, if Marco takes a part of the population to whom he will observe the phenomena during collection, this is letter C, sampling. Uy, dumadali. Dumadali na yung questions. 98, that's cat. 98, that's letter cat. One more, number 98, that's letter cat. Number 99, if Marco instead collected data from his sample coming from premier nursing schools in Manila, what sampling technique was utilized? Okay, ngayon meron siyang criteria na sinabi, medyo naging choosy siya dito or hinandpick niya mismo yung magiging parte ng study niya. So that's letter boy, purposive sampling. Okay, 99, that's boy. Number 99, it's letter boy. Last, number 100, Mark knows that the purpose of the review of literature is letter boy to provide a theoretical framework of the study. Okay. Number 100, that's letter boy. Questions pa more. NP4 guys, congrats naman at natapos natin na itawid yung NP4. So with that, let's have your next break, next morning break. Okay, so on my clock, it's 11:02 p.m. a.m. rather. Balik na lang po tayo after 10 minutes. Okay, working lunch na lang tayo. Hindi na ako makapagbigay no lunch time kasi. Okay, so 10 minutes lang yung kaya kong ibigay. For sure, matatapos tayo na maaga. Okay, thank you so much guys. Thank you. Para makapagpahinga pa kayo after. Required yung second break, so go lang. Enjoy nyo yung 10 minutes break. Thank you guys. Ano po yung ginamit kong pencil sa boards? Yung Mongol na number 2. Yun yung ginamit ko. Anong passing? Let's say 65 yung passing. Sana umabot ka sa 65. Dami ko namang kamukha, nakakaloka. Na-estimate mo ba ilan tama mo nung nagsasagot ka? Hindi. Hindi ko na-estimate. Kasi umiiyak lang ako lagi pagkatapos. Charot! Hindi ko na siya inisip after. Uy, yung iba mag-break lang nagchichikahan lang kami dito. Nag-top 7 po si ate girl. Ayan. Top 7 po siya. Ano po yung study habits or routine? So top rank in the morning, tapos yung gusto kong pag-aralan sa gabi. Basa lang, basa-basa, answer question, basa ulit, tapos answer question. Ganun lang, kung ano sinishare ko sa inyo, ganun at ganun lang din yung ginagawa ko. Ano ang mas mahirap? Pre-boards 2 or board exam? Incomparable, I could say. Hindi mo siya maka-compare. Iba yung level of difficulty ng top rank question sa actual board. Sabi nila mas mahirap daw yung sa top rank. May lumalabas po ba from the past boards? I could say yes, may lumalabas. Pero hindi man siya exactly word by word lalabas. Yung kamukha niya, lalabas siya. Colored hair. Mas okay siguro kung bibisitahin natin yung PRC na guidelines. Kasi nag-update sila every time eh. So para lang mas sure. Food tips during the boards. Hindi kasi ako kumakain masyado. Pero ang binaon ko nung board exam ay dapat fast food. Pero kasi kasagsagan yun ng pandemic, so sarado pa yung mga fast food by 5 o'clock. Kasi di sa 24 hours. So nag 7-Eleven na lang ako. So bumili po ako ng siopaw, tapos Gatorade na color blue ata, tapos may chocolate akong dala. Ganun. Yung tatlong yun yung snacks ko nung boards. Di ko alam kung nakatulong ba siya or what. Nagte-take po ba ako ng vitamins? Well, since kasagsagan ng pandemic, vitamin C is one, ferrous sulfate, tapos vitamin E for the skin. Pwede pong kumain ng candy during exam? Yes, pwedeng kumain during exam. Nung board ko, anong communicable disease yung lumabas? Scabies. About scabies siya. Sobrang nakakainis kasi relatively napakadali, pero hindi ko rin siya inaral. Umabot ba kayo ng 75 plus sa pre-boards? Hindi nga. Nakakahiya yung score ko sa pre-boards. Patapon din ako nung top rank student pa ako. Di ba nga yung kwento ko, yung mga batchmates ko sa UP, nakakalat yung pangalan nila sa top 1 to 50, tas walang JD Rojas doon. So, hindi ko rin alam kung bakit ako pumasok sa top. Kung anong nangyari. Pwede po ba yung black pants, white shirt with collar and white shoes? Yung mga ganyan po ay hindi ko po directly masasagot. Paki-check na lang yung PRC guidelines. Mas okay kapag yun yung ano. Magkano po yung nakuhang pera nung nag-top notcher? Iba kasi yung mundo ng UP eh. Palakpakan lang na may kasamang sigawan. Wala pang atang sigawan. Internal screaming lang ata yung nangyari. Ganon. Yun lang yung reward kapag nagtatop. Congrats, congrats. Ganon-ganon lang. Um, Naniniwala ba? And may ginawa ba kayong pamahiin? I was too anxious to even think about the pamahiin during the board exam. Ang arte talaga magsalita. Nakakaloka. Wala akong nagawang pamahiin. Hindi ko siya naisip. Ewan ko kung bakit hindi ko siya naisip ng time na yun. Ano ba yung mga nakuha niyong mataas na score? Siguro 60, sobrang saya ko na. Ganon. Pag nakaka-60 ako sa recalls tsaka sa PB. Pero napakadalang naman ata nun. 55. Average score ko ata nun. 55. Hindi ko na nagawa yung red underwear. Si Dr. Hindi ko po sila kilala. I'm sorry. Gwapo ba sila? Charot. Paano po grading sa board? Wala pong nakapagsasabi, in all honesty, kung anong ginagawa nilang grading sa board. Sabi daw kung ano yung highest scorer, sa kanya magde-depend yung ibang scores ng ibang students. Yung score ko sa pre-boards, lowest, 84 ata. Hindi ko na sure eh. Hindi ko na sure. Ay, sige po. I-message niyo lang po ako if you want me to sharpen your pencil. May plans po ba kayong mag-abroad? Sa ngayon, wala po. Pero I'm not closing any doors. Ang funny. Dapat po ba kaming kabahan kasi kasabay namin yung mga taga-UP? Bakit? Anong meron sa mga taga-UP? Anong factors? Anong reason? Paano mo nasabi yon na dapat kang kabahan kapag kasabay mo yung mga taga-UP? Masyado mo namang nilalagay sa pedestal yung mga taga-UP. Okay, hindi naman kami ganon ka-extraordinary. Same lang din naman yung mga kinakain at nilalanghap naming hangin such as yours. So there's no need to be overwhelmed and overly competitive kapag may mga taga-UP kasi um, pare-parehas lang tayong students here. Hello sa mga taga-UP. Ayan. Karina? Si Sir John. Hindi ko na siya naabutan. Dito ba? Hindi siya familiar, I'm sorry. Is it true ba na mag-based sa DOH? Uy, 2 minutes na lang tapos tuloy na tayo. Is it true ba, ma'am, na mag-base sa DOH White Book kaysa kayo maglaya pagkasabay mga taga-UP? Alam mo, meron sa mga taga-UP, hindi. Huwag niyo isipin yung mga taga-UP. Isipin niyo lang sila as normal, healthy individuals. Okay? Pare-parehas lang po tayo. Okay? Wala pong bearing kung magte-take yung mga taga-UP ng board exam. Wala namang ganon. Hindi yun na-meet si Sir Lian. Why? Ay, sorry. Okay. So, si Sir Octubre pala, tsaka si Sir EJ. Oo naman. Oo, na-meet ko sila. Online lang, hindi personal, sayang. Pinaka-lowest score, siguro 22, 24 ata. Pre-boards 1 ata ko yun. Okay? Yung isang Daklis. Wala pa po akong nami-meet na lecturers. Ano pa lang, sila Sir Ken, Sir Keith, si Ma'am Heidi, si Sir V, syempre, si Attorney Kapili na-meet ko na. Si Mommy Doc na-meet ko na. Okay. Sino po si Sir V? Seryoso ba yan? Karina ba? Okay, hindi na po. Nag-top rank na po si ate girl. Ayan. All right, so we're down to the last stretch and final stretch of our lecture discussion for today. I hope marami po kayong natututunan kasi kung wala po kayo natututunan, magre-resign na po ako. Deserve niyo po na mas magaling na lecturer. Okay, so here naman, NP5 ratio, if you would notice, I read the material. It's very, very easier to understand in comparison to other recalls and even sa pre-boards 1. Okay, so hindi kailangan na masyadong maraming brain cells na masasayang dito. Okay, ipe-preserve natin yung brain cells sa actual board exam. Okay, so ito ay aalagaan lang natin, ino-nurture, papalakihin, papakainin, ganon. Okay, para sa actual boards is ready to fight ang mga brain cells. Ngayon dito chill-chill lang sila. Okay, yung brain cells nyo yung tinutukoy ko. Alright. Situation number 1. Pwede po bang pa-type ulit no ready na para alam ko pong nandyan tayo? Kasi umuunti tayo, guys. Ayan, please. Okay, para alam ko lang. May mga corrections along the way, pero wag natin gawing big deal. I-change na lang natin to the final answer. Yun yung mas importante. Alam natin yung final answer. Alright? So number 1, as Nurse Winnie prepares to administer a medication to Marielle diagnosed with a borderline personality disorder, Marielle says, just leave it on the table. I'll take it when I finish combing my hair. What is the nurse's best response? Uy, borderline personality disorder. Alam naman natin, sila ay medyo may pagka-manipulative in a sense. So letter C tayo. Say to Marielle, I must watch you take the medication. Please take it now. Okay, so here, if you answer option letter C, you could be using your non-judgmental language, your matter-of-fact tone, okay, para hindi rin magiging defensive si patient. So number 1, that's cat. Number 1, letter cat. Again, number 1, that's letter cat. Number 2, Marielle has a history of self-mutilation and suicide attempts. She reveals feelings of depression and anger with life. The psychiatrist suggests the use of a medication and which type of medication should the nurse expect. So, syempre, gusto natin yung medication na merong fewer side effects. Okay, number 2, it's letter apples, SSRI. Selective serotonin reuptake inhibitor. Safest, right? Yes, correct. Okay, so number 2, that's apple. Number 2, that's letter apple, one more. Number 2, that's apple. Number 3, one day, Mariel's boyfriend visited her beyond visiting hours. When the security guard inhibited him from entering the hospital, he made threats against staff, ripped art off the walls, and thrown objects. Astonished by his behavior, the security guard used force to stop him. Soon he was detained in the police community precinct. The nursing diagnosis for Manuel's boyfriend is letter boy, risk for other directed violence. Obviously, kaya po humaba yung tanong kasi binild up niya yung situation for us to be lead to letter boy as the final answer is for other directed violence yan. Okay, so number 3, that's letter boy. When you say other directed violence, okay, pwede siyang mag-impose ng harm sa other tao. Meron na ba siyang nasaktan? Wala pa naman. Okay, so risk yan. So 3, letter boy. Number 3, letter boy. One more. Number 3, that's letter boy. Number 4, Mariel used manipulation to get his needs met. Okay, lalaki din pala si Mariel. We like this. The staff decides to apply limit-setting interventions. What is the correct rationale for this action? That's letter C. External control are necessary while internal controls are developed. Okay? Kapag wala kang internal control, dun po lumalabas yung manipulative behaviors natin. For example, lying, cheating, flattering other people, mga ganyan. And for us to be protected with those manipulative behavior, you have to set your limits. Yun po yung external control na binabanggit sa atin. So number 4, that's cat. Number 4, that's letter cat. Siya na to. We remember someone. Sino yan? Okay, ilabas niya mga pangalan na yan. Okay, number 4, it's letter cat. Hindi niyo sila deserve, guys. You deserve someone better. Okay, number 5, for which behavior? Okay. Mahal ko mahal, yes. Okay, pero kapag ganyan nagkakasakitan na, whether emotionally or mentally, physically pa yan, okay, iwan mo na, please lang. Okay, for which behavior of either Mariel or her boyfriend would limit setting be most essential? Okay, that's letter boy, flirtatious and provocative with staff members of the opposite sex. Okay, so number 5, that's letter boy. Okay, number 5, that's letter boy. Again, 5 boy, number 6. All right. So here naman, kung papansinin mo yung mga choices, parang lahat naman sila, di ba? Manipulative. Pero kasi ipa-pattern natin yung sagot natin sa kung anong meron si Mariel. Meron siyang borderline personality disorder. Okay, so letter boy yung mas appropriate na isasagot natin. Okay, so number 5, that's boy. Okay, 5 is boy. Number 6, which of the following nursing measures should receive priority in the client's plan of care after eye surgery? Yun na yun. Letter apple, prevent increased IOP and infection. Okay, taking note of the situation, clients with glaucoma. Ganun lang yung situation. Clients with glaucoma. Okay, so 6, that's apple. Okay, so number 6, that's letter apple. One more, 6, that's apple. Number 7, the nurse is administering an adrenergic blocking agent such as beta blocker to a client with glaucoma. Which of the following would the nurse interpret as of a serious adverse reaction? Okay, some of you would say letter dog, exacerbation of asthma. Pero hindi kasi siya indicated sa situation or sa kwento na may asthma si patient. So ano mag-exacerbate doon? Okay, so letter C tayo. Okay, so number 7, letter C. Okay, pwede siyang magkaroon ng drop in the BP na very unsafe yung levels, hypotensive. So 7, that's cat. Number 8, which of the following is essential that the nurse includes in the assessment of a client who works evenings and takes pilocarpine? Ayan na naman tayo. Okay, so pharmacology question na naman. So isa-isahin lang natin. So when you say pilocarpine, okay, that is an example of your cholinergic drugs. Okay. So pilocarpine, one of your example of cholinergic drugs, one of your anti-glaucoma medications. Okay. Kapag ito ay pinainom natin sa pasyente, syempre, babagsak or bababa yung IOP ni patient. Okay. The pupil will be smaller. So magkakaroon ka ng myosis dito. Sulat ko pupil smaller. Para lang mas magets nyo. Okay? So the pupil will be smaller to make more room, okay, between the iris and the lens. Kasi doon po dumadaan yung fluid, right? Yung fluid natin. Therefore, kaya bababa yung IOP mo. Okay? So ngayon, kapag lumiit po yung pupil ni patient, it will now not let adequate light to pass through. Okay? So mahihirapan po si patient na makakita, okay, na mga bagay-bagay sa buhay, especially pag sa gabi or especially sa dim lights. Okay? Yun kasi yung kwento on the evenings now. So letter dog tayo, decreased dark adaptation. Okay? So number 8, that's letter dog. Dagdagan natin. So pupil smaller, make more room to iris and lens. Okay. Tapos, for fluids to flow. Yan, for fluids to flow. Therefore, bababa rin yung IOP mo. Ganon. Pero ito yung effect. Number 8, letter dog. Number 8, that's letter dog. Okay, number 8, that's letter dog. Yung difficulty no level no exam depende on how much you prepared for it. So kapag prepared ka, madadalian ka. Okay, so number 9, one of the problems with structured interviews is that's letter C. The questions are all asked in the same order. Okay, so there are 3 types of interview na pwede natin gamitin. The very first one is the structured interview. This one is the most rigid kind of interview because kung ano po yung nakasulat sa questionnaire, hindi ka po pwedeng lumabas doon. Okay, hindi ka rin po pwedeng magkaroon ng follow-up questions. Pero kapag ang ginamit natin is semi-structured interview, okay, ito yung mas recommended because you have your questionnaire at hand and you're also free to have your own follow-up questions. Mas okay. Okay? Kapag naman sinabi mo unstructured interview, ito naman yung anything under the sun, wala kang prepared questions, pero may papel ka pa rin na hawak. Ano yung nakasulat doon? Yung topics mo as a guide doon sa interview. Okay, so yun yung difference ng structured, semi-structured, and unstructured. Okay, so number 9, that's cat. Okay, number 9, that's letter cat. Again, number 9, it's letter cat. Baka bumawi kayo sa susunod na questions. Okay, number 10, an ethnography is letter apple. Interview with cultural minority. Okay, so number 10, that's apple. Kapag ethnography, ang focus niyan, culture, languages, artifacts, dialects, mga ganyan, tribes, ganyan. So number 10, that's apple. Finally, tumama din. Number 10, that's apple. Number 11, the advantage of observation over interview would be letter boy. Observation enabled the recording of actual behaviors rather than subjects' interpretations. Okay, so number 11, that's letter boy. Okay, number 11, that's letter boy. Number 12, participant observation may be defined as, letter C, participation in a group while studying it. Ganon. Balikan nyo lang yung core experience ninyo. In a way, di ba, parang may participant observation din tayong ginawa doon. Kasi nag-immerse tayo sa community firsthand. Okay? Pero inaaral din natin sila at the same time. So 12, that's cat. Number 12, cat. Number 13, one of the major problems associated with the use of participant observation as a research strategy is letter dog, may cause unrest among the samples. Okay, sa itong participant observation na to, if you want to use this as your technique or method, okay, to gain knowledge and data, okay, towards your subject, kailangan meron ka munang dalawang hurdle na ma-overcome. Okay, so number 1 hurdle, kailangan ma-establish mo muna yung rapport, okay, doon sa patient or doon sa group of subjects mo. Okay? Kasi syempre, kapag wala kang rapport, kapag wala kang trust doon sa subjects mo na gusto mong samahan, they would become uncomfortable with you or towards you. Pwedeng i-outcast ka rin nila. Okay? The next one, dapat meron kang actual entry doon sa group that you're trying to observe. Syempre, participant observation. So, dapat ma-penetrate mo yung mundo nila. Okay? So, kapag hindi mo nagawa yung dalawang yon, pwedeng hindi maging successful yung participant observation mo. Okay? So, number 13, that's letter dog. Okay, may cause unrest among the samples. Number 13, that's dog. Again, number 13, that's letter dog. Number 14, general a patient experiencing mania. Started to experience signs and symptoms 2 weeks ago. She was very talkative, running from one topic to another. And she has not eaten or slept for 3 days. While inside the psych ward, general threatens to hit another patient, which comment by the nurse is appropriate. Yun na yun. Mapanakit na si patient. That's letter C. Do not hit anyone. If you're unable to control yourself, we will help you. It's very, very assertive, very, very directive, at the same time, matter of fact manner. Okay, so 14, that's cat. Number 14, letter cat. Number 14, cat. 15, this nursing diagnosis applies to Janella. Imbalanced nutrition, less than body requirements related to insufficient caloric intake. Select the most appropriate outcome. That's letter boy. Drink 6 servings of high-calorie, high-protein drink each day. Okay, so 15, that's letter boy. Okay, hindi kasi kayang gawin ng isang manic patient ang consistently sit for at least 30 minutes. Hindi niya kayang gawin yan. Okay, so letter boy tayo. Okay, so number 15, that's letter boy. Again, 15 is boy. Number 16, General develops mania after discontinuing lithium. New prescriptions are written to resume lithium twice daily and begin olanzapine. The addition of olanzapine to the medication regimen will letter dog provide long-term control of hyperactivity. Okay, so number 16, that's letter dog. So according to our pharma handbook or drug book, yung mga antipsychotics natin, diba, they have this power to reduce the hyperactivity of our patients and at the same time, yung sedative powers nila in the long-term process. Okay, so 16, that's dog. Okay, 16, that's letter dog. Again, number 16, that's dog. Number 17, since Janella with an episode of mania is hospitalized, what initial nursing intervention is a priority? Letter boy, set limits on the patient's behavior as necessary. Okay. Siyempre, ang patients natin na merong mania, meron din silang capacity na maging aggressive. Okay? So, you also have to maintain the safety as well by setting limits. 17, that's boy. 17, letter boy. Again, number 17, that's letter boy. Number 18, a patient diagnosed with bipolar disorder has been hospitalized for 7 days and has taken lithium 6 times daily. Staff members observe increased agitation, pressured speech, poor personal hygiene, hyperactivity, and bizarre clothing. What is the nurse's best intervention? Again, medyo mahirap siyang intindihin, but I would like to change our answer here. It's supposed to be letter boy. Okay? Highlight muna natin yan. Isa-isahin natin para ma-finalize natin na letter boy yung sagot. Okay, letter apple, educate the patient about the proper ways to perform personal hygiene. Okay, hindi kasi yun yung issue niya per se. Hindi mo siya na-directly address yung concern ng question. So, X yan. Okay. Letter C, ask the healthcare provider to prescribe an increased dose and frequency of lithium. Parang it's too early to do this. Parang may kailangan ka pang gawin bago itong intervention na to. There's not enough cues for you to say letter C. Okay, so X din to. Ang letter dog naman, consider the need to check the lithium level. Okay, tama sana siya. Right? Assessment of the lithium level. Pero kasi sabi niya, the patient may not be swallowing medications. Where in fact, the actual question told you na in-ingest naman niya daily. Okay? The patient is taking lithium daily. Okay, so mali kasi yung second statement. Okay, letter boy po yung best answer natin apart from our elimination technique. Okay, meron din kasi tayong konsepto na tinatawag na therapeutic lag. Okay, may delay po sa therapeutic effects ng mga psychotropic medicines natin. Hindi lang po ito exclusively available or exclusively applicable sa mga antidepressant meds natin, right? Pwede rin po siya sa lithium. Sabi daw, according to references, at least 6 to 10 days, tsaka lang mag-e-effect yung lithium. Okay, ilang days pa lang ba siyang hospitalized? 7 days. Okay? In some other references, they would even tell you 1 to 3 weeks pa nga daw bago mag-take effect yung lithium. Okay, so letter boy tayo. Continue to monitor and document the patient's speech patterns and motor activity. Okay, so number 18, that's boy. That's the final answer. Yan. So I hope we're okay here. Sana mas naintindihan natin kung bakit ito yung sagot. 18, that's boy, because of the therapeutic lag of the medicine. Number 19, because a client with glaucoma is scheduled for removal of a cataract from the left eye, the nurse anticipates an order from the surgeon to administer which of the following drugs. Again, baka yung iba may magko-contest na bakit po hindi letter apple atropine, since ito po ay mydriatic effect, tapos isa-surgery daw si patient. So kailangan kasi nating tingnan holistically yung question at pagsama-samahin yung concepts na binibigay sa atin. Okay, si patient kasi ay may glaucoma, very good. Okay, along with the removal of the cataract. So ito pong acetazolamide is an example of your what specific drug classification? Medyo mahaba eh. Okay, that's your carbonic anhydrase inhibitor. Okay. So ito po mga carbonic anhydrase inhibitor natin such as your acetazolamide. Some studies would show na effective daw po ito as prophylactic medicine, okay, to reduce the patient's IOP as the patient with glaucoma is undergoing your cataract removal. So 19 letter cat. Okay, prophylactic na yan para hindi tumaas yung IOP. 19 letter cat. Again, 19, that's letter cat. One more, 19, that's cat. Number 20, which of the following activities greatly increases the client's intraocular pressure after an eye surgery except. Okay, may word na except. And I read a lot of references just to finalize our answer here. Letter C talaga yung tamang sagot. Wearing of the tight shirt colors. Okay, especially sinama mo siya sa group of choices na to. No, obviously, except kasi, right? No, obviously, nakakapag-increase ng IOP such as sneezing or coughing, okay, the straining even, okay, sexual intercourse even, di ba? So wala na tayong ibang pwedeng masagot, letter C. Okay, so 20 letter C, wearing tight shirt colors. Okay, it does not necessarily increase the IOP of the patient. Tapos sinabi niya pa dito, greatly increase pa. Oh. So letter C. Ganon. So number 20, that's cat. Nadali. Number 20, that's letter cat. Okay. Number 21, which is considered as the earliest sign of increased ICP that the nurse closely observed. That's letter dog, progression from restlessness to confusion and disorientation to lethargy. We know this very well, that one of the earliest sign of increased ICP is the changes in the level of consciousness. So letter dog tayo. Okay, letter dog tayo. Seryosong question ba yun? Para daw nakaka-increase na IOP ang sexual intercourse? So, imagine nyo lang, how do you do your sexual intercourse? So, pwedeng mag-increase din yung abdominal pressure mo. In short, okay, long story short, yung mga pressure sa katawan natin, pwedeng mag-increase yan. Due to our positioning, yes, correct yan. Okay, ganon. So, in time or in turn, pati yung IOP affected na rin. Ganon. Okay, so 21, that's letter dog. 21, that's letter dog. Number 22, which is irrelevant in the pharma management of a client with CVA, that's letter apple. Osmotic diuretics and corticosteroids are given to decrease cerebral edema. Okay. Medyo tricky lang din isagot itong tanong na to because halos lahat pwedeng tama. Okay. Taking note of the word irrelevant, dahan-dahanin ko lang. Okay. Tapos, CVA daw. So, this must be the stroke. Okay. Sa unang basa, ang letter apple parang tama. Osmotic diuretics and corticosteroids are given to decrease cerebral edema. Okay? So tama yan. Okay? Ang corticosteroids in the context of decreasing cerebral edema is only applicable kapag ang situation ng pasyente is may tumor siya. Okay? Not necessarily kapag may stroke. Okay, and if you would try to read more, ang corticosteroids daw in the management of your stroke to decrease your cerebral edema, ginagamit siya sa practice, pero the research would found out na wala naman talagang maximal benefit na naidudulot yung steroids dito sa case ni patient. Okay, ang letter boy, anticonvulsants given to prevent your seizures, pwede rin. Okay. Letter C, thrombolytics are most useful. Yes, pwede rin for the stroke. Letter dog, aspirin is used in the acute management of a complete ischemic stroke. Okay. For sure, yung iba sa atin ay letter dog yung sinagot kasi parang very wrong siyang pakinggan. Pero kasi ang aspirin, ito talaga yung recommended, okay, within 24 to 48 hours after the stroke onset. Okay, mababasa niyo to kay Brunner, guys. Okay naman gumamit na aspirin. It's just that hindi na siya pwedeng gamitin after, okay, beyond 24 hours kasi dun mas magi-increase yung bleeding. Okay, so ang pinaka-pinili natin is letter apple. Irrelevant in the CVA because of the corticosteroids. Okay, so 22, that's apple. Again, number 22, that's letter apple. Pero pwedeng gumamit ng corticosteroids to reduce your cerebral edema kapag tumor yung nagkukos nung increased ICP na yon. Pero kapag stroke kasi yung issue, walang benefit yung steroids. Okay, sa management. Although in practice, ginagawa siya. Okay, so 22, that's apple. Yes, yung negative kasi yung hinahanap, irrelevant daw, yung mali. So letter apple. Okay, so 22, that's apple. 23, Ivan is a 20-year-old communication arts student. Thinks that his roommate is trying to poison him. He was admitted in the psych ward because this has affected his performance at school and his classmates were afraid that he might hurt them. So obviously, ang nangyayari kay patient ay nagiging paranoid na siya, right? At ang paranoid, as a psych concept, may master's degree na kayo dito kasi Diyos ko naman, di ba, from refresher, na-encounter niya na ito. So number 23, in the psych ward, he has refused all hospital meals for 3 days, which intervention is most likely to be acceptable to Ivan. Okay? Meron kasi siyang trust issues. Letter apple, allow Ivan to have supervised access to food vending machines. Okay? Kapag ginawa mo yung letter dog, tube feedings, TPN, mas magi-increase yung anxiety niyan. So, hindi pa tayo magre-resort sa intervention na yan. Letter apple muna tayo. Okay, so 23, that's apple. Okay, number 23, that's letter apple. Again, number 23, that's apple. Number 24, even examine the voices are bothering me. They yell and tell me I'm bad. I have to get away from them. Select the nurse's most helpful reply. Okay, that's letter C. I will stay with you. Focus on what we are talking about, not the voices. Okay, so 24, the final answer here is letter C po. Okay, so offering the self, yes, correct. Keeping the patient safe. Okay, so 24, letter C. Most helpful reply. Ganon. Okay, so 24, that's cat. 24, it's letter cat. Ba't kayo nagti-thank you sa akin? Pag tama kayo. Okay, deserve nyo yan. Number 24, that's cat. Number 25, Ivan has taken flu 5 mg orally twice daily for 3 weeks. The nurse is now assessing a shuffling propulsive gait, mask-like face, and drooling. Which term applies to these symptoms? That's letter C, pseudo-Parkinsonism, or the drug-induced Parkinsonism. So 25, that's cat. Okay, 25, that's cat. Okay, number 25, that's letter cat. Ano yung 25 letter dog? Anong keyword natin dito para masabi mong akatisha siya? Para wala no confusion. Ano to? Restless siya. Okay, inability to sit, ganyan. Okay, so 25, that's letter cat. 25, that's cat. Number 26, acutely violent patient diagnosed with SCITS received several doses of haloperidol. 2 hours later, the nurse notices the patient's head rotated to one side in a stiffly fixed position. The lower jaw is thrust forward and the patient is drooling. Which intervention by the nurse is indicated? Okay, that must be letter apple, administer diphenhydramine, PRN, medication administration record. Okay, obviously, ang nangyayari sa kanya, according to the group of symptoms, meron po siyang dystonia, right? So 26, that's letter apple. Okay, 26 letter apple. Apart from this, diphenhydramine, pwede rin tayong magpabigay ng anticholinergic drugs such as your benztropine. Okay, Cogentin yung brand name yon. Okay, so 26, that's letter apple. Meron nagko-contest na sexual activities daw would decrease the IOP patterns. Okay, okay lang bang i-park natin yung question na yon? I-erase ko lang siya sa research team tapos babalikan ko kayo. Okay? So, ang suggested answer niyo would be letter dog ba? Okay, sige. If ever na natapos yung ratio tas wala pa silang sagot, ipadaan ko na lang kay ma'am o kaya kay sir. Okay? So, rest assured makukuha niya yung final answer for that. Okay, so, number 26, that's apple. Number 26, apple. 27. In the meantime, move on tayo. 27, Ivan is receiving antipsychotic risperidone. He reports severe muscle stiffness at 10:30, and by noon, he is diaphoretic, drooling, and has difficulty swallowing. By 4 p.m., vital signs are body temperature 39, pulse 110, respirations 26, and BP 150/90. Obviously, sobrang deranged nung BP niya. Okay, pati no vital signs in general. So that's letter dog. Neuroleptic malignant syndrome. Immediately notify the healthcare provider. Okay, so 27, that's letter dog. 27, that's letter dog. Again, number 27, that's letter dog. Kasi meron na siyang high fever, pati autonomic instability symptoms such as your unstable blood pressure. Okay, may pallor na rin siya, diaphoresis. Okay, so i-highlight ko lang din. So mas letter dog tayo kesa letter boy. Okay, so 27, that's dog. 27 letter dog. Number 28, which nursing diagnosis is of the highest priority when caring for a client with myasthenia gravis? That's letter dog. Ineffective airway clearance related to muscle weakness. Needless to say. Okay, airway priority. 28 letter dog. Okay. Actually, more on breathing issue nga ito eh. So 28, that's letter dog. 28, that's dog. Number 29, Helen is diagnosed with myasthenia gravis and pyridostigmine therapy is started. The Mestinon dosage is frequently changed during the first week. While the dosage is being adjusted, the nurse's intervention is to letter C, evaluate the client's muscle strength an hour after medication. Because whether or not ang na-experience ni client is cholinergic crisis or myasthenic crisis, laging may issue sa muscle strength niya dyan. So 29, letter C. Okay, so frequent assessment tayo sa area na yan. 29, that's letter cat. Again, number 29, that's cat. One more, 29 cat. Number 30, JM and JL are best friends. Ito na po yung MMK story natin. Okay, their friendship dates back to elementary school days. While JM was bullied, JL is always ready to defend him. Okay, sana all. Okay, even in periodic tests, JL will make a cheat sheet for both of them to help GM get a passing rate. When the parents of GM separated, JL was there to support him. But things changed when JL had a romantic affair with Ellen. JM felt his best friend left him. Oh, ang sakit. Okay, friendship breakups, one of the worst things to happen. GM felt alone, but not for long, for he found what he considered to be his new best friend. Si Shabu daw. Apparently, nag-addict tuloy si pasyente. Number 30, aside from Shabu, GM also drank alcohol. And since GM was admitted at 2 o'clock today, okay, nurse Jessie would expect alcohol withdrawal symptoms to begin at what time? That's letter apple, between 8 and 10 today. Okay? 6 to 8 hours after the drinking stop. According kay Master Videbeck, yung symptoms daw ng alcohol withdrawal natin would usually begin, let's say, 4 to 12 hours after. Okay, the client stops drinking. Sa kanya pasok yung letter apple, right? So 30 apple. Yes, I am telling you, merong mga ganito kahabang tanong sa board exam. Tapos sobrang complex pa in a way that yung unang statement, yung unang kwento about OB. Okay, pero yung final question, magiging psych siya. Ganon ka-complex yung mga tanungan doon. But still, you have to be prepared. Whatever would come out sa board, at least na pagdaanan na natin sila. Okay, so 30, that's apple. 30, that's letter apple. Number 31, when working with JM who is beginning treatment for alcohol abuse, what is the most therapeutic approach? Siyempre, kitang-kita natin yung sagot. It's letter apple, empathetic and supportive. Okay, 31, letter apple, empathetic, supportive. Okay, number 32, which is an important nursing intervention when giving care to JM who is withdrawing from a central nervous system stimulant like amphetamine. That's letter dog, observed for depression and suicidal ideations. Okay, so 32, that's letter dog. When you have your central nervous system stimulant, syempre, ang expected reaction natin may stimulate o kaya may excite yung central nervous system natin. So, syempre, magiging sobrang high ni patient, hyperactive, hypervigilance. Pero once na tinanggal natin yung content na yun or yung substance na yun sa katawan ni patient, such as withdrawal, pace, syempre, kabaligtaran na yung mangyayari. Letter dog tayo. Okay, magka-crash na siya ngayon. Depressive symptoms na yan. 32, that's dog. 32, that's letter dog. One more. 32, that's dog. 33, JL impregnated Ellen. Ayun na nga ang kwento. Ayaw matapos. Ellen, during her pregnancy, drinks 8 to 12 ounces of alcohol daily. Wow. Sarap buhay ni mother. The nurse plans for the delivery of an infant who is, that's letter dog, microcephalic and cognitively impaired. Okay, sobrang kawawa ng babies natin who are suffering from these kinds of conditions. Okay, so number 33, that's dog. Number 33, that's letter dog. Anong basis ng sagot natin dito? The fetal alcohol syndrome. Okay, so kapag merong prenatal exposure to alcohol, which is what we know teratogenic, anong effect nun? Letter dog. Okay, that's letter dog. 33, that's letter dog. Again, 33, that's dog. Number 34, because of marital problems JL had with his partner Ellen, JL abused heroin. Lahat na sila nag-substance abuse galore na. Okay, which assessment findings will the nurse expect in an individual who has just injected heroin? That's letter dog, drowsiness, constricted pupils, and slurred speech. Okay, so ang heroin po natin na isang example ng opioids. Okay, so paka-review na lang po ng signs and symptoms natin with regards to opioid intoxication. So 34, that's letter dog. It has to be constricted pupils. Okay, kay Videbek tayo nag-base. 34, that's dog, true friendship. 34, that's letter dog. Number 35, client suffering from MS. 30-year-old female social worker has had a variety of vague complaints for the past 6 months. The physician suspects MS and plans to complete neurologic assessment. When testing the trigeminal nerve, the nurse should expect the physician to evaluate, that's letter dog, corneal sensation. Okay, I know medyo na-confused ata yung iba dito, pero isa-isahin natin please. Kapag trigeminal nerve, anong cranial number what yan? I-establish muna natin kung anong number sila. Okay, that's cranial number 5. Ang smiling and frowning, sino yan? That's number 7 for the facial nerve. Okay, sulat ko lang dito, facial nerve. Okay, ang letter boy, anong number naman po ito? Cranial nerve number 11 for your accessory nerve. Okay, accessory nerve. And itong letter apple, cranial nerve number 3, right? Oculomotor nerve. Oculomotor nerve. Bakit po letter dog yung sagot natin for the trigeminal nerve? Because as we know, both sensory pati motor yung affectation nito. Okay, yung sensory portion ng trigeminal nerve would be the literal sensory na pain, touch, temperature from the face, okay, to the brain. Okay, from the face to the brain. So, ang sensation yan sa face. Okay, pero yung motor effect ng trigeminal nerve would be sa mastication. Okay, mastication yan. Okay, aside from that, yung sensory, pati yung motor affectation ng trigeminal nerve, meron din kasi tayong tinatawag na corneal reflex. Okay, corneal reflex for the cranial nerve number 5. Ito yung anong tawag dun sa Tagalog? Kukuha ka ng portion, okay, ng cotton balls, tapos iikot-ikutin mo, okay? Gusto mong i-test yung cornea ni patient, okay? Ang normal response nun, dapat magbi-blink siya or dapat luluha-luha siya para masabi mong positive siya for corneal reflex. Okay? Bulak yun. Kukurot ka na maliit na bulak, tapos ito twist-twist mo, tapos yun yung i-touch mo sa cornea ni patient. That's still your cranial number 5. Okay? So 35, that's dog. Okay, so 35, that's letter dog. Doon siya galing. Yung corneal reflex. 35, that's letter dog. Again, number 35, that's letter dog. 36, the client is suspected of having MS. The nurse will expect her to complain about a common initial symptom associated with multiple sclerosis, that's letter dog, visual disturbances. Diba? Kapag nasa mundo tayo ng multiple sclerosis, laging mababanggit yung visual disturbances. For example, blurred vision, diplopia, decreased visual acuity, scotomas even, yung changes in your peripheral vision, kasama yan. Nystagmus even, kasama rin. Okay, so 36, that's dog. Okay, so 36, that's letter dog. 36 is dog. 37, the client has been admitted with relapsing remitting MS, which of the following should be the focus of nursing assessment and history. Okay, initial level of consciousness to begin with kasi ang main issue natin sa multiple sclerosis, especially kapag relapsing remitting, is that meron kang portions nung spine mo na affected. Now, kapag meron kang demyelination sa spinal cord na medyo nasa bowel and bladder, yung part niya, medyo lumbar affectation, magkakaroon ka ng bowel and bladder dysfunctions dyan. Kaya letter C yung sagot natin. 37, that's cat. Okay, 37, that's letter cat. 37, that's cat. 38, which intervention should the nurse suggest to help the client with MS to avoid episodes of urinary incontinence? Again, with your form concepts, urinary incontinence, that's letter dog, inhibits the activity of acetylcholine. Anong panlaban natin dito? Anticholinergic agents, right? So 38, that's dog. Kaya siya letter dog. Okay, so 38, that's letter dog. Again, number 38, that's dog. Number 39, clients suffering from osteoporosis. The most observable changes caused by osteoporosis will occur in letter C, the vertebral column. The BUN could ask so simple and as easy, okay, as this one. Okay, ito yung tipong kapag nagkamali ka pa, I mean, bakit? Ganon. Okay, so 39 letter C. Minsan mabait naman yung BUN. Pinamigay na sa'yo yung score. Okay, number 40, which of the following would the nurse recognize as the appropriate rationale for the administration of the drug? Levodopa to a client with Parkinson's disease, that's letter C, provides the precursor of dopamine. Okay, so 40, that's letter C. Yan talaga yung mechanism of action ng levodopa na drug natin. So 40, that's cat. 40, that's letter cat. Are we going too fast? Ito po yung 39, letter C. Okay. 40, that's cat. 41, client is being switched from levodopa to carbidopa-levodopa or Sinemet, which is the more recommended, right? The nurse should monitor for which of the following possible complications during medication changes and dosage adjustment. Ito na nga yun, di ba? Once you've been in a very long-term drug therapy, tapos nag-switch ka, ano yung mga possible na mangyari? Pwedeng drug tolerance o kaya naman drug toxicity. Okay, and a part of your drug toxicity symptoms could be evidenced by your delirium o kaya confusion, ano pa, any forms of cognitive impairment, di ba, hallucinations, kasama yan. Okay, Okay, so number 41, that's apple. Okay, number 41, that's letter apple. One more, number 41 is apple po. 41 apple. 42, a client with Parkinson's disease complains of choking when he swallows. Which intervention will improve the client's ability to swallow? Alright, kapag ganito yung tanungan sa boards, magkaisa lang tayo. Okay, kasi ang tinatanong sa atin is the ability to swallow. So, syempre, isipin natin risk for aspiration. Ano ba yung mga possible interventions for the risk for aspiration? I-modify natin yung diet ni patient. So basically, that's supposed to be semi-solid sana o kaya naman soft diet. Okay, ito yung priority nating isagot. Pero nabasa mo kasi yung choices, wala siya dyan. Okay, the next priority would be letter dog na. Your small frequent feedings na. Okay, so 42, that's dog. Okay, magkaiba kasi yung semi-solid sa semi-liquid. Kasi kapag sinabi mo semi-liquid, kasama rin din dyan yung mga maninipis na sabaw. Diba? Gusto natin as much as possible kapag may aspiration issues, dapat makapal yung soup, okay, tsaka cold soup, okay, not hot. So 42, letter dog. Okay, so number 42, that's letter dog. 42, that's dog. Number 43, the client has been admitted with relapsing. Uy, naulit. Tama ba? Or hindi pa? Naulit na. So 43, that's dog. 43, that's letter dog. Again, number 43, that's letter dog. Number 44, which intervention should the nurse suggest to help a client with MS? Avoid episodes of urinary incontinence. If you would notice, naulit po yung question. Right? Pero nag-iba kasi yung choices. So, iba na rin yung sagot natin. Okay? Gusto ko lang din pong i-reiterate na the way that we should choose for the best answer and the correct answer, i-depend po natin siya sa set of choices. Okay? Dito at dito lang tayo mamimili. Huwag mo nga hanapin yung mga wala naman sa choices. Okay? Laging ganon. Kapag pinapipili ka kung ano yung pinakatamang sagot, always choose among the choices. And in this case, nag-iba kasi siya. Okay? Ang ideal answer sana is to give your anticholinergic drugs. Pero since wala siya dyan, letter dog tayo, bladder training. Okay? For the incontinence issues, 44, that's dog. 44, that's letter dog. Again, sabi ko kanina, just because urinary incontinence yung problem ni patient doesn't necessarily mean na kailangan natin magpasok na indwelling urinary catheter. Hindi yun yung purpose niya eh. Okay? So 44, that's dog. More on bladder training tayo. 45, a client with Alzheimer's disease. What color should you repaint the hallway to provide safety? That's letter dog, red and yellow. McDonald's color, para mas ma-recognize niya to avoid further injuries. 45, that's letter dog. Again, number 45, that's letter dog. Number 46, Emilia is a 40-year-old client, comes to the clinic with superficial cuts on the left wrist. The patient paces around the room sobbing but cringes when approached and responds to questions with only shrugs or monosyllables. What is Lily's best initial statement? That's letter boy. I see you are feeling upset. I'm going to stay and talk with you to help you feel better. Okay, so nag-reflect si nurse and nag-offer siya ng self niya. So 46, that's boy. Sige lang, carry lang. Okay, so number 46, that's letter boy. 47, Emilia exclaimed, I'm in a terrible situation. I don't know what to do. The triage nurse can initially assume that the patient is letter boy, anxious and fearful. Okay, so 47, that's letter boy. Wala po masyadong cues para masabi natin na suicidal si patient. Okay, so 47, that's letter boy. Number 48, while Emilia was anxious, Ivy held her hand for 1 minute. Which type of touch is this one? So that's letter boy, friendship and warm touch. Okay, that's friendship, warm touch. Isa-isahin natin para mas masaya. So ito pong functional and professional touch. This is the touch that we do towards our patient. Let's say kapag nagkakaroon tayo or nag-perform tayo ng assessments. 'Di ba? Kunwari, mag-assess tayo ng skin trigger, o kaya naman we will do our abdominal assessment, o kaya naman we will provide our therapeutic massage. That's functional professional. Okay? Kapag naman social polite ang pinag-uusapan, ito naman yung mga pagbati natin, kunwari handshake, o kaya air kisses, o kaya naman the surf sign, mga ganyan. Yun yung mga social polite touches natin, yung mga signs or gestures. Okay? Kapag naman love or intimacy, okay? Yes, kahit nurse si Ivy. Okay, kahit nurse. Kapag kasi nagpo-perform ka ng friendship kind of touch, it doesn't automatically or necessarily mean, okay, na friends kayo. Okay, it's about the quality and the kind of touch. Yun yung focus natin. Okay, kapag love intimacy, of course, this would happen between your family members, the closest friends, your loved ones, ganyan. Okay, so 48 letter boy tayo. 48, that's letter boy. Again, number 48, that's letter boy po. Pag letter dog, ito yung mga professional assessments natin, like assessing for the skin trigger, for the abdominal assessments, or the therapeutic massage, ganyan. Professional touch yun. Okay, 49, when Emilia recovered, she realized that Nurse Ivy was the daughter of her enemy a few years ago. Kapag naman po, sorry, last na, kapag love or intimacy, syempre, yung mga pinagagagawa nyo with your jowa, with your parents, with your closest friends, ganun yan. Okay? Yun yung love intimacy. Here naman, and to stop invading her personal space in proxemics, which one is incorrect? Again, taking note of the word incorrect. So yung mali yung hahanapin natin. That's negative sign. That's letter C. Personal space is 6 to 8 feet. Masyadong malayo yung 6 to 8 feet as your personal space. Dapat sana ito ay 1.5 to 3 feet lang. Okay? Para masabi mong personal space siya. Okay? Ang public space, tama po ito, 12 feet and beyond. Pwedeng 12 to 25 feet, okay, in some references. Kapag social zone naman, tama rin naman na 4 to 12 feet. Kapag intimate space, tama rin naman to, 1.5 and less. Okay, so 49, that's cat. 49, that's letter cat. Number 50, when Emilia was discharged, she began to take CNS depressant to cope with problems. The following are CNS depressants except letter dog, LSD. Okay, hindi siya CNS depressant. Ito po ay hallucinogen. Very, very good. So number 50, that's letter dog. Okay, 50, that's letter dog. Gusto niyo ba na 3 minutes break? Sobrang mabilis na bladder break lang for you. Okay, 3 minutes break lang. Tapos tuloy-tuloy na natin. Okay, thank you. Alright, so we're back. Tuloy na natin, guys. May class pa ba kayo after this one? At least nakakapagpahinga kayo after. Alright, so we're still with NP5. Let's now continue. Number 51. The nurse wishes to teach Nina alternative coping strategies. The nurse will first need to. Diba? Ano ba nangyari? Yan talaga eh, kapag ini-skip yung situation, kapag na-excite, diba, nagkakamali, so sayang yung oras. So Nina, a 34-year-old female client assisted by her boyfriend James in admitted in the emergency room. She was hyperventilating, her palms placed over her chest while experiencing head tremors. Furthermore, she is having diaphoresis. All right, she was unable to explain herself clearly. So that's letter C. Lower the patient's current anxiety level. Okay, obviously, with the set of symptoms na binigay sa atin, si Nina po ay merong severe anxiety, and isa sa mga management natin for patients with severe anxiety, ang goal is to lower the anxiety level. Okay, so 51, that's cat. 61, that's letter cat. Again, number 61, that's cat. Number 52, as Nina's anxiety went down, she verbalized, I feel undone. An appropriate response for the nurse would be, letter boy, what would you like me to do to help you? Okay, 52, that's letter boy, offering the self. Ganyan din yung sinasabi namin sa inyo. Kapag nag-express kayo na, ma'am, feeling ko kulang pa po, yung natututunan namin or yung nababasa ko. What would you like me to do to help you? Gusto niyo bang suklayan ko kayo? Okay? Or subuan habang kumakain para makakapag-focus kayo habang nagbabasa, mga ganong levels. Okay? Na offering self. 52, that's letter boy. Okay? So 52, that's letter boy. Okay. Itong letter C kasi, hindi natin siya pinili because it is expressed in a negative manner. I'm not sure I understand. Diba? So, hindi ko pipiliin yung mga negative statements natin. Okay, so letter boy tayo. Okay. 52, that's letter boy, offering the self. Gets natin. Number 53, the next day, the nurse saw Nina. With a high level of motor activity, she runs from chair to chair and cries, they're coming, they're coming. Nina does not follow instructions or respond to verbal interventions from the start. The initial nursing intervention of highest priority, that's letter apple, provide for patient safety. Okay, safety talaga ang primary concern sa mga delusional patients natin. 53, that's apple. Okay, number 53, that's letter apple. Okay. Tas in addition to this one, the patient is also experiencing panic level na no anxiety. And ganun pa rin naman yung ratio kapag panic level, ang concern natin is safety. 53, that's apple. Number 54, Nina experiences a episode of severe anxiety of these medications in the patient's medical record, which is most appropriate to administer as needed PRN anxiolytic medication. Syempre, that's letter boy, lorazepam. Okay, ito talaga yung pinaka-common na ginagamit. Takbuhan ba? Drug of choice. Benzodiazepines. 54, that's boy. 54, that's letter boy. One more. 54, that's letter boy. Ay, sige, pwedeng pa-share sa akin yung nakita mo kay Udan. 54, that's boy. Number 55, when Nina was discharged, she has been unable to leave her home that week because of severe anxiety. Pwedeng pa-summarize nung nakasulat. Okay, hindi ko siya kasi mapabasa. I know it does not make sense, but I just can't bring myself to leave my apartment alone. Which nursing intervention is appropriate? That's letter apple. Teach the person to use positive self-talk. Okay, ang nangyayari po kay patient, because of his or her severe anxiety, nagkaroon siya tuloy na agoraphobia. Diba? Ayaw niya nang lumabas sa public spaces. And with that, we would just want to encourage the positive reframing of the thoughts. Okay, isi-shift mo lang kung paano siya mag-iisip. That's letter apple. Okay, so 55 apple. Teach the person to use positive self-talk. Okay. 55, that's letter apple. Pwede po bang pa-summarize ng picture na sinend mo? Kasi Nakaganon siya, hindi ko rin siya mabasa. So 55, that's Apple. Number 56, a computer analyst, Mr. Rick J. Santos, 825, was brought to the hospital for diagnostic workup after he had experienced seizure in his office. Number 56, just as the nurse was entering the room, the patient who was sitting on his chair begins to have seizure. Which of the following must the nurse do first? Okay, that's letter Apple, is the patient to the floor for safety. Okay, so 56, that's Apple. Okay, so 56, that's letter Apple. Pwedeng pasabi ulit kung ano yung other choices. Okay, pa-type na lang ulit sa chat box. Okay, 57, apart from this one, sa nabanggit mo. Okay, thank you. Mr. Cruz is scheduled for CT scan for the next day, noontime. Which of the following is the correct preparation by the nurse? CT scan, guys, we know this. There's no special preparation talaga. Okay, kailangan niya lang na head still instead. So 57, that's boy. Wag lang malikot. Okay. 57, that's letter boy. Hindi kasi outright sinabi na gagamit tayo ng contrast dye. So, dapat merong explicit statement para masabi natin na may dye na binanggit. So, overthinking ulit yung nangyari sa'yo. Overthinking situation yan. Okay, so number 57, that's boy. Number 57, that's letter boy. Okay, number 58, Mr. Cruz is placed on seizure precaution. Which of the following would be contraindicated? That's letter Apple, obtain his oral temperature. Alright, so yung iba sa atin, okay, baka ang sinagot is letter dog, encourage him to be out of bed. Okay. As compare mo sa letter Apple, obtain his oral temperature, di ba? We do not want to put anything in the patient's mouth, especially hindi natin mapipredict kung kailan siya mag-seizure, lalo na kapag tonic-clonic seizure yan. So baka lang din ma-break yung temperature sa loob or yung thermometer sa loob ng bunganga ni patient. Okay? Ito pong 58 letter dog, encourage him to be out of bed. Ang point nito is, it is not necessary naman no complete bed rest ng isang pasyente. In fact, okay, based on what I read about kanino ko ba ito nakuha? Kay Brunner and Sudart ata. Okay, sabi niya, kapag daw maglalakad si patient, kailangan with assistance pa nga, okay, and with support. Okay, so not necessarily na naka-complete bed rest si patient. So letter Apple pa rin yung best answer natin. Okay. 58, that's letter Apple. Obtain his oral temperature. Mas okay kung tympanic thermometer yung gagamitin kesa oral temp, right? So number 58, that's dog. Okay, number 58, that's letter dog. Encourage to perform his own personal hygiene. Okay lang din naman yan. Kaya ang hinahanap kasi natin is yung mali, right? Yung contraindicated. Okay, so 58, that's letter A. Overthinking yan. Overthinking yan. Okay, personal hygiene in general. Okay, so 58, that's Apple. Number 59, usually, how does the patient behave after his seizure has subsided? That's letter C, sleeps for a period of time. So pansin nyo guys, pag sinasabihan ko kayo, kasi yung iba dito nagsasabi na, paano po kung ganito, kung ganyan? Okay, tapos sinasabi ko na lang na overthinking na yan, masyado ka nang malayo. So at least meron ka na ring appropriate self-awareness kung hanggang saan ka lang ba dapat mag-iisip. Kasi once you think beyond na the concept and the given question, dun na mas namamali. Okay, dun na mas nagiging distorted yung analysis natin. Okay, so just attack the question as is. Wag na tayo magdadagdag ng mga bagay no hindi naman natin nabasa outright. Okay, so here number 59, letter C, sleeps for a period of time. If you would, or kung naka-handle na kayo ng actual patient who had a seizure, usually, di ba, they would have fatigue, lethargy, confusion even. Okay, pwede din silang makatulog after. So 59, that's letter cat. 59, that's letter cat. Again, number 59, that's letter cat. Number 60, before, during, and after seizure, the nurse knows that the patient is always placed in what position? Okay, that's letter boy, side-lying position. Okay, side-lying position. just to prevent the aspiration risks and to allow the secretions to drain. Okay, 60, that's boy. Number 61, which among the following is a characteristic of evidence-based nursing care? That's letter dog, nursing care based on integration of research. I-describe mo lang, ano ba ibig sabihin ng evidence-based practice? Galing sa research. Okay, so 61, that's dog. Again, number 61, that's letter dog. 61, that's letter dog. Number 62, which among the following is a characteristic of qualitative research design? That's letter C, data gathered or based on narrative descriptions. Because the rest of the choices, ano na to, quantitative na yan. Okay, quanti na yan. Balikan lang natin mabilis. Okay, yung sa positioning. Okay. Ano suggested answer niyo here if it's not letter boy? Letter C, supine. Mas appropriate isagot yung letter boy, side lying. Okay. Some references magkakaiba. Wait lang, sorry. Ayun, side lying talaga siya. Na-clarify na rin daw po ni Sir Raymond. Sabi din ni Sir Ken, pare-parehas kami ng mga sagot. Okay, tama rin naman ako. So, 60 number letter boy. Okay, side lying tayo dyan. Alright? Sir Archie, Sir Ken, Sir Raymond, dagdag nyo na ako guys. Letter boy, side lying po tayo. Okay, gusto ko yung source mo TikTok. Nakakaloka. Sana ikapapasa mo yung TikTok reference mo. Research study. Ma'am Odan is shaking. Okay, is entitled Investigation on the Effects of Osteoporosis in the Incidence of Bone Fractures Among Elderly Patients. The independent variable is letter C, osteoporosis. Okay, 63, that's letter cat. 63, that's letter cat. Of course, kapag ito na yung independent variable mo, ang dependent variable mo would be the incidence of bone fractures. 63 cat, 64, the study is conducted on the effectiveness of ROM exercises aimed at improving joint flexibility, activity function, and pain among stroke survivors. Okay, some patients receive a 4-week exercise program, whereas others did not. Groupings were assigned randomly. What type of research design is involved? This is the very, very perfect example of your letter dog experimental research because outright binanggit sa'yo yung manipulation, which is your ROM exercises. Meron ka rin pong control group dito for basis of comparison. At the same time, sinabi niya po na randomly assigned yung groupings mo. So it satisfies the 3 elements or criteria. Therefore, that's letter dog. 64, that's dog. Okay, number 64, that's letter dog. Again, number 64, that's dog. 65, in the question above, what variable is being controlled or manipulated? That's letter apple. Exercise intervention. Okay, exercise intervention. Number 66. Pia is a 32-year-old, a clinical instructor discussing topics in psychiatric nursing in her assigned group. A patient says, "Please don't share information about me with other people." How should the nurse respond? That's letter apple. I won't share information with others without your permission, but I will share information about you with other staff members involved in your care. Okay, so number 66, that's letter apple. Ma'am, sorry na tabunan. Yung concern mo po about kay Ma'am Udan, anong number nga po ulit yon? I-address natin. Okay, so number 66, that's letter apple. Yung nag-send nung reference kay Ma'am. Okay, so number 66, that's apple. Number 67, which issues should a nurse address during the first interview with a patient diagnosed with psychiatric disorder? Okay, first interview, guys. First meeting lang natin kay patient nito. Siyempre, meron tayong iba't ibang phases nung patient-nurse contact relationship natin. The very first one is what you call your orientation phase. Okay, and dito po papasok yung letter C, relationship parameters, contract, confidentiality, and termination. Okay, so number 67, that's letter cat. The rest of the choices, that's under your working phase na. Okay, so 67, that's cat. 67, that's letter cat. Okay. Number 67, that's cat. Number 68, alprazolam or Xanax is prescribed for a patient experiencing acute anxiety. Health teaching should include, that's letter C, avoid alcohol beverages. Bakit? Anong problema? Kapag alprazolam po kasi, that is an example of your benzodiazepine, mas mapapataas niyo yung effect ng alcohol. So 68, that's cat. Okay, number 68, that's letter cat. One more. Number 68 po, that's cat. Number 69. Okay. For patient experiencing panic, which nursing intervention should be implemented first? Provide calm, brief, directive communication. Number 69, that's boy. Wait nga lang. I-address ko na nga yung concern. Sorry Here, 69, that's letter boys. I hope we're clear so far. Okay, balikan lang natin na mabilis yung question number 42. Here. May nag-send kasi na reference according 41 rather. Daw kay Ma'am Udan, it can cause hypertension and postural changes. Okay? Postural hypotension pala rather. So it should be checked yung BP daw. Okay. So vital sign fluctuation, yung sagot daw kay Ma'am Udan. Okay. Okay. Sige, i-base na lang natin yung answer dito kay Ma'am Udan. Okay, so number 41, palitan natin to letter C. Okay, vital sign fluctuation. Okay, so number 41, that's letter C na po. Alright, so sana po na-catch nyo yun. Pinalitan na po natin 41, that's cat. Ang reference natin is kay Mother Udan. Sabi daw sa book niya, because kapag daw may switching na magaganap ng mga medications, it causes you to have either hypertension o kaya naman postural hypotension. So either way, your BP should be checked daw. Okay, so 41, that's cat. Okay, this one, yung directive communication, anong number to para ma-address natin? So here, 41, that's cat. Again, number 41, that's letter cat. Number 68 naman. 68, ito yung 68, letter C. Alcohol beverages. 69. Okay. So, ang patient natin is experiencing panic level of anxiety. So, here, during panic, ang pinaka-goal natin is the safety. Okay? Sabi daw ni Mother Wiedebeck. Okay. Okay. The nurse should still continue and to maintain directive communication to the patient, even if the patient do not understand what you are saying. Okay, yun yung sinabi ni Wiedebeck. Makikita natin yun sa anxiety na chapter. So letter boy tayo. Okay, 69 letter boy. Tama naman, calm, brief. Okay, for the safety aspect, pati directive communication. Okay, I think ang purpose nun is for that, so the patient could know that the nurse is still beside him or her. Parang ganon. Okay, so 69, that's letter boy. Okay, implement first. Yes, correct. Safety priority concern, boy pa rin. Okay, so 69, that's letter boy. Again, number 69, that's letter boy. Number 70, which finding indicates that a patient with moderate to severe anxiety has successfully lowered the anxiety level to mild. The patient, letter C, can concentrate on what the nurse is saying. Ayan. Thank you sa confirmation. 70, that's letter C. Siyempre, kapag mild level of anxiety, okay na. Di ba? Nag-gets na ni patient kung ano yung mga sinasabi natin sa kanya. 70, that's cat. 70, cat. Okay. 71, nurse evaluates which of the following assessment findings to be normal in an older adult client. Older adult client. Experiencing normal physiologic changes. Letter C, presbyopia. Okay, so 71, that's your age-related farsightedness, right? 71, that's cat. 71 cat. Number 72, the nurse would take which of the following as the priority action for the client with penetrating eye injury from a visible foreign body. Okay, may natusok daw sa mata niya. Yun yung pinaka-issue. That's why letter boy yung sagot natin. Immobilize the foreign body and cover the eye. Okay. Itong letter C, irrigate the eye with copious amounts of water. Ito nagtama siya, pero kasi mas tama itong isagot kapag ang focus ng question is about the chemical splashes. Okay, penetrating yung injury, letter boy. 72, that's boy. Okay, number 72, that's letter boy. Okay, only the injured eye lang yung kailangang i-cover. Not necessarily yung both eyes ay i-cover. Okay, 72, that's boy. Number 73, which of the following clinical manifestations would the nurse expect to find in a client with meningitis? Select all that apply. Again, please, patience is the key kapag SATA questions. Headache, yes, alam natin to. Okay, dysphagia, not really. Okay, so X ka dyan. Nuchal rigidity, yes, or the stiff neck. Okay, number 4, fever, yes, kasi nga meningitis, may inflammation. Dysarthria, mali ka rin dyan. Okay, and vomiting could be rin. Okay, so again, kung ano lang yung highlight, yun yung tamang sagot. That's 1, 3, 4, and 6. Letter apple. 1, 3, 4, 6. Okay, number 73, that's apple. 73A, 74, client's family asked the nurse what meningitis is. The nurse's response should be based on an understanding that meningitis is letter boy, walang kahirap-hirap. Okay, cerebrospinal infection. Okay, 74, letter boy. Pinamigay na sa'yo yung 1 point. Okay, so hindi ka 0/500 doon. Okay, number 75, to reduce the risks for meningitis, the nurse's best instruction to an older adult client is to which of the following, that's letter boy, get your vaccinations. Okay, 75, boy. Okay, number 75, that's letter boy. Okay, but your BP is a part of your vital sign. So, pwede natin siya i-consider. A vital sign fluctuation, more specifically your BP. Okay, so number 75, that's boy. Number 76, client at routine blood glucose screening for DM tells a nurse she has excessive urination and excessive thirst. The nurse should ask about which of the following symptoms first. That's letter dog, excessive hunger. Diba? Kukumpletuhin na lang natin yung 3 P's ng hyperglycemia symptoms natin. You already have your polyuria over here. Okay, meron ka rin pong polyuria. Okay, excessive thirst is your polydipsia. So, isulat natin dito. Ano yung nawawalang kapatid? Polyphagia. Hanapin mo sa choice, letter dog. Okay, that's letter dog. Polyphagia. Ganon. 76, that's letter dog. Okay, number 76, that's dog. Again, number 76, that's letter dog. Number 77, which of the following factors places a client's risks at greatest risk? Kaya ko pa ba? For developing DM or diabetes mellitus. Number 77, that's apple, obesity naman. Okay. Okay. So 77, obesity. Pinili natin yung lifestyle risk factors. Greatest risk kasi, 77, apple. Okay, so number 77, that's letter apple. Number 78, which of the following fasting blood glucose levels is considered within normal limits? That's apple, 70 to 125 mg per dl. Okay, number 78, that's apple. 78, that's letter apple. Number 79, ADM client says she slipped on a throw rug while going to a bathroom at night. Which of the following factors needs assessment? So ito naman kasi, the way the question was asked, okay, gusto niya in general sense. So, dapat yung sagot din natin general din. So, here, gusto niya iparating sa'yo na dapat yung home environment ni DM patient ay safe. So, 79 apple. Okay. Number 79, let's letter apple. Especially, di ba, pwede siya magkaroon ng retinopathy, so visual changes. Pwede rin siya magkaroon ng neuropathy, so sensation changes yan. Okay, some of you answered letter C, if the client hit her head. Okay, mas tamang isagot yung apple. Okay, yung safety in general. Okay, 79, that's apple. Okay, 79, that's letter apple. Number 80, you have to be very well discerning about what is being asked of you. Kapag general yung question, dapat general din yung sagot natin. Kapag specific yung tinatanong, dapat specific din. Number 80, client with DM also takes 8 ounces of magnesium sulfate solution. The calibrations of the measuring device are in milliliters. How many should the nurse give? Diba may computation, hindi ako ready. Okay, so 8 ounces, i-convert natin to ml. And alam natin that 1 ounce is equal to 30 ml. So that's 1 ounce, 30 ml. Okay, buti na lang madali. Okay, so that's 8 times 30, that's 240 ml. Okay, so number 80, that's letter C. Number 80, that's letter C. Gusto ko yun, yung bote daw ng soft drinks, yung pinagbasihan niya. 80, that's cat. Marami kayo, hindi kayo nag-iisa. Okay, number 80, that's letter cat. Again, 80, that's cat. Ayan. Number 81, the nurse correctly explains to a client's family that the reason a stroke on the right side of the brain results on paralysis on the left side is because the pyramidal pathways cross over the end of which of the following. So, contralateral kasi, right? That's letter apple, medulla. Very, very objective type question. 81, that's apple. Again, number 81, it's letter apple po. Number 82, the nurse is admitting a client diagnosed to have cerebrovascular accident involving left brain damage. Okay, the nurse evaluates which of the following to be clinical manifestations of a CVA involving left brain damage. Select all that apply. Okay. Number 1, paralyzed right side. I-highlight ko to na left brain daw po yung affected. So number 82, number 1, yes kasama to kasi nga naman contralateral yung paralysis na may experience ni patient. Number 2, aphasia. Okay, common din po ito sa left-sided stroke because of the possible damage saan? Sa Wernicke's area, sa Broca's area. Okay, so possibly magkakaroon siya na aphasia. Okay, number 3, left-sided neglect. Medyo baligtad, right? Hindi yan yung sagot. Number 4, paralyzed left side. Hindi rin siya yung sagot. Depression. Okay, sorry. Okay, depression, yes, kasama ito sa mga patients natin with left brain damage. And number 6, denial of deficits. Mas okay ito kapag right-sided ang issue. Okay, so 82, that's 1, 2, and 5. That's letter apple. 82, that's 1, 2, and 5, letter apple. Uy, thank you naman sa nag-send ng reference natin. Okay. Legit bang in-story pa to ni Sir Raymond? Naka-story ba to? But either way, sabi daw ni Sir Raymond, i-bonus daw natin yung IOP question kasi meron siyang reference dito. Lahat yan ay kabilang sa pag-i-increase na IOP. Okay, so anong question nga ulit yon? Balikan natin. Pwede po bang pa-share to everyone yung story ni Sir Raymond kung totoong in-story niya to? Final answer na din daw po yon yung bonus aspect. Okay, anong number yon guys? Balikan natin mamaya. 74. 20. Here, number 20. Para lang wala na tayong backlog. Wala na akong backlog sa inyo. Okay, so here, number 20, lahat daw po ay nakakapag-increase na IOP. And negative sign yung hinahanap natin. So, i-finalize na natin, bonus daw po siya. Okay, so number 20, that's letter C, bonus. Okay, so okay na tayo guys. Wala na tayong backlog. Carry na, no? Wala na tayong naiwan. 20, that's bonus. Okay, 20, that's letter bonus. Yee, ka-DM. Sana all. Ka-DM si Sir Raymond. Okay, so balikan na po natin yung question. Issue ka, di ba may jowa si Sir? Ayan. Anong number na ba tayo? Here. 83. Okay, number 83. Uy, konting-konti na lang, promise. Okay, client with a brain attack is comatose on admission. Which clinical indicator is the nurse most likely to identify that's letter dog on responsiveness to pain? Okay, so number 83, that's letter dog. Because ang word natin dito is the word comatose. Okay, and alam natin na ano GCS scoring na isang comatose patient, that's 3, right? Unresponsive in all areas. So 83, that's dog. Okay, 83, that's letter dog. 83, dog. 84, when a client experiences a brain attack, in which position should the nurse initially place the client? It's letter C, lateral position. Okay, so 84, it's letter C. To prevent your aspiration, of course. Okay, so 84, that's cat. 84, that's letter cat. Number 85. Uy, issue na naman tong situation. May drama. Ito yung gusto natin, yung na-entertain tayo habang sumasagot ng board questions. Okay? They got married. The couple had a grand wedding celebration. It was a dream come true and they had 3 children. But one day, Song Joong-ki met Song Landi. Okay? And they had an affair, but not for long. For Song Hye-kyo soon discovered about them through her friend. Okay, because of this, Song Hye-kyo become severely depressed, particularly when Song Joong-ki choose to live with Song Landi. Ibang klase yung issue, di ba? 85. Alam mo yung wala kang kamalay-malay magsagot ng questions, tapos may mababasa kang ganyan. 85. Inside court, entertain ka patuloy. Song Hye-kyo repeatedly says, "No one cares about me. I'm not worth anything." Which response by the nurse will be the most helpful? That's letter boy. The staff here cares about you and we will try to help you get better. Okay, so here, nagpo-provide tayo ng reassurance but in a more therapeutic manner, right? So 85, that's boy. 85, that's letter boy. Itong letter dog, napaka-ano naman nito, napaka-rigid naman, tinatimingan niya si patient. So, kapag nag-offer ka ng self mo, you should be available anytime na kailangan ka ni patient. So, 85, that's boy. 86, on the second day of her confinement, Song Hye-kyo has been self-neglectful, self-poorly, lost faith and repeatedly says, "No one cares about me anymore." The patient will letter Apple verbalize realistic positive characteristics about self by date. Okay? Yan po yung initial goal natin. 86, that's Apple. So with that, kapag napapractice niya na yung positive characteristics na verbalization, mag-i-improve din eventually yung self-concept niya. 86, that's Apple. 86, Apple. 87, a nurse wants to reinforce positive self-esteem. For Song Hye-kyo, diagnosed with MDD. Today, she's wearing a new shirt and has neat, clean hair. Which remark is the most appropriate? That's letter boy. You are wearing a new shirt. Ganun lang. It's a very, very matter-of-fact manner. Well, you acknowledge the patient's positive behavior. Kasi itong letter apple, cat, and dog, medyo nag-agree ka kasi dito eh. Meron kang opinion na binabanggit and hindi siya therapeutic. So 87, that's boy. Okay, number 87, that's letter boy. One more, 87, that's boy. 88, soon. She says to the nurse, "My life does not have any happiness in it anymore. I once enjoyed holidays, but now they're just another day." What would the nurse document the complaint? Letter boy, anhedonia. Is 88, letter boy. Again, the BUN could ask simple questions as this one, definition of terms. And when you see anhedonia, that is the loss of your pleasure. Okay, anergia. Tama ba yung pronunciation ko? Or anergia? Lack or loss of energy. Yan. Euphoria, of course, that's the heightened sense of happiness. Ganun. Vegetative symptoms. So, syempre si patient ay decrease na yung activity niyan. Okay, increase na yung sleeping habits niyan. Okay, so 88, letter boy tayo. Okay, so number 88, that's letter boy. Again, number 88, that's letter boy. 89, a patient diagnosed with MDD is receiving imipramine every night, and which assessment finding would prompt the nurse to collaborate with healthcare provider regarding potentially hazardous anticholinergic side effect of this drug. Okay? Uunahan ko na kayo guys. Yung letter apple na dry mouth, okay, effect din yan ng drug as much as your letter dog, urinary retention. Pero kasi ang tinatanong sa atin is potentially hazardous. So in comparison to your dry mouth, mas hazardous po yung urinary retention kasi. Okay, so 89, that's dog. Itong other options, baligtad. It's supposed to be tachycardia. Ang nasal congestion dapat dry yung nasal passages niyan. Okay, so number 89, that's dog. This one is 88. Okay. 88, that's letter boy. 89, that's dog. Number 90, clients with orthopedic disorders. The nurse evaluates that a client understands the discharge instructions after a total hip replacement when the client states, I should avoid a total hip replacement sitting in a low chair. 90, letter C. Because iniiwasan natin yung please avoid, okay, hip flexion. Okay, yung bending, okay, ng hips bawal, that's less than 90 degrees angle. Ano pa? Hip adduction. Para hindi mo ma-dislocate, okay, yung bagong opera na hips ni mother. Okay, so number 90, that's cat. Carry, number 90, letter cat. Number 90, that's cat. Okay, 91, the nurse is evaluating the following for clients for the development of pressure ulcer. Which of the following clients is at greatest risk for development of pressure ulcer? Pwede nilang isata question to actually. Okay, number 91, letter apple, that's 52-year-old obese female, 2 days post-op for knee replacement who has an indwelling urinary catheter. Okay, so 91, that's apple. Okay, number 91, that's letter apple. Again, 91, that's apple. Number 92, which of the following dietary guidelines should the nurse provide to a client with fracture? Syempre, guys, okay, yung patients with fracture, they have to recover very well. At paano sila makaka-recover? Kailangan natin silang pakainin ng maraming proteins and carbohydrates and even calcium content, okay, that is necessary for the bone and tissue healing. So 92, that's apple. Okay, number 92, that's letter apple. Number 92, that's apple. Number 93, the nurse is giving a discharge instruction to a client with crutches, which is incorrect statement made by the nurse. That's letter dog. Place the crutches 6 to 10 inches diagonally in front of the foot. Okay, i-highlight ko lang po ha. Incorrect statement yung hinahanap natin, yung mali. Okay, so lagay tayo dito ng negative sign. Letter apple, your elbows should be slightly flexed when walking. This one is true, right? In fact, binigyan tayo ng angle niya that should be 15 to 30 degrees. Okay? Etong letter boy, never rest the axilla in the axilla bars. Syempre, it could lead to nerve damage, right? Etong letter C, tama yan, never rest, tama rin yan. Watch your crutches carefully when walking. Okay, of course, to prevent the risk for fall and injury. Okay. Letter dog, place the crutches 6 to 10 inches diagonally in front of the foot. Okay. Ang recommended na binigay sa ating space would be at 46 inches. Isa kanya kasi 6 to 10. Okay, so number 93, that's letter dog. Ano yung other options na kasama no letter dog? Same options ba? Yes, sa dog. Kaya siya tama. Tapos tama pa rin siya. Ano yung recommended answer mo? 493. Okay, so this one is the negative sign we're looking for. So 93, that's dog. 93, that's letter dog. Balik lang po, 91. 67-year-old obese male who has a cellulitis of his right lower leg. Okay. Pwede, kasi obese, tapos may cellulitis. Okay. Actually, itong letter C, pwede nga rin yan eh. Diba? With hyperglycemic, tapos sitting in a wheelchair. Pero kasi, syempre, just because hindi natin pinili yung other options, doesn't mean it's entirely wrong. Okay? Meron lang mas tamang sagot, mas priority answer. 91 letter apple. Mas hagip kasi nung letter apple yung mga risk factors for the development of your pressure ulcer. Okay? So number 91, that's apple. Okay, so 91, still letter apple. So here, 93, that's dog. Incorrect statement. Okay, wait lang po. Wait lang po ah. Okay, so number 93, that's dog. Yun nga eh, yun yung pinakita niya sa akin. Wait. So tama rin yung dog. Pag lumalapit ako guys, may binabasa ko. Yung mga sinisend yung binabasa ko. Si Saunders ba yun? Pero kasi, kung i-consider natin yung letter dog, all right. Yung kay Ma'am Udan naman is 6 inches. So tama pa rin yung letter dog. Right? Wait lang. I-clarify natin to ha. Can I see yung kay Ma'am Udan na reference? Para lang mas sure. Okay. Dapat look up. So all right. So ang tentative answer natin would be letter C. Dapat letter C. Right? So dapat kung susundin natin yung rationale, we have to look up, to be looking up, okay, to prevent more possible injury. Pero guys, okay lang bang i-park ko muna? Kasi gusto ko muna i-inform yung mga kataas-taas lang nila lang sa top rank bago ako mag-change ng answer. Okay? So here, ang tentative natin supposedly would be letter C sana because dapat looking up instead of watching the crutches for carefully. Look up and outward. Okay, that's very good reference. Okay, so ang tentative answer natin is letter C, pero ipapadaan ko po sa staff, okay, kapag kinonfirm na nila na final answer natin is letter C. Alright, tama yung letter dog eh. Sabi daw kay Saunders, tama daw siya. So i-consider natin yung reference ni Saunders. Okay, so this one, this should be look up and outward. Okay, thank you so much. Okay, so 93, tentative is letter C. Okay, 93, that's cat. Okay, ito kasing letter dog, word by word na nakita kay Saunders. Okay, so 94, that's boy. 95, a nurse is assisting 45-year-old client with left short leg cast on crutches who wants to go down to the cafeteria. The correct method to go down with crutches is, ito lang yung kailangan nating tandaan dito, that the good leg goes to heaven. Okay, the bad leg goes to hell. Ganun. Okay, and ang case natin, bababa daw siya with the crutches. So mauna muna yung affected leg. 95, that's cat. Ay, sorry, walang 94. 95, that's letter cat. Again, 95, that's cat. 94, the nurse plans to ambulate with the client during her morning care. When walking with the client with crutches, the nurse should be on. Ganon. Siyempre, kailangan na muna siyang supportahan na ni-assist. Saan ka daw po pwesto? Sa affected side ni patient. Okay, so 94, letter boy. To prevent any possible injury. Okay, 94, that's boy. 94, that's letter boy. 95, that's cat. 95 is cat. 96, which among the following basic qualifications is not required for Alvin to be admitted as clinical faculty at Xavier College of Nursing. Okay, taking note of the word not, i-highlight natin. Tapos, clinical faculty requirements. Lagay natin dito negative sign. Of course, ang reference natin would be the RA 9173. Okay? Or the new nursing law. Okay? So, 96, that's letter dog. Licensed IV therapy nurse. Okay? Hindi yan requirement. Ano lang ba yung requirement? Sana ay meron po siyang master's degree. Okay. Sana po ay member siya ng PNA or any other accredited organization. At sana po meron siya at least 1 year na clinical experience. Okay. Yes, kahit sa public health practice na master's degree, kino-consider nila yan. Okay, so 96, that's letter dog. Not necessarily letter dog. Okay, so 96, letter dog. One more, number 96, that's letter dog. Number 97, which among the following shows that Nurse Alvin is maintaining continual learning to maintain competence in letter apple, attending continuing professional education. Ito po yung CPD units. Okay, 97, that's apple. 97, that's letter apple. One more, number 97, that's apple. Number 98, one of the following choices are among the minimum required qualifications of a chief nurse at San Miguel Primary Hospital. Okay, that's letter dog, the GSC completion. Okay, pag sinabi mong GSC completion, ito po yung general staff course. General staff course. Okay. For the chief nurses, if you want to apply sa military hospital kasi ito. Okay. Ayan. So 98, that's letter dog. Carry lang. I-message niyo lang ako. Okay. So number 98, that's letter dog. 98, that's dog. Number 99, the present composition of the Board of Nursing, that's letter boy. 1 chairman, 6 members. Number 99, it's letter boy. Again, number 99, it's letter boy. 9173 ah. Wait lang, para mali yung kita ko dito. 73 yan. Okay. 99, that's boy. Number 100, the institution which has the right to close a nursing school who failed to comply with the minimum academic requirements, that's letter boy. Na ipasa po ang responsibilidad sa CHED, okay, with regards to authority of opening and closing the colleges of nursing. So 100, that's letter boy. Okay, 100, that's letter boy. Sabi daw ang requirement for the CPD units, that would be 15 units every 3 years. Okay, pero hindi ko lang sure. Okay, kailangan ko lang i-refresh kung may updated units na bang required. But anyway, 97 is apple. 98 dog, 99 boy, 100 letter boy. Any more questions? Okay. Or clarifications? Okay, 98, ulitin natin. Kasi kung babasahin natin yung requirements for the chief nurse na pag binasa mo yung law kasi, dinivide niya into 2. Yung requirements sa isang usual hospital, sa primary hospital, pati yung requirement para sa military hospitals. So kapag sa primary hospital, ito yung mga gusto nating makita. Syempre dapat RN ka, dapat meron kang at least 5 years experience. Okay, sa managerial position mo sa nursing, 5 years experience sa managerial position sa nursing. Sana ay meron ka ring master's degree. Okay, dapat meron ka ring, minimum required. Member of the professional organization, isulat natin. Member of professional organization. Yan yung mga requirements to qualify as a chief nurse sa primary hospital. Kapag naman po GSC completion, okay, applicable to sa military hospital. Okay. Kaya letter dog yung pinili natin. So, wala na po tayong backlog na natitira. Pero kapag meron akong nakitang additional na corrections, ipaparating ko po sa staff para make sure lang din natin na tama at uniform yung mga questions na binibigay po namin sa inyo. So let me stop sharing now, and I would like to say thank you very much for spending your Friday morning with me. Okay, babalikan ko lang, parang ilang beses ko na siyang naulit at nasabi at nabanggit, pero dahil malapit na po yung board exam, please do not forget to take care of yourself. It's very, very easy to neglect ourselves, especially kapag hyper-focus na tayo sa mga inaaral, binabasa natin. Pero please, kumain ng sapat, matulog ng sapat na oras kasi deserve niyo pa rin naman. Okay, so with that guys, to top the board exam po, pahinga na po tayong lahat. Kayo, pahinga na kayo. Okay, kailangan niyo yan. Thank you guys. Ingat po kayo. Thank you. Thank you so much. Thank you.